Welcome, everyone. Before we begin, I'm going to look to our board clerk to read our public participation procedures, and then we'll go into our oral communications.
You got it. In order to protect the health and safety of our Tuolumne County citizens, this board meeting is open to the public with modifications. Face coverings are required for all attendees regardless of vaccination status. During the board meeting, citizens physically present who wish to provide public comment will be invited to do so by the board chair. Citizens who are not present and wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Options for public access, audio and video live streaming. The public will not have access for public comments via these media options. They are available for audio and visual only. There are only two options. The first is Access Tuolumne County at www.accesstuolumne.org and click Watch Live, or on Comcast Cable 8. And Zoom webinar via your computer at https://zoom.us/j/98737385155, or you can call in at 1-669-900-9128 with webinar ID 98737385155. Please note, Zoom webinar services tends to have a reduced broadcasting delay in comparison with Access Tuolumne live stream, and is suggested for the closest to real-time viewing and listening. Granicus live streaming through the county website is currently unavailable pending a scheduled maintenance. Important public notice under the Governor's Executive Order N2520 and Order N2920. Members of the Board of Supervisors can participate by teleconference. Accessibility requirements: if you need swift special assistance during the board meeting, please call 209-533-6581.
All right, thank you very much for doing that. So what we'll do now is we'll go to our oral communications. Our board values public participation and encourages community members to take this time to provide comment on matters of county interest. This section is for comment not related to items on the listed agenda. The public time limit of 3 minutes per speaker applies, and no action may be taken by the board on topics discussed. Your board members are listening carefully to these comments and appreciate you taking the time to make a personal investment in our community. And so with that, if you have any items that are not on the agenda that you'd like to speak up, I'll invite you to come up and join us at the podium. Come on down.
First of all, not everybody's got masks on here, so I'm going to give you guys each a little gift. And what this is an antigen test. There's 2 in each box. You can take these home and use them as you wish, or give them to a loved one. But I think all of us have people that are at risk, and so when somebody's spewing and they don't have the courtesy to wear a mask, I get it. But we can still test ourselves easily. I'll be going to see my 76-year-old mother-in-law this weekend, and I'll take a test before I see her. I do it when I see an older lady on Fridays. I just don't want to kill grandma.
Could you come up to the microphone so other folks at home can hear you?
Sure. These are a couple of pictures of the hardening PG&E has done for us. These were
I'm real sorry. Folks at home are not going to be able to hear you unless you speak into the microphone.
You can hear me, okay? Okay, these are pictures of hardening of lines that PG&E did that didn't work. It lit the whole telephone pole on fire, and you can see a video of it. This relates to me because I was sued by PG&E for obstructing some of their so-called hardening in July, and they stuck their thumb down on my wife and I with a lawsuit in the middle of the night on a Sunday after we had just gotten back from Germany. I had 36 hours to prepare for a temporary restraining order that they were trying to put on me, and also the fact that they were coming after me for their legal costs, et cetera, et cetera. Why? Because I had obstructed their so-called hardening. when they wouldn't negotiate, I went ahead and took the holes that they put in front of my house, and I filled them in. I took the two boards over them, and on one, I said property of PG&E, and on the other one, I said 85 dead thanks to PG&E and Paradise. I got their attention. But they didn't negotiate. The way they negotiated was to serve me papers in the middle of the night. So 36 hours later, when they tried to get their temporary restraining order, the judge knocked it down. And I manned up with a lawyer. We hammered him. I won. And I now have composite poles at my house, 2 of them. I only asked for 1, but they put in 2. What I'm driving at here is that you guys have got to stop administrating and start advocating. And if you can start advocating and go to the California PUC and pound those guys, then we can get undergrounding that we need. The undergrounding is critical because the day after I won my lawsuit, that the new head of PG&E said that hardening doesn't work, and we're going to underground 10,000 miles of power. No, the first bit of time was giving you gifts, and those are freebies.
I'm sorry. You have 3 minutes to speak. And
okay, well, we'll do this some more next week then.
Please.
Thank you very much.
Thank you. I apologize. We have to be consistent.
You know, it's not a matter of apology. I'm trying to tell you something to get on it.
I understand. Good morning.
Hi, I'm John Kiter. I live up Curtis Creek area. Thank you for allowing the public the opportunity to speak. While I don't see such an action item on today's agenda, I came here to speak about mandated vaccination requirements for county employees.
So
I urge you.
Sir, I'm sorry, I'm going to have to ask you if you could hold your comments until the 9 a.m. appointment.
So are you voting on?
That is on the agenda.
And you're going to vote on a mandated vaccine?
Well, I can't tell you if we will or not. But that topic is on the agenda for discussion for 9 a.m. So if you can hold your comments until then, I'd be happy to hear what you have to say.
Okay, it's just not explicit on here. I can see that. I'll hold it.
Thank you.
Want it back?
Welcome. Good morning.
Good morning, guys. Jeff Musio with Hazy Bulldog Farms Dispensary. My wife, Courtney, who's a co-owner, and my daughter, Juliet. Thanks for the opportunity to come and speak. Always giving the public a chance to speak is huge, so thank you. Just wanted to once again lobby for cannabis in the county area. I think it could be desperately used right now. Our budget seems to be doing good in this county, but could always have some room for improvement. I would hope that if the cannabis were allowed to go commercially legal in our county, a minimum of 50 jobs would open up. I would keep it selective, not have a ton of farms and that kind of stuff. So erring on the smaller side, it could be 50 to 200 new jobs in the area. I think that'd be very big for everybody in the area, and I think the voters have been telling you this. You guys have put a couple measures for other taxes through, and all of them failed. The only one that did pass was the one, Measure M for cannabis, passed with 63% approval, and that was just to see if cannabis was in town, if they would tax it. And that's the only tax that I've seen approved for this county for a long time. So I think that's kind of telling a story that the people don't want to pay for any of the more taxes up front, but they realize there's a burden on the county, the police departments, the fire departments, and all that everybody needs a little more money. And I think cannabis would be a great way to shoulder a lot of that. It's definitely not going to save everything. I'm not pretending that's some giant industry that's about to save everything, but it could be a small part of the local economy and a lot more jobs. Thank you, guys.
Thank you, sir.
Have a great day.
You too.
I wasn't planning on saying anything, except for the first gentleman came up here, and it seems like it's entirely fair that if he hands something out, the clock doesn't start, you know? Can't you be reasonable on that? And regarding PG&E, everybody's aware of the governor of California. I consider him a criminal. And he had this famous lunch or dinner at the French Laundry in celebration of his lobbyist friend. Do you know who that friend was lobbying for amongst many others? He was lobbying for PG&E and the settlement that the fire victims of PG&E in Paradise, how they were going to be compensated by PG&E. and that lobbyist, a criminal also, in my mind, he convinced the governor to come up with a deal where the people that were victims of the fire became investors in PG&E. This is the truth. 1/4 of their settlement, 1/4 of it is PG&E stock, which has since declined a significant amount. So I'm just encouraging everyone here to get rid of this criminal governor we got. We've never had a worse one.
Thank you. Okay, is there anyone else from the room that would like to speak on any item not on the agenda? Good
I
morning.
just want to double check. I'm Mike Egner with Operating Engineers. Is there going to be the ability to have public comment before closed session?
Yes, so we do have an item on bargaining for closed session, and we'll have an opportunity then. Thank you. Okay, is there anyone on the phones that is called in that would like to speak on an item not on the agenda? Okay, shake of the head, no. All right, thank you very much, everyone. So we'll go on to staff reports. So come on down.
Good morning. Debbie
Morning.
Batista, County Register of Voters, County Clerk, County Auditor Controller, and Christina's mom. So we are just about a week away from the election. I'm happy to tell you that Tuolumne County is outpacing the rest of the state. As of this morning, we've had 16,200 of our voters have turned in their ballots, and 9 voters have voted in person over the weekend. So we're sitting at about 45%, and the rest of the state is a little under 30%. So Tuolumne, you voters are on ball, and you're doing your homework, and you're getting everything in. I want to report that right now we have 2 places that one can go to vote in person. Downstairs at my elections office, which has been opened ever since the beginning of the election, but also Tuolumne Memorial Hall will be opened today through Monday from 8:30 to 4:30 that one can go in and vote in person. All of the drop boxes are still 24/7. You can drop off your ballots there. Just continue to get your ballots in early. If this is a closer election, the more ballots we have in before 8 o'clock on Tuesday, the larger response we will be able to give to the state, and people won't be calling me, "Are you done yet? Are you done yet? Are you done yet?" Thank you.
Thank you.
Good morning, Supervisors. Dory Beats, your Office of Emergency Services Coordinator, just to provide a staff report on the Washington fire. The Washington fire that started on Thursday, August 26, is contained. The total acreage is 136 acres. The fire was managed in unified command between CAL FIRE TCU and the City of Sonora. And so the City of Sonora currently is managing their side, and Tuolumne County, CAL FIRE and TCU on the county side. And I know that Chief Andy Murphy is behind me, will probably provide a better staff report on that side. The Tuolumne County EOC was activated and staffed with county employees. We actually, funny story, had a training set for that particular day in the EOC, so we had folks already there, ready to go. So just like that, which was great. We kept the EOC activated at Stryker Court, starting on that Thursday through Sunday evening. That we now have moved the EOC to the CIO's office, and where it remains activated Monday through Friday, 8 to 5. The after-hour duty officer is yours truly, who answers those calls as needed. The purpose of the EOC during the event was obviously to provide support to first responders and coordinate with partner agencies as needed. The purpose of keeping the EOC activated is for continuity and coordination with the state, local agencies as we get through the recovery process. A shelter was created at the Tuolumne Memorial Hall during the event. This was manned by our local Red Cross volunteers and also assisted by Twain Harte area CERT volunteers. We are still waiting on a total number of folks assisted during the actual event at that facility. We did create a disaster assistance center on that Saturday, and several of our supervisors did peek in and help out with that, so thank you. That was open on Saturday, August 29th, and that was there to process those folks that either lost a home or structure as a result of the fire. At that particular time, we processed about 8 families that were provided resources and assistance, both from Red Cross and several of our county organizations. Huge shout out to our county staff for supporting us in the EOC as well as the Disaster Assistance Center during that time. Many of the displaced transient population also showed up. ATCA was there as well to assist and provide assistance as needed. And we have been working through the process identifying all of those affected within that area. As to a damage assessment, CAL FIRE performed a damage inspection report on August 28th. They initially identified 17 structures. Later on September 1st, the latest report assessment from CAL FIRE is 19 structures. The majority of those identified were located within Supervisor Brandon's district, and then a few non-residential within the city of Sonora, which is also Supervisor Goldenberg's district. The types of structures that were identified included 15 residential, 1 mixed residential commercial, 2 non-residential commercial, and another minor structure. County staff has also completed initial damage assessment and identified additional structures. Many structures that were identified as living spaces were not necessarily permitted or shown on our records. Quincy is also here to give a report, staff report, and she can add more to those. As you know, the Board of Supervisors approved ratifying the local emergency proclamation as well as ratified a local health order due to the Washington fire. Along with the City of Sonora's proclamation, we have submitted a request to the state requesting assistance. This request included 2 phases. Phase one is specific to household hazardous waste removal to be completed by the Department of Toxic Substance Control, or DTCS. And phase 2 then would be debris removal, including vegetation debris of those properties. Our request is currently being reviewed, and we are working with the state to enter in what they call initial damage estimates, or IDE. This process, of course, of approval is not guaranteed. It is simply a request. And in the proclamation, we've also asked for assistance under the California Disaster Assistance Act. We are working on a Plan B, and I'll let Quincy also speak to that. We would like to say for all of those that have impacted, we are truly, our hearts go out to you. We do continue to have our public information line open. That is open to the public Monday through Friday, 8 to 5. That number is 209-533-5151. We'll have somebody there to help answer questions or help you get to the right resources. We also have a dedicated Washington Fire button now on our county website. If you click on that, it'll direct you to our Washington Fire page where you can find additional information on safety precautions if you choose to go back to the area of the burn of the fire. Also some resources as well as donations, location, resources, links for folks. Lastly, I cannot stress the incredible cooperation and coordination that has occurred amongst all of our partners, our employees that stepped up, and the opportunity that we had to work together to make sure that we recover from this. A lot of thank yous. The list is way too long. I'll save that for another time. We will be doing an after action with our partners, and we will definitely apprise your board on any recommendations out of that. Thank you.
Thank you.
Dory, quick question. So Supervisor Brandon and myself were out on Saturday, and we spent some time going through the fire area. And I was there at the disaster assistance at Sonora Elementary the previous Saturday. But some of the people that we spoke with were still not completely clear. Is there point of contact if they're concerned about seeking relief still with the American Red Cross?
Yes, and they can contact our public information line. Also, our webpage will have that direct information, but we can hook them up with caseworkers who will intake if they have not already gone through the process.
Okay, very good. Thank you.
You're welcome.
And Quincy, before you get going, I just wanted to go over one thing real quick. We're really glad to be able to have board meetings that are open to the public and held in person. And in order to do that, we have to have some modifications to what typically goes on. We have a large number of people in a small room here. And so face coverings are required for all attendees, regardless of their vaccination status. So if you don't have a face covering, we do have them provided at the back of the room, and we're just asking everybody to follow those guidelines. So Thank you. Go ahead.
Thank you. Good morning, Quincy Yaley, Community Development Department Director. Supervisor Goldenberg, just to follow up, as staff is going through the burn area as well, and we see people who are going through their belongings, we're taking their phone numbers, and I call Dory, and Dory gets them in touch with people too. So as we talk to people out there who are still not either connected with the Red Cross or have unmet needs, staff is working to take care of that as best we can. I'm just here today to briefly go over some of the issues with returning to the burn area. If you do go into the burn area to go through any of your belongings, please use the utmost caution. Please use full protective gear, including sturdy shoes, long pants, long sleeves, eye protection, and an N95 or equivalent respirator. All of this information is available on our website. But what I'm finding is that folks who are out on the site are not able to access our website. So if those of you who are on social media, you can go to our Washington Fire webpage and push those out through your channels and try to get that information out to the people on the site. In terms of debris removal, the first step, as Dory said, is household hazardous waste removal, and the second step is the actual debris. There need to be steps taken by our partner agencies to ensure that the site is safe. There appears to be some ground instability on the slopes there that environmental health and community development and OES are evaluating, along with the Forest Service and Cal OES. So you need to use the utmost of caution if you're in the area. The plan B that Dory spoke to, very high level at this point, is if the state is unable to come in with resources for phase 1 and or phase 2, we'll be back before your board because there's a couple of options that can happen. One could be county funding or other grants that could be used to support that. The other would be through a code enforcement process where the county would go in and abate the violations and then take that through that process. So there is a plan B. We're just hoping we don't have to activate it, and if we do, we'll be back before your board. If the public has any questions about accessing their property or what they can do on their property or bringing contractors in to help them, please call our public information line. They'll put you in touch with the right people so that we can work with you directly rather than just through press releases or signs we posted on the property. So please call us or come to our offices, 533-5151. So thank you.
Thank you. Morning.
Good morning. Andrew Murphy, Assistant Fire Chief for County Fire and CAL FIRE. And I just wanted to add on to some of the comments that were made already regarding the Washington Fire. First, I wanted to highlight the magnitude of the aid that we received and the force of firefighters that responded. Unfortunately, for Calaveras County, there was a fire on the other side of the river, about 650 acres the day before, so there were a lot of resources there that we were able to get and that had come from other fires in other areas around the state. But if you'll indulge me for a moment, for CAL FIRE, Tuolumne Calaveras Unit, Amador El Dorado Unit, San Benito Monterey, Madera, Mariposa, Merced, Shasta Trinity, Lassen Modoc, Riverside, San Diego, and San Luis Obispo all had resources on the fire, also the Stanislaus National Forest, Yosemite National Park, of course, our Unified IC Department, the City of Sonora, Miwok, Sugar Pine, Twain Harte, San Andreas, Altaville Malones, Copperopolis, Bear Valley, Ione, El Dorado County, LA County, Orange County, Alton, an LA County strike team consisting of Downey Fire Department, Santa Fe Springs, La Habra Heights, West Covina, Long Beach, a Stanislaus County Task Force, including the City of Modesto, Burbank, Paradise, Stanislaus Consolidated, and Salida Fire, and volunteers and career staff from Tuolumne County Fire Department, Jamestown, Chinese Camp, Cedar Ridge, Pinecrest, Mona Vista, Mona Village, Don Pedro. We had a couple of private hire dozers as well as part of our arsenal. Also, of course, the Department of Corrections, CHP, many agencies within the county and city, including Animal Control, Community Development, and OES. Just to highlight on the aircraft, we had 6 air tankers, 4 of them were S2s, 2 of them were the large air tankers, and 5 helicopters from all around Columbia, Hollister, Grass Valley, Fresno, Paso Robles, Bear Valley, which is in San Benito Monterey unit, Bald Mountain, Crane Flat. Over 50,000 gallons of retardant were used to stop this fire. So with that, just a reminder to the public that we're not out of the woods yet. We still have a couple of months, our most dangerous months, as the fuels have been drying and curing. We're having fires every day. We had a couple yesterday. In the county, we had 20 acres, another 20 acres burned at South Shore Tolek last week. So just reminding everybody to be vigilant, and one less spark equals one less wildfire. Thank you.
Thank you very much.
Yeah, I just want to make one comment. As mentioned, Supervisor Goldenberg and I were out there, and thank you, Quincy, thank you, Dorian, thank you, Andy, for presenting on that. We're talking about steep slopes, difficult terrain, and white ash. We got lucky. It's amazing that it didn't jump some of those retardant lines and everything out there. Anybody visiting, definitely there were a lot of noxious fumes there, but just speaking to Andy's last point about the potential for other fires, since then and around then, not only have we had the Arola fire and the Washington fire, we've had Wigwam catch on fire. We've had an area of Lake Tolek catch on fire. Just yesterday, we had an area of Rawhide catch on fire. Any one of these, without their hard work and all the amazing staff serving you in the county, any one could be the one, you know? So it's great to be appreciative, but we are having a lot of these fire starts, far too many. So please let your neighbors know, if they're dragging chains, get something to pull them up. Don't be flicking butts out of the window. Don't be parking on dry grass. If you got friends visiting, they might not be familiar with that stuff. And we just got to keep doing the best we can, and I know that they'll keep doing the best they can too. Thank you.
All right, any more staff reports? Okay. If there's no staff reports, we'll go ahead and close that section and move on to the consent calendar. Look to our board clerk, Ms. Ryan, to read our consent calendar. Yeah, we have a long one today, but a lot of them are the same thing, so.
Yeah, same thing with slight difference. Item 1, approving the minutes of the August 17, 2021 and August 30, 2021 meetings. Item number 2, adopting Resolution 75-21, approving the summary vacation of a public road easement as described in Exhibit A attached to the resolution. Item number 3, approving the discharge of accountability for 13 accounts totaling $3,901.32 in the Ambulance Enterprise Fund, in accordance with Government Code Section 25259. Item number 4, adopting Resolution 76-21, approving the 2021-22 Tuolumne County tax rates pursuant to Government Code 29100. Item number 5, approving of post-adoption services agreement with Wayfinder Family Services for fiscal year 2021-22, not to exceed $65,000, and requesting the board chair to sign and authorize county administrative officer to sign all related amendments and documents. Item number 6, consideration of adopting Resolution 77-21, electing to cease to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Attorneys Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 7, consideration of adopting Resolution 78-21, electing to cease to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Deputy Sheriff's Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 8, consideration of adopting Resolution 79-21, electing to cease to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Skilled Trades and Maintenance Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 9, consideration of adopting Resolution 80-21, electing to cease to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Healthcare Employees Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 10, consideration of adopting Resolution 81-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Road Operations Unit, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 11, consideration of adopting Resolution 82-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Employees Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 12, consideration of adopting Resolution 83-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Executive Confidential Unit, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Consideration of adopting Resolution 84-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to recognized employee organization, Physicians Unit, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Number 14, consideration of adopting 85-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Management Association, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees. Item number 15, consideration of adopting Resolution 86-21, electing deceased to be subject to the Public Employees Medical and Hospital Care Act with respect to the recognized employee organization, Professional Unit, as the county will be withdrawing from PERS Healthcare and using PRISM to provide healthcare insurance for its employees.
Okay, well, boy, if that last sentence wasn't clear. Yeah. I'll look to the board members. I'm going to pull item 6. Would any other board member like to pull an item from the consent? Any discussion on any item, or else we'll open it
Yeah.
up for public comment?
I have a discussion on one item,
Okay.
item 3. Item 3, yeah.
Okay.
So I just want to, this area has been a concern of mine, that we try to recoup all of the money due to the county as possible. And I just wanted to express my appreciation to the ambulance staff that they're working proactively on this and working with Adventist Health Sonora to try and, garnish all of these funds back into the county as possible. So thank you for doing so.
Thank you. Okay, is there any public comment on the consent calendar minus item 6? Yes, sir.
Mike Egner, Operating Engineers. I represent 2 of the bargaining units that are mentioned in this long list of things you're going to be voting on. I have a concern. One of the concerns is that in our MOUs right now, there's a section that requires the county to meet with us and talk about changes in the medical plan. I'm not against changing the plan. My problem is that I felt it was wrong and unprofessional to get a letter after the fact saying that, I knew the county was looking, but I didn't know that they had made a decision to pull out. I get a letter stating that the county is going to pull out. And oh, by the way, if you want to meet and talk about it, we need to do it before September today because you're going to be voting on it, which, not that, like I said, not that I have any objection to it, it's just the way the process was handled. And that seems to be the way the county's handling negotiations right now too, which I'm not going to talk about. I'll wait till the proper time. But this is kind of like a perfect storm right now. You got COVID going on. The county's in negotiations. The county's changing medical plans. Open enrollment is coming up. And the other huge concern I have is I want to make sure that all the county employees know what they're looking at, because with negotiations happening, there are enhancements to these plans, because I sat through a Zoom meeting with PRISM and they did a really good job explaining it, but there are enhancements. With those enhancements are higher costs to the employee, but there's been no discussion yet about providing any higher pay for those costs. So that's my concern. One is, next time, let's tell me before you're going to do it. Give me a chance to at least talk about it. And the other one is, make sure your employees, the whole county knows about it. I'm not your conduit to all your employees. I will always make sure our members are up to date on things, but it's y'all's job to tell the employees when you're going to make a decision like this. And I can tell you, being a more mature individual, telling me to look at a website for answers is not the way to do it. So I'm used to employers having health fairs, and I do understand with COVID you can't do that, but we need to make sure that there is some process that employees that have questions about open enrollment, where they can get the answer and who the person is. All right? Thank you.
Thank you. Hello, welcome.
Hi, my name is Don Nessel. I worked for the local water district for 26 years, so I've got PERS health insurance. Why have you decided to change? Is it cost or is it services? Does anybody know?
So if that's the extent of your comment, I can, if you want to, if you have anything more to add, I can direct our CEO to answer that.
It's a
My
secret?
understanding is, no, it's both.
Supervisor Campbell, if one were to read the 10 memos that are on the agenda, it would explain the reason for the change. The reason for the change is it will save over an estimated $672,000 for our employees out of pocket next year.
It's a
Otherwise,
financial thing.
it's a financial thing for our employees to their benefit.
Thank you very much.
Yeah, in addition to that, the type of healthcare that most employees have is no longer going to be offered by PERS, so it essentially forced us to look at another area for providing healthcare since that plan is no longer going to be available. Is that?
Correct. They went from, PERS went from 3 plans to 2 plans.
Okay, any other questions on the consent item, consent calendar minus item 6? All right, I'll look for a motion of approval from the board.
Motion to approve the consent agenda.
Second.
Okay, I have a motion by Supervisor Brandon, second by Supervisor Half. I'll call for the vote. All those in favor, please say aye.
Aye.
Any opposed? Okay, none opposed. Motion passes 5-0. All right, so before you reread item 6, I'm going to recuse myself from that item because my wife is employed by the Public Defender's Office, and this item deals with the attorney unit. So now I'll hand it over to Supervisor Kirk.
Do we have to read this? We're gonna have staff present on this?
Why is it being pulled?
Because his wife.
So this item is actually one of the 10 resolutions that we'd asked your board to approve to leave PERS Health and then enter an agreement with Prism Health. And so this is the same as all of the others, but it is required and it is due by September 13th in order for that decision to become effective. So we're looking for your board to approve the resolution, please.
So, motion to approve item 6.
Second.
Motion by Supervisor Brandon, second by Goldenberg. What's that?
Public comment.
Oh, I'm sorry, public comment. See, I only had one chance and I messed it up. Any public comment? No, okay. Bring it back to the board. So we got a motion by Supervisor Brandon, second by Goldenberg. All those in favor?
Aye.
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 And so it passes 4-0 with Supervisor Campbell abstaining.
Okay, how did it go?
She still has a job.
No. Okay, so we'll go ahead and take a recess. It's 9:40. We'll reconvene at 9:50. All right, welcome back, everyone. Sorry for the delay. Without any further delay, we'll go ahead and move into our 9 o'clock appointment. Look to Ms. Ryan to read that appointment for us, and then we'll have Public Health come up to the front here.
9 a.m. presentation and direction on the novel coronavirus, COVID-19.
Good morning. Oops. There you go.
Good morning, Chairman Campbell, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, the Health and Human Services Agency Director. On August 26th, at approximately 2 p.m., a large plume of black smoke filled the skies of Sonora. This prompted a remarkable, unified response from our county and city leaders, our county and city emergency responders, and the community came together in unity to support those affected by this fire's devastation. We were one team, we were one county, and we had one fight. During the past 19 months, the COVID-19 virus has also devastated our community. Close to 6,000 of our family, friends, and neighbors have been infected by this virus, and nearly 100 have lost their lives, leaving in its wake children without their mother, husbands without their wives, sisters without their brothers, friends without their friends. And for the Health and Human Services Agency, it left an agency without a beloved employee. This virus does not care if you are young, old, sick, healthy, vaccinated or not. Similar to fire, it only aims to destroy lives and livelihoods. But unlike fire, this virus has attempted to destroy the unity of our community. Unity has always been our very best characteristic. We care for each other. It's always we before me. We must be unified in our approach to beat this virus. We need one team, one county, one fight. Thank you.
Thank you.
Good morning, Chair. Good morning, Board. Eric Sergienko, Interim Health Officer. And with me is Shelley Jaquetta. We're going to just do a quick update of the current COVID numbers. Next, please. Put it in a slideshow. Mr. Wizard. Yeah. It's not transmitting up there. Beautiful. There we go. That should work. Thank you so much. All right, so it has been 2 weeks since we updated the board. Since then, we have had nearly 700 new positive cases. So in a 2-week period, we've essentially had more than 10% increase in the number of cases when we compare that to the previous 17 months. We have had an additional 16 deaths. So again, a fairly significant percentage of our case fatalities here in Tuolumne County have occurred during this Delta surge. Much more of a burden that we're seeing in our hospital system locally and also regionally, as compared to both the surge in last summer and the surge over the winter. As of the 5th, we had 7 Tuolumne County residents hospitalized at Adventist Health, and we had 5 hospitalized outside of the county. However, I would say on potentially positive note, and I've mentioned this to the board previously, is that when we looked at data from India, when we looked at data from England, they saw basically a 6 to 8 week period of surge associated with the Delta. And this is our cases by episode date. That is the date on either which they were positive or they developed symptoms, whichever is sooner. And as you can see, it's kind of doing a slight downward decline
If you could
after
move
the
a
middle
little
of
closer
August.
to the mic, we could
Yep,
hear you
lean
better.
in a little bit. There we go.
There you go.
Okay. So as I was saying, like India, like England, we saw a peak and are on a slight decline. And if this bears true, we'll have a brief respite if we're like England. They are starting to see an uptick again after having a down period for about 4 to 5 weeks. Or if it holds true as it did in India, they've yet to see an elevated number of cases like England is seeing right now. That said, the proviso I have with this is that our hospitalizations and our deaths continue out for about 7 to 10 days past when the cases occur. So again, we're not at a hospital surge. Next. And if we look at our hospitalizations by date of report, we can see that very significant spike that is basically twice of what we saw during the winter surge. And even though it says we have 2 ICU beds available, that is just a snapshot in time. We go from anywhere from having 1 bed available to 0 beds available in our ICU at Adventist Sonora. And at this point in time, all of those ICU beds that are occupied with COVID positive patients. The other piece of information that I would have for that is getting back to the value of vaccination and hospitalization is that for Adventist Sonora, for data going from the 1st to the 27th of August, and I apologize, I don't have a slide for this. I just took down some notes from the hospital. And of the 88 hospitalized, 77 were unvaccinated, 8 were fully vaccinated, and 3 were unknown. Of those hospitalized in the ICU, there were 25 hospitalized in the ICU, 23 were unvaccinated, 1 was fully vaccinated, and 1 was unknown. And then of those on the ventilator, of which there were 19, 18 were unvaccinated and 1 was fully vaccinated. So again, if we look at our population being roughly half vaccinated, fully vaccinated, this speaks to the value of that. Next. Another encouraging trend is we follow on a twice weekly basis, not just the bed occupancy in Tuolumne County, but throughout the region, places to where we send our patients to. And for the last 3 weeks prior to this slide, everybody was on an upward climb. What you're seeing here is Merced has actually been able to get rid of a couple patients. And so open some beds. That's the first decline we've seen in hospital bed use for COVID patients in this month. I will caution, however, is that even though you see that decline in Merced County, Stanislaus and Fresno are still going up, but at a much lower rate than they had been the previous 3 weeks. So again, we're seeing a decrease in cases. We're seeing a decrease in what's called the effective reproductive number going below 1. So that is each positive case of COVID is producing less than 1 secondary case. So that's a good piece of news. But again, we're still seeing a demand for healthcare, and we're still seeing the implementation of what's called a level loading order, where hospitals throughout our region, if they do not have an available ICU bed, can ask any facility that does have an ICU bed available to accept that patient. And that's being put into place on a daily basis. Today it was shifting 2 patients from Madeira to hospitals throughout the region. And I will say that's not just for COVID patients. Both of these patients that are being moved from Madeira Community Hospital are medical patients. One is an asthma exacerbation. The other is a person having complications from diabetes. Next. So in terms of new public health orders since we last met, on the 1st, there was a revision of the school guidance, and that was to include guidelines for sports and curricular activities. And then on Friday, we met with our surrounding counties that had a previous health officer order for youth sports, and we're revising that guidance in response to the revisions of the school's guidance. I think one of the takeaways from the state guidance was to test folks regardless of vaccination status if they are in close contact and cannot wear a mask. The other thing I would add, as long as we're talking about schools, not related to the health officer's orders, but Somerville, as you saw, closed out of an abundance of caution, and they have moved to a 10-day quarantine rather than using the modified quarantine that is included in the school's guidance. Similarly, Sonora High and Curtis Creek High have moved to that 10-day quarantine as well, rather than doing a modified quarantine. What a modified quarantine allowed people to do was allowed students to continue to attend school and basically travel between school and home, but not do any extracurricular activities. And the schools have found that just too much of a challenge to administer, given increased transmission within the schools. Next. So again, our primary concerns, we are seeing that decline in the case rate with the effective reproduction rate declining from above 1 to 0.95. So that means, again, for every 100 cases, you're getting 95 secondary cases. There is the ongoing health surge, again, recognizing there's a delay between when a case presents and when a case gets hospitalized. And then we have to message on the importance of vaccination. As mentioned, it prevents illness, it prevents hospitalization, it prevents death. In terms of numbers, it really is an order of magnitude reduction, a 10-fold reduction in hospitalization, a 10-fold reduction in death. Our current data suggests about a reduction of 6 times for illness, and that is in the face of the Delta variant. We also have to be cognizant that we may need to be doing booster shots. The federal government got a little ahead of its regulatory process with the White House announcing that they were going to plan on booster shots by the 20th of September. We are planning on that as well because we may have to do it, but we also know that there has to be a regulatory and advisory process that has to occur. The FDA has to meet with its Vaccine and Related Biologicals Products Advisory Committee, or VRPAC. That will happen on the 17th of September. And then the Advisory Committee on Immunization Practices, an external body to the CDC, will provide recommendations on how to implement those booster shots. And so until those two things happen, we will not be doing booster shots. However, we will be doing and continue to do what are called third doses. And the differentiation is that third doses are for people who have known immunocompromise relating to things like solid tissue cancer or other significant immunocompromises, and we are continuing to do those third doses. And then I think probably the one thing, again, going back to Director Espino's comments about being one community, is what would help us the most as a community is if you're sick, stay at home. It doesn't matter whether it's influenza, upset tummy, or COVID. Having someone sick either at work or at school allows for transmission of that disease. And so maintain as best you can your isolation, your quarantine. And if it does happen to be COVID and your friends test positive, your family tests positive, and you get a call from one of our case investigators or one of our contact tracers, please be helpful, please assist. Don't hang up on us. We really want to get our arms around this and reduce the impacts of this on our community, and that's the best way of doing it.
Dr. Shchenko?
And before you go, I know Supervisor Kirk is joining us remotely. He had to jump out of the meeting and go remote. Are you with us, Supervisor Kirk?
Yes, I am. You guys hear me?
Yep, we can hear you loud and clear. So I know Supervisor Brandon had, did you have any questions first off, Supervisor Kirk? Otherwise, I think Supervisor Brandon had some questions, and then Supervisor Half.
No, I'll wait.
Okay.
Just one quick question. It's specifically related to R naught of the virus. It seems substantially higher than obviously the point or 0.95. I just wanted to see, is that a difference between a kind of what am I trying to say? A lab experiment of potentially how infectious the virus is versus all the measures taken and what the actual reality is. The R naught was seeming to be somewhere between like 8 and 12 or something like that. Last time from the discussion we got about 2 weeks ago.
Right, so the difference between the RE, which is the effective reproductive number, was really based on field data. So what we're seeing, whereas, yeah, when we were talking about originally the Delta variant, we were looking at a potential R0 reproductive number of somewhere around 8. And so I don't think that has bared out in our community. The highest I think we saw it was approaching 2. And this is based on data that is pulled in by the epidemiologists at the state level, so we can get it at both a county level and at a state level. And so that's, again, what we look at ongoing, and is to be expected as we see decreased transmission. And that's based upon both vaccines and non-pharmaceutical interventions that are being taken on by people, whether it's mask wearing, whether it's staying home when they're sick. All those things impact the effective reproduction number.
Okay, I appreciate it. And just to folks listening there, one reason I end up focusing a lot on the R0 is when we say it's 50% more infectious than the previous variant, which is 50% more. R0's, to my understanding of it, basically how many people potentially someone would infect if they were infected. And measles is kind of the king of that, I think, around 15
20.
or something, 20? Yeah.
So, yeah.
So comparing it between measles and kind of seasonal flu and gives you an idea of really how contagious, how fast this spreads.
And I to get a little bit nerdy is, the basic reproduction number, the R0, is generally theoretical, based upon a big snapshot. And again, what we saw with the Delta variant is a basic reproduction number was, around 6 to 8, whereas the Alpha was somewhere in the 2. But then as you see it implemented in the community, where you've got social distancing, where you've got masks, where you've got people getting tested, all those layers reduce the basic reproduction number down to an effective reproduction number. That is, what are the public health interventions? What are the things that are people doing to bring down that basic reproduction number down to what the effective reproduction number is? And then the goal is to get the effective reproductive number below 1. So that means it's slowly dying down.
Okay, thank you.
So,
Supervisor Goldenberg.
Dr. Sajenko, thank you for the information. So I have a few questions. You indicated we had, in the last couple of weeks, 700 cases, 16 deaths. Really, in the last 30 days, we've had about 1,200 or more cases and 22 deaths, as far as I know. But, the last couple of weeks has been especially strong. When we talk about surges, hopefully we will get through this current one, and we're looking at the plateauing and the charts. But if we don't take some remediation efforts, between masking, vaccines, other measures, what's to prevent another surge from occurring 2 or 3, 4 weeks from now? So that's my first question.
Got it. So again, that's the scenario that's playing out in England right now, is that they saw a decline in cases and then a brief hiatus over the month of August, basically. And now we're seeing an uptick in cases. So I think the way I would want to phrase that is we're really looking at the transition between a pandemic and an endemic disease. I think when I first came to this board 18 months ago, I said this is going to run us 18 months to 2 years till we're out of the pandemic. And there is this transition period where we go from it being, causing these huge spikes to causing little and littler wavelets as we move out. Eventually, don't know when, maybe as long as a decade, it really will become more like what we see with seasonal influenza, where we have a burden of disease that varies from season to season, but it's not the same huge surges we have now. But getting from here to there is the challenge. We still need to be mindful of what are the things that we can do to reduce the burden of disease. So again, I will continue to encourage people to get vaccinated because the vaccine is, again, effective against every variant that we have. It is, again, less effective against the Delta variant than the Alpha or the native strain, but it's still very effective, 10-fold reduction in hospitalization, 10-fold reduction in death. So I think those are the things we need to do. And then, again, things like wearing masks, things that are prudent and of minimal burden, reduce the transmission and should be continue to be encouraged, especially when we have a higher level of transmission. So as we move out of this wave and into a hiatus, it may be, okay, we'll take a break from masks, let things go a little bit closer to normal. But at the same time, if we see a ramp up in cases, we'll say, okay, maybe now it's time to put masks on people. Maybe it's time to, again, social distance. Maybe it's time to close down gatherings, again, based upon the scope and scale, if you will, of that wave.
Yeah, and thank you for explaining that, because, I think it is important for the public to understand that, we're moving forward, we're trying to get through this, but that doesn't mean that we won't have increased, problems, maybe to a lesser degree, as you're explaining, but they're still, very possible, and we saw some recent, pretty strong amount of cases, come out of certain sectors, including our schools, and, so that can have an impact. Another question I had was when we talk about the number of cases in the hospital, and we look at the ICU cases, pretty much predominantly occupying by COVID, all of the ICU beds. So we've had anywhere from 12 to as many as 22 hospital cases reported in the last couple of weeks, or a little bit more. A little disturbing to me, is to see that, okay, if we've got, 7 cases in the hospital and we have 5 that were transferred out of the county, and I guess my question is, why are these patients transferred out of the county? Was there, because a higher level of care needed? Was the seriousness that we were just not able to care for them as much as we would like to see, locally?
So it's a combination. Some of it is simply bed availability. If you don't have an ICU bed, rather than trying to maintain that patient in the emergency department, which does happen. I mean, if you talk to the emergency department manager at Adventist, they'll hold patients down there for 2 or 3 days if they need to. But the preferred course is to find an available hospital bed somewhere in the region rather than try and manage them in the emergency department. So for some of the patients, it's just finding an available ICU bed. For some patients, however, yes, as you indicate, it's for that higher level of care, whether it is something like ECMO, which is extracorporeal membrane oxygenation, where they basically suck out your blood, put oxygen in it, and put it back in, or something like a lung transplant, something that you cannot get at Adventist Memorial Hospital. So those are things that have happened and that require transfer of that patient from our hospital to tertiary care centers, not just in the region, but throughout the state.
Yeah, we've seen cases, we've seen deaths across all sectors. Thankfully, we have not seen, a fatality under the age of 18, but that doesn't mean that that couldn't change today or tomorrow. Certainly, the amount of cases that we're seeing, in our younger children, have approached 25% from the numbers that I've been seeing of our total, new cases. It just, we're watching people all across our communities. Our own employee, as, Rebecca Espino, professed here just a little bit ago. The answer, is not that we just ignore, these things, that we can do better, and we should do better, because this is not going to stop, on its own. So that's all I have for now. Thank you.
And I did have a message that Dr. Hurd wanted to weigh in on your last question as well. So are you with us, Dr. Hurd?
I'm with you, and I appreciate Dr. Serjenko's comments, because he took the words right out of my mouth. Now, we actually do very well with treating COVID positive patients in our hospital. So most of the transfers have been for other medical conditions that need a higher level of care. And that's all I was going to add.
Okay. Thank you. Supervisor Heff?
Yeah, thank you. All right, I don't know if
most of you have read my position paper. Hopefully everybody on the board has. We've had short discussions on COVID and on some decision-making where the state is concerned, and asking us, expecting us to follow their lead. And I want to apologize to everybody that I have not brought up another side of this discussion before now. I have been studying the COVID story since I won in March of 2020. And I had plenty of time in the 9 months before taking office this January to really research it in depth. And for those of you who don't know, in my government work here since 2000, I have been both an investigator of child abuse, but an investigator nonetheless, and an analyst. And so I bring these two traits, these two experiences into what I have done in this 10.5-page paper. And I want to say that I agree with Dr. Sarjenko. We need to reduce the burden. And I also want to speak to Rebecca Espino, the head of Human Services. And I share your grief in the loss of actually 2 employees. One is retired. The most current employee that is still was still working, I understand, was vaccinated. And the loss of my friend, retiree, was unvaccinated. So this is why I am writing this paper. One of the reasons. First and foremost, it's for educational purposes. We're only hearing a certain side of I'm calling it the COVID story. And I think it's important to bring all of the information out, including some data analyses, research that is, I'm going to go ahead and say suppressed. We're not getting it. We're not getting that information. And I think it's high time that we all understand what we're dealing with. So with that, I'm not going to go over the whole paper because it's extensive. I would encourage you all to read it and to play every single video and to read the research. I have not drawn a whole lot of conclusions, although I am going to today. I'm going to suggest some alternate ways of doing things. But I'm going to make a few points here, and they by no means reflect everything that's in this paper. But the salient points I want to bring up, first and foremost, is fear prevails right now. Fear has been prevailing ever since we noted that something was going on in China. And my second point is this is unnecessary. It's unnecessary to be fearful of COVID. That might seem like a bold statement. However, from what I've learned from my research and what you'll find in the paper is that SARS, or CoV-2, is treatable. I hope you hear that. It is treatable. These treatments are not being employed locally that I know of, and I'm glad that Dr. Hurd is on the call. He's from Adventist Health, because maybe he can weigh in on this when I'm done. But there are treatments that work, such as monoclonal antibody infusion therapy. There are infusion centers, not here, where you can go in and get a 30-minute infusion of these monoclonal antibodies, and you start feeling the effects that you've been feeling from COVID-19 starting to go away. And then you wait another half an hour, and you go home, and you heal. There are also the use of 3 different generally regarded as safe prescriptions that are used off-label. They are not used alone. They are used with other, like zinc, other supplements, and sometimes other things, kind of like a cocktail. So there are other things that we can do to reduce deaths here in this county and in the United States, and we're not doing them. And it breaks my heart that the research is out there and we're not. Many experts in their fields with decades-long, highly recognized reputations have spoken out. Their findings run counter to what you hear on the news, and you can see what they have to say in this position paper that I've written. I will warn you, though, before they spoke out, their reputations online were stellar. Now they're smeared. So just expect to see that. There are some other more highly explosive things in this and in the research, such as mass vaccinations have created the problem of immunoescape. It is not the unvaccinated. It is those who have had the vaccinations that have a immunity towards one type of a thing, and that virus does no longer exist. Vaccines are showing waning immunity and do not prevent anyone from contracting COVID-19 or passing it on to others. The head of the CDC has admitted this. Contrary to what we are being told, those who have contracted SARS-CoV-2 and have recovered have broad, durable, and long-lasting natural immunity. Adverse events such as deaths reported from vaccines from 1990 to 2019 averaged about 158 deaths per year. Since 2020, they're reported to be over 13,000 now. And that's not even counting all the other adverse life-altering effects. There are hundreds of thousands of those, or thousands of those. They break them up. We may be entering the endemic stage, as Dr. Sarjenko suggested, which means it will be with us from now on, which further calls to let's treat it. Let's do something now, because it is going to be with us. And my final point that I state at the beginning and at the end is we're not going to vaccinate our way out of this disease. We've got to start looking at these other treatments. Therefore, taking all this information into consideration, Tuolumne County has no business, in my opinion, mandating vaccinations for anyone or following onerous guidelines that the state mandates for us to follow. Not when there are effective treatments that come close to eliminating most deaths due to this disease. These treatments, especially if given early, and in most cases, remove the ill effects that the SARS-CoV-2 virus causes. As I stated in my closing, the role of government is supposed to be one of leadership in providing fact-based information so the public, which also includes county staff, can make an informed decision about their health. So far, we have utterly failed at this. The facts as presented to date have been arranged to create a certain outcome, one of fear, sometimes even panic. One that pits one group, the vaccinated, against another group, the unvaccinated. This has to stop. We do need to be one community. We do need to come together and figure out how to do this going forward. By using COVID treatment protocol as revealed by this research, we can effectively stop the spread of this disease and help people get back to their lives harmoniously. The biggest hurdle we face is the disbelief that this is true.
All right. Okay, Supervisor Kirk, do you have any other questions for Dr. Sarjenko?
Yes, I do. And before I do, am I getting any feedback or echoing, or are you guys good?
No, we hear you loud and clear.
All right. Well, I thought Supervisor Kathleen was going to speak much longer, and so I applaud you for being able to summarize it the way you were. I did read your paper, and I really appreciate it because it takes a lot of guts to to speak to the other side. And so I do have some questions. I do have some comments for Dr. Surjenko and a little bit for Dr. Hurd. But, you know, this is really rough for me because I would rather be in a room alone with people kind of duking it out and really having tough conversations. But we've been forced to a position now where I think with these forced vaccinations, with some of these policies, that we really no longer can just be quiet. Every one of us up here on the board is smart. We're educated. We have good hearts. We want the best. But I haven't been quiet about this issue, and I continue to have questions and I continue to have comments, which I feel like a lot of our employees and a lot of the public have, and I think that's appropriate and I think that's healthy. And so I just want you guys to know, as I ask these questions and as we have these comments, I do it out of a heart of humility and sincerity, but also just want you guys to know that I do have a lot of unanswered questions and things I want to discuss. With that being said, I want to make it really clear, and I want to ask County Council real quick, just a quick question, because so much has already happened. On August 3rd, this board, the majority of the board, Brandon, Goldenberg, and Campbell, you guys decided to move forward with either proof of vaccinations or weekly testing and masking for the unvaccinated. And so during that policy discussion, you know, what's that?
You said you meant employees, right?
Employees, correct.
Yeah,
Employees.
sorry to interrupt.
We're speaking specifically about employees. So Dr. Surjenko said it made immense sense to do these things. But one thing that County Council had said during that meeting was that this board alone had the sole authority to require this of our employees. So that was August 3rd. Up to now, County Council Creo, could you just bring the full board and the public up to speed on where we're at, what we have authority and sole authority to allow or to not implement? And I know there's about 3 different bracts where this falls in. So could you just give us an update real quick?
Sure. So part of this is what we discuss when we talk about bargaining with our employees, because we're required to meet and confer over anything that impacts, you know, wages, hours, terms and conditions of employment. So legally, the board has the authority under the law to require verification of vaccine status or mandating vaccines. The issue is, even if you have that authority, you still have to meet and confer with your unions over it. So as you know, bargaining is ongoing, and we will continue to go through that process until we have finalized policies in place, which will ultimately come to your board in public session for final approval. So that's kind of the status. I don't know, Supervisor Kirk, if you have additional questions.
Well, I know at that board meeting, it sounded like the majority of the board would never want to force a vaccination on somebody. But at that time, that wasn't on the table. But since then, public health has come out and said, no, there will be forced vaccinations for people who work in certain public health, nurses, certain areas within county government. Is that correct?
Right. So California State Department of Public Health has issued various orders. Some are simply verification of vaccine status for certain employees, though that impacts, for instance, our jail, our juvenile hall, and then our certain other employees that go into those buildings frequently. And then they also issued another order for mandating vaccines. That is for public health, behavioral health, and then certain employees that go into those facilities frequently. And so again, we're in the process of working with our unions on implementing those, but those are required by state mandate that we implement.
Okay. And the reason why I bring that up is because in less than a month, when we were at that board meeting, I told you guys I was drawing a line because we were going to be headed towards forced vaccinations, and we got there in less than 3 weeks. And the majority of this board at that time said that they would never want to force anybody to get vaccinated. So I want to remind you guys of what you said then. And
Supervisor
where we've already
Kirk,
arrived.
I just realized I forgot to mention something really important, and that is that there are exemptions to the vaccine mandate. There is a religious exemption, and there is a qualifying medical reason exemption. So I just wanted to make sure everybody is aware that those exemptions exist, and those would be put in place when that policy is implemented. Thank you.
Right. But we do know, and I've spoken with healthcare providers, that there's a liability for anybody who writes a medical exemption. So I've spoken with 3 healthcare providers that said that they won't take on that liability, so they won't be writing medical exemptions. Then we all know the religious exemptions are only going to last for a little bit of time because our kids in public schools, those don't even fly for our children going to public school. So again, I'm saying this is where we're headed. I appreciate the fact that you brought there's 2 exemptions, but we all know what's going on. So let me move on to, I do want to acknowledge what Dr. Surjenko and Hurd are seeing. Right now, the local data for us locally, it does show that if you're vaccinated, you're much less likely to end up in the ICU or die. That is data that cannot be disputed. I agree with that. And I know that Dr. Hurd's back on August 13th said that they were full in the ICU. The step down's full the last 2 weeks. They've seen a peak in the pandemic, and that it's following national data, and that the majority of that ICU and death was from unvaccinated people. So I want to acknowledge that. I see that side of the picture and I understand it, and I hear what's being said there. My question is to Dr. Hurd or Surjenko, do we have any data on previous infection who were in the ICU or died? So people who were previously exposed to COVID, who carried COVID, do we have any data on those people who ended up in ICU or passed away?
So Supervisor Kirk,
I can speak.
Yeah, go ahead.
Supervisor Kirk. So and this gets a little bit to Supervisor Half's comments. The folks that we've seen that have previously had COVID, who wind up in our hospital, who wind up in our ICU, are about the same numbers as the folks who have had a vaccination. So there is some protection from having had the disease. The 2 caveats I'd put on that is, one, they have to have had COVID before and be exposed to that increased hospitalization, increased ICU on their first illness. But on their second illness, there does seem to be some protection. I forgot my other point, but we'll leave it there.
So,
if there is protection, go ahead.
No, I think one of the areas of agreement is that, natural immunity is strong. And as I've mentioned to the board before, specifically Supervisor Half, is that having a natural infection plus having one of the mRNA vaccines, either the Moderna or the Pfizer, is probably the best protection you can get right now. So, that is, again, we're seeing reinfections. We're seeing reinfections get hospitalized, but at a low rate. Concerns here that I have would be, are we capturing everyone who is reinfected because are they under testing because they say I can't get infected again? That'd be the only concern I have. But we are, again, robust natural immunity. But again, it varies from individual to individual, so that we know that by augmenting it with a single dose of the mRNA vaccine, that you actually get a more robust, more uniform immune response. So if people were truly concerned, that would be my recommendation.
So if people have a strong immunity from prior exposures, why wouldn't we test them but force vaccination?
Yeah, so, well, I mean, I don't think forcing is where, I'm a recommender. But, go ahead.
Real quick, Supervisor Kirk, I just want to say, if folks follow and that.
Hold on. I want to finish. I would like to finish my opportunity to speak, and then at the end.
Yeah, let's let
Supervisor Kirk. I didn't interrupt other people.
I only just requesting the public, please respect our speaker. I know that we're up here. They can email us any criticisms or disagreement, but we really appreciate their time and their expertise here, and please be able to let them answer Supervisor Kirk's questions.
I'd like to continue.
Okay, please continue, Supervisor Kirk.
Okay, so my question was, and you answered it. Okay, so
I think the challenge is,
I guess, why isn't the state allowing for antibody testing?
So that's where I was going to go next. Is with antibody testing, it's more of a binary than it is a quantitative, where you actually know how robust it will do. You have to do a neutralizing antibody test. Could you do that? Probably, but again, thinking in terms of logistics involved with that to see whether you've got a robust immune response to the infectious agent or not.
So kind of what I'm hearing is it's not just a positive or a negative. It's you have to take a bunch of stuff into consideration. When
Yeah, well, it's not, no, you'd have to, so if you do, like, you go to Quest or some other commercial lab and get an antibody test, it doesn't really tell you how robust your immune response is. You'd have to do a more specialized test, and I just don't know the capacity within the county, the state, the United States to be able to test everyone that was interested in that versus the ability to do a vaccine.
Okay. And Supervisor Brandon, I'm sorry, somebody just texted me saying you're trying to support what I was saying because people were talking over me. So if that was the case, I do apologize.
Okay. If there's no,
I do have more questions.
Oh, okay. Apologies.
It's okay. I'm going to be here for a few minutes. I have questions. So Dr. Surjenko, does it make sense for those outlined in the public health order for them to be fired if they're not vaccinated? And that is to say, if they can't provide a medical exemption or they can't provide a religious waiver, because, you know, I know it's going to be hard for some folks to get a medical exemption. That's between them and the doctor. But, you know, we have folks that maybe aren't religious, but they have very strong held beliefs. You know, we have folks that go and fight for our nation and for freedom who lay their lives down, but that's not considered a religious belief. So do you feel like does it make sense to eventually fire those people who can't fit within these public health orders?
So again, I would echo what county council said, is that these are state public health officer orders, but it is a policy decision at this level. And therefore, I think it's relevant for your board to make that discussion happen. Again, from my perspective as the health officer for Tuolumne, is that I would encourage everyone to get vaccinated. So again, that is a policy decision that I think that you and the rest of the board need to have, and then consider it with your human resources and your county administrative officer.
On your thumb drive there, Michelle, I think I put in a few links. Back in November, I presented some stuff to the board, and I was accused of cherry picking data. So I went straight to the sources. I put it on a thumb drive. I put it there on your computer. Could you bring up link number 1 when you have a second?
Maybe. I think what we need to do is exit out of the...
This isn't, was this presented ahead of time, Supervisor Kirk? Because I haven't seen anything. I think you'll have to present this on your own time.
No, these are just part of my questions.
Well, they look like links to websites.
Right, because I have a question.
Okay. What's your question?
Sorry, let me get my Zoom back up. You guys able to click on the link?
Which link would you?
So link number 1, if you just copy and paste that into Chrome, Google Chrome.
It's going, I think.
All right, is it up there? I can't see from my Zoom.
Go ahead and... I think you have to activate it or else it's not going to cut and paste.
Yeah, the link's not coming up. Supervisor Kirk, could you describe what you're trying to get at, and maybe they
I
can,
cut and copied the same one into my link. It's working on mine.
maybe they can,
You guys not have
maybe they
internet
can work
access?
on pulling it up while you, elaborate on what your question is?
Okay. Well, but we do need to get this fixed, and we can take a break if we need to, but I can talk about this link in particular. This link is from the CDC website, so Centers and Disease, and it's from Director Rochelle Wozinski. And I'm just going to read 2 parts of her statement. It says, on July 27th, CDC updated its guidance for fully vaccinated people, recommending that everyone wear a mask indoor public settings in areas of substantial and high transmission, regardless of vaccination status. And then later on down, it says high viral load suggests an increased risk in transmission and raised concern that, unlike with other variants, so we're talking about the Delta variant, vaccinated people infected with Delta can transmit the virus. This finding is concerning and was a pivotal discovery leading to CDC's update mask recommendation. The masking recommendation was updated to ensure the vaccinated public would not unknowingly transmit virus to others, including their unvaccinated or incompromised loved ones. So CDC made a recommendation, or is noting that it's a pivotal discovery that vaccinated folks can and do spread COVID-19. So my question is, why are we supporting a policy that is going to let the vaccinated continue to work while only testing unvaccinated folks? And that's not a policy for you, Dr. Surjenko, but it's a policy question for our board when we have the head of CDC saying it's a pivotal discovery. So I take that information very seriously.
So Supervisor
so I
Kirk,
wanna talk about-
if I might, to address a little bit of that, again, that was based on a cluster of cases that occurred in Massachusetts, where the cycle threshold values were slightly higher, but very similar between the vaccinated and unvaccinated. And again, science progresses. That was based on an outbreak that occurred in July. And then looking at viral carriage after a breakthrough case, we do know that people who are vaccinated carry, so at a point in time in testing, they have similar levels, but it drops off more quickly for those who are vaccinated versus those who are unvaccinated. And so they are less likely to transmit. But I agree that as per the statement here from Director Wolinski, at that point in time, within a day or two after onset of symptoms, they are transmitting at about effectively the same level as someone who is unvaccinated, but then it more rapidly declines than for someone who's vaccinated versus someone who's unvaccinated. So again, less concerned about people who are vaccinated, but I acknowledge your point.
Sure, and my point is from a policy point of view, which is we're only testing unvaccinated folks when CDC and we all agree that you can still transmit the disease if you're vaccinated.
But at a less likely rate.
Well, at a rate nonetheless, though, but yes. I want to talk about
Supervisor Kirk, if I can just make a comment.
Sure.
I'm in agreement with you that testing everybody would be a best gold standard practice. What we've run into in the hospital is we don't even have the antigens and the testing capability for the 20% of our unvaccinated people who we have to test. So you might look at it from just a logistic numeric pattern of, who can you test? How quickly will we run out of antigens? So then we'll be unable to test anybody. So there's, that's the sort of realistic sort of unsavoriness of where we are with our supplies right now.
Right. And I hear what you're saying, and I would agree that you guys have some real challenges as far as numbers and ratios and how do you do that. But in the same token, as a policy, and I'm not blaming you because this is a state mandate, but it does fall on our board. And again, Adventist Health is separate. And I appreciate you coming to the table and having conversations. I can't speak into you or tell you guys what to do, but as a county, how can I go along with the state mandate mandating a vaccination when the excuse is, well, we don't have enough testing capability? That doesn't work for me. So, again, that's not directed towards you. That's as a county policy. But thank you for bringing that up. Michelle, do you guys were you able to get the internet working?
It looks like it.
Okay, can you go to link number 2?
This is the problem, it's not letting me.
And let me know when you guys have it up. I can't. All I see is Dr. Hurd's beautiful face right now.
Yeah, for some reason your document is not allowing us to cut and paste from it, so we're hand jamming in the URL.
Okay, I'm sorry about that. That's strange. It's a Word
So
document.
if you save the Word document to your computer, then you'll be able to
Yeah, you might
do that. Okay, we're looking at it, Supervisor.
All right, is
Hurd.
it up?
Yep.
Okay, let me pull mine up. I didn't want to get a hold or in front of you guys. Let me pull it in right here.
Let's scroll down a little bit.
Okay, so we're talking about the effectiveness of COVID-19 vaccines in preventing SARS among frontline workers before, during Delta variant. And if you, of course, everybody in the public looking at this, if you look at the top left, it's CDC, Centers for Disease Control and Prevention. So what I wanted to look at was, if you scroll down to where the chart begins, it says table effectiveness of COVID-19 vaccines against SARS-CoV. Are you guys there? So it says unvaccinated, fully vaccinated, and then on the far right, it says adjusted VE. And so as you scroll down that adjusted VE, the way I'm interpreting this, and I'm open for any doctor's interpretation because you guys are smarter on this than me, but it basically says over the course of time, the effectiveness of the vaccine, starts to dwindle. I think Dr. Hurd, last time you said, it's kind of why with natural immunity, we put a belt and suspenders, and this kind of explains that reasoning for belt and suspenders. But my question is if you go down to the very bottom where it says Delta variant predominant, it says under fully vaccinated, it shows the efficacy level of 66%. So the way I'm interpreting this is overall, we're at about a 66% level for effectiveness right now with the Delta variant when we're talking about the vaccine. Is that correct?
So yes, and in terms of reduction of disease.
And then the other link I have is link 3. Look at that, we're already halfway through the links. If I go to link 3, let me know when you guys are able to put that in.
Are you saying, is it possible for you to start talking about the links while?
Yeah.
Michelle, okay. I think that would save a lot
So
of time.
they're pulling that up, this link, and please, Ryan, because I'm looking at my computer screen and doing Zoom at the same time, let me know when they have it up. But this link is to the Public Health in England. So their Public Health Department, this is their study directly from England. And it talks about SARS-CoV-2 variants of concerns and variants under investigation in England. And if I go down, see, this is kind of hard to do without them being on the link. Are you guys on the link yet?
Getting there.
Okay.
So I was going to say, because it's such a long URL, we're scanning it it didn't go through. So we're
You want to trust me and I'll tell you the data?
Sure. I'm actually think I'm familiar with this paper, but let me know.
Okay. Okay. So on this study, they talk about people who received the vaccination post 14 days, which means it's supposed to be legitimate at that point. And then it talks about people who are unvaccinated. And so it gives this chart. And if you go down to the bottom of the chart, which is on page 23, I don't know what to make of it other than what the numbers say. They say death within 28 days of positive specimen date. And so the people who are unvaccinated, it shows a death of 390. But guess what it says for 14-day post-vaccination date for Delta? It says 679. So I don't know if that's because England and the UK are a couple months ahead of us, or why there's more deaths among vaccinated than there are unvaccinated. I'm curious what your interpretation of that is. Is that because the variant is losing its effectiveness, and kind of like Dr. Hurd said, where that's where the booster is going to be needed, where we belt and suspenders it. But I'm curious why those numbers would show the way they show.
So I'm going to say, are those absolute numbers rather than case rate?
No, they're absolute numbers. They're deaths within 28 days of positive
Right.
specimen.
So absolute numbers rather than case rate. So then what percentage of the population is vaccinated?
See, that's where we need this chart up. Let's see here.
Sorry. But my suspicion is, in not knowing, and
it gives numbers.
Yeah. And we can talk about this offline, but my guess is that if it's healthcare workers, they're going to have a high degree of vaccine uptake. And so if you're looking at absolute numbers, what you want to do is adjust that for case rate and then stratify by risk population to give you
so it's not healthcare workers. The table, it says attendance of emergency care and deaths.
Okay.
Oh, cool. So go to page 22.
Yeah, we're just getting slightly seasick as we scroll down there.
Right. So right there on the far right, it says 14 days post dose, and then to the very far right, unvaccinated.
A little bit so I can see it. See everything on the chart. Okay, attendance to emergency care and death substitutes. Vaccination status. Okay, so.
And then at the very bottom of 23 is where you get the total deaths.
Oh. Okay, so what's, it's going to be hard for me to figure this out. Can I get, I was going to say, can I do this offline?
Sure,
with
that's
you?
fine.
This
That's
sounds
fine.
like a conversation
I
to be
guess-
had offline, because there's a lot of data here, and I
Well, no,
wouldn't
these
expect.
if Dr. Surjenko needs time, I completely get that. I'm just saying from my interpretation, it would, in my mind, make sense that the variant is, or the vaccination is weaning. And this is, if England is a few months ahead of us, potentially those are the type of numbers we might see in America or in California.
Yeah,
or in
so,
Tuolumne County in the
no,
future,
what I'd
as far
say
as
is this
the-
probably, I'm sorry, I'm interrupting, go ahead.
Yeah.
Oh, no, I was going to say is, just looking at this briefly, my thought is it because it's absolute numbers rather than case rate, then you'd want to look at it as case rates, and that's probably somewhere in here. You just need to find it within the whole presentation. So let me take that as homework.
Sure. No, I'll follow up with you later on that. I appreciate it. Okay, so we talked a little bit about natural immunity, or Supervisor Half did, but if you bring up link 4, and I'm going to grab link 4 right now, and I'm going to talk about it. It's pretty short and to the point, but it talks about some studies in natural immunity. And it was dealing
Not
with
that one.
Israel. I
Next
guess
one,
Israel
the-
was
the
one of the
mid-arc.
first countries. I guess Israel is one of the first countries to really meet herd immunity as far as with the vaccine. Are you guys able to pull up link 4, or are you
Yeah, we're
still
getting
working
there.
on that?
Yeah, I just want to interject, Supervisor Kirk, that they started very early in December, I believe, of 2020. Israel did.
December. Oh, wow. Okay.
Oh, ORG at your, go back. No, go back to MedRx. It's .org.
Supervisor Kirk, are you able to share your screen? I mean, you have this stuff up, right?
Ooh, let me see. Let's try this.
Yeah, we got it.
You got it. That's probably good. I'm not techie enough. Okay, so so if you look at the study, this is obviously comparing SARS-CoV natural immunity to vaccine-induced immunity. Again, if you scroll down to the bottom of this page, you'll see that it's from Israel. This is the direct study. And so I went to the conclusion, which is on page 3, just a couple pages down. And in the conclusion, it says this study demonstrated that natural immunity confers longer lasting and stronger protection against infection, symptomatic disease, and hospitalization caused by the Delta variant of SARS-CoV-2, so COVID-2, compared by the BTN16-2B, whatever that means, 2-dose vaccine-induced immunity. So the conclusion was that, hey, if you have natural immunity, it has a longer lasting, stronger protection. That was their study that Israel did. So I'm kind of winding it down here. I've only got a few more things to talk about.
Okay, may I, as long as you got this up, may
Yeah.
I draw, so I'd also bring up that last sentence in the conclusion. Individuals who were both
Sure.
previously infected with SARS-CoV and given a single dose of the vaccine gained additional protection against the Delta variant. So I think that's
Sure.
something we've already talked about. Just wanted to emphasize
Right.
that for.
And I was just honing in on the study demonstrated that natural immunity confirms longer lasting and stronger. But yeah, it does draw 2 conclusions, but we can't deny that from their study, natural immunity confers longer lasting and stronger protection. So I'm going to go to, if you guys want to bring up link 4, I'll talk about link 5. I only got 2 more links left, and then you guys will be done pulling up links. And so link 5, I'm going to talk a little bit about overloading the healthcare system. Let me pull this link up. Let me know when you guys have it.
Again, do you want to set up what this is going to be about so we can start talking about it?
So there's been a lot of concern about the overloading of our healthcare system, which I actually agree with and I hear. From my research and from hearing Sergenko and the public and hearing what's going on in other parts of the world, it sounds like, and the data shows that the Delta variant is moving much quicker than last year's variant. So it's much more contagious. It's hitting people harder, which is probably, my guess is probably why the surge rate and why the case count is through the roof. But although it's moving faster, we also know that because we've been dealing with this for 18 months, that it sounds like Adventist Health and the whole healthcare system in general has better treatment. They know how to handle this. They're better set up. In fact, I think Dr. Sergenko said, or Dr. Hurd said a few weeks ago that basically the mobility rate has gone from 10% down to about 1%. So that's for mortality rates from this time last year. So I just want to look at one chart with you guys real quick. And do you have it up, Dr. Sergenko? Okay, so does it say excess deaths associated with COVID-19 on the website?
Yeah, which Which chart do you want?
Okay, so scroll down and where it says weekly number of deaths from all causes, and it shows United States. But would you click on that box and type in California real quick?
That box, just drop down. There you go.
California. Yeah. So again, this is excess deaths that have occurred over the course. Looks like it goes back to 2017. And if you look at where we're at right now, Dr. Surjenko, if you want to take over, feel free. But that orange line is basically what we expect death rates to be in California. And as you can see in July, about January of 20, you start to see those blue lines go above that death rate. So that's where we saw COVID introduced. And we went through those 3 waves. We see that huge wave that we went through back in January, killed a ton of folks. Basically what this chart says is a lot more excess deaths. But then if you follow that orange line down, that excess deaths line, you'll see, kind of to Dr. Hurd's point, is we have a much better handle on how we care for this. And so the excess death rates above that orange line are very, and I'm not making light of anybody dying, but they're very minimal compared to what we've been through. And in fact, if you look all the way back to January 2017-18, that was when we had a bad flu year. So right now, it appears that we're doing better than the 2017-18 flu season. And all that to say, I understand we're having a huge spike in surge. And if you guys are open for different interpretation, please interject. But all that to say, we're getting all this hysterical media and the Democrat and people screaming, saying, you got to get vaccinated. You're killing your neighbors. You're responsible for all this. But the reality of it is it looks like we're faring better than the flu season in 2017-18. Am I misinterpreting this in any way?
So yes. The biggest proviso is the data lag that exists from the National Center for Vital Statistics. So NVSS data tends to be about 3 to 6 months, maybe even a year behind. So again, they're looking at all-cause mortality, and you have to wait, sort of the cascade of vital records at the county going to vital records at the state, going to vital records at the CDC. And so that takes time. So I think that's, like if you look at the last column that's in that graph right now.
Yeah, can you click on that last column or hover over it? Because it says data in recent weeks are incomplete. Only 60% of death records are submitted to NCHS within 10
So I think
days.
that's,
so I don't understand a year when it says it's 10 days.
So 60%, so you've got to make up for the other 40%. That other 40% can take anywhere from a month to 6 months to a year. So over time, it all becomes complete, but it takes time to do that.
Sure,
so
but
I think,
but wouldn't we agree that overall we're faring much better than right now as far as the rest of the COVID pandemic that we've been through and kind of entering that endemic phase?
I think for us as a state, yep. For us as a county, probably could be doing better. And then if we look to other areas in the United States, I think that's open for discussion.
Right. Okay, but it does look like California as a whole is faring better, and that's to my point of kind of what Dr. Hurd has said, is where we do appear to have a much better grasp on how we deal with this. So, but I guess yes.
If I could just interject, your rightmost column was still in July, and most of our surge was in August and September. So I'd love to see the data when the August data comes out.
Sure, and I think the far right column is August 21st, and it says 10 days, and then the one behind that, which is in the orange, does say August 14th.
Thank you.
Okay. And then the last link I want to look at is August, link number 6. And this has to deal with early. Supervisor Half touched on this a little bit. I know she did in her paper, which I read last night, but she touched on it a little bit in her discussion. And let me go to Google and type this link. And again, I'm sorry, the reason why I wanted to provide these links live is because last time I did this, people cherry picked what information I was putting out there when it wasn't necessarily so. So here we have the data, we have the links, we have CDC, we have everything right in front of us. So there's no question as far as what data we're looking at. Let me know when you guys are there.
Got it.
Okay, so this is interim clinical guidance for management of patients with confirmed COVID or coronavirus disease. So this is CDC saying, hey, this is what we recommend for treatment. And I haven't heard anything about early treatment other than what Supervisor Haffa kind of presented today. But if you do control find, if you hit your control find button and you type in moderate disease, there is it's a very long study, or this paper is very long, but if you type in moderate disease, you'll come to a header that says mild to moderate disease. So type in search again, or moderate disease, if you add disease to that. There you go. Okay. So if you read this, it says patients with mild clinical presentation may not initially require hospitalizations, and most patients will be able to manage their illness at home. The decision to monitor a patient in the inpatient or outpatient setting would be made on a case-by-case basis. The decision will depend on clinical presentation, requirement of supportive care, potential risk factors, yada, yada, yada. You go down and you read this, nowhere in CDC do they list what some of those preventative at-home cares are. So I used to say what I've been hearing is one thing, but what I've actually seen take place now in some of my friends' lives, two who are no longer with me anymore, is they get sick, they're not taking any preventative care, and I wish I would have known earlier, otherwise I would have recommended some preventative care to them. But then they end up going to the ER, and they're already way past this stage where they've developed pneumonia. But I know from doing simple research, just like encouraging people to have a healthy immune system, zinc, quercetin, some of these, just keeping a real healthy, robust immune system. But nobody, even my friends who are very educated, none of them have any idea of some of these supplements or things they can do to boost, vitamin D at 5,000 IU or whatever the ratio is. But so I'm curious, why haven't we, or can we maybe start like some sort of campaign where we start educating people through our public health department, some of these things that really would help with the preventative treatment. That way they're not showing up and it's kind of too late for, and really impacting the hospital at that time, and impacting the hospital at that time. So I guess that would be more of a policy thing that the board would have to do. I'm curious, Dr. Surjenko, would that be something that we could work together on to really blast out? Because like you said, I don't think this is the end of it. We're going to have years, potentially a decade of this. And I think we owe it to our community to try and make them aware as possible.
Yeah, no, I think this is, again, I would say that the science is mixed on the use of things you mentioned. Zinc as an example actually probably does have benefit. Vitamin C, lots of studies on that, including, stuff preventative, early, mild, moderate. So not necessarily as strong there despite decades of work on vitamin C. Vitamin D, again, if you're going to do that, do it early. But honestly, most U.S. citizens have adequate vitamin D intake now with supplementation that occurs in things like fortified milk. Or just, sunlight synthesis. Anyway, I'm trying to think about other things that you mentioned, but again, most people have an adequate diet that supplementation is not necessarily helpful, not necessarily harmful. Zinc is the one question mark that I would throw out there that again would bear more study, specifically within the SARS-CoV-2. So I don't know if Dr. Hurd has any other further thoughts on supplementation.
I think just to reiterate what you're saying, a healthy diet, good sleep, good exercise is good for anything. Most of the studies in other illnesses looking at vitamin supplements or things like zinc, can show a reduction of a day or two. It doesn't necessarily show great prevention type methodology over a normal healthy diet. But to Supervisor Kirk's standpoint, I think, a policy decision to say eat healthy and exercise, fits nicely with the sort of goal of blue zones, which we're trying to entertain to make the whole community healthier. I think I'd be a little careful saying, that these supplements prevent COVID. I think that would be disingenuous when we know that folks are getting sick, even folks who take care of themselves.
I appreciate the feedback. And I did look at, I take like a Men's Health vitamin, and when I look at some of the things like vitamin D or zinc, the levels are so minute that they don't really have an effect unless you take a much higher, I'm losing the word, but anyways, you know what I'm saying. So anyways, well, I appreciate the comments on that. I'm winding down. Let me, when it comes to, okay, so Dr. Hurd, don't hate me for this, okay? But I went back and I watched the board meeting, and you said something that really stuck out to me, because a lot of people were frustrated. There's so many studies out there. Like, we're inundated with studies. What studies are true? What are legit? What aren't? And one thing that you had said was that, part of the reason why we take the CDC guidance is because it's slow, it's more methodical, it's deliberate, it's not rapid changing in response. But then as I sit here and I think about that, like, okay, if that is the history of CDC, then how as an individual would people feel when this vaccine that's being rolled out is the first mRNA vaccine? There's been no long-term studies, and it's been pushed out faster than any vaccine ever recorded. And yet CDC, who supposedly moves slow, methodical, and deliberate, and they don't change fast to response, why is such the fast change with CDC?
Yeah, and I think that's a great question. And it's a question that a lot of people have wondered about the speed to market of the vaccine. And I think it was mainly a response to a pandemic surge of illness that we did not have many things to combat it. I will say that the numbers have borne out the safety of the vaccine and the efficacy of the vaccine. But your point's very valid, Supervisor Burke, in this example of the speed to market of the vaccine.
So
and then go ahead, Dr.
So the other thing I would add is, we look at the development of mRNA vaccine, is that really the story started 10 years ago when the National Institute for Allergy and Immunization was looking, or infectious disease rather, was looking for candidates for SARS and for MERS, the other two coronavirus with pandemic potential. And so when SARS-CoV-2 appeared, there was already a backbone available. And then it also speaks to the infusion of cash. When the president initiated Operation Warp Speed, he threw billions of dollars at vaccine development, just like a war effort. So if you throw billions of dollars at a problem and are able to pull energies away, resources away from other projects, you shorten that timeline and you're already building on a known backbone. So I think, again, if you think of it as an 18-month time period, you're discarding the past that had already been existed in terms of research on mRNA vaccines.
But for folks who, I've even spoken to some people in the medical field, providers who, one doctor in particular, he said that he doesn't put anything on his shelf that hasn't been tested, tried and true for at least 10 years. So even if you put a $5 billion out of vaccine, that still doesn't supplement the long-term studies. I mean, how do we justify that?
So I think, again, looking at long-term safety of vaccines, so looking at retrospectively at other vaccines that have been produced, we know that the majority of their shortcomings appear in the first year, just like with myocarditis, just like with clotting issues. And getting to Supervisor's Half comments about the VAERS data, that's where we identified those problems. Is had there not been VAERS in place, that examination of the VAERS data, then we would not have known about those. And again, those are small numbers. I think it speaks to the value of sorting through a lot of signals and finding real data, finding a potential problem and addressing it. So again, How do we find the problems? We surveil, whether it's through VAERS, through vSafe, which is the online symptom reporting for individuals who receive vaccines. There's ED, emergency department surveillance going on for vaccine reactions. So it's ongoing monitoring and knowing that the history of previous vaccines generally point out problems that occur within the year of fielding. And again, that's why Pfizer, we were expecting them to get fully approved a month and a half ago. But realistically, the FDA wanted to hold off until they had a year of data from going through stage 3 trials.
But with a discussion about boosters basically becoming an everyday part of life, the way I interpret that is basically every 9 months to a year, we're going to be introducing a booster, and there's going to be that year-long waiting period. So maybe people who are skeptic about the vaccine or the booster, that's kind of in the back of their mind is, well, what about that 1 year period? But yeah, I don't have I don't have a choice to resist this if I want to stay employed.
Okay, so did you have any other questions, Supervisor Kirk?
I have one last question, and it's for Dr. Hurd. Are you there, buddy?
I'm here.
Okay. If I lived in a third world country and I had COVID, what would you recommend I take?
Whatever you can get your hands on.
Ivermectin?
No, absolutely no. So I'm glad you brought up ivermectin. We've had a couple patients who have entered into either liver failure or near liver failure from taking ivermectin.
Okay.
One was a prescribed, and one was they picked it up themselves and gave themselves too high a dose. What I would tell you about third world countries, having just spoken to some friends in India, is what they want is the vaccine. So.
Gotcha. Okay. Now I know there's been a lot of posts on social media, a lot of discussion. And so I wanted to ask that question. And the only reason, and part of the reason why I asked it too, is at the August 13th board meeting, you did mention that in other parts of the world, that was what they had to use. And, but that was because they didn't have access to the vaccination.
Correct.
So I guess what I'm just going to end this here in the next minute. And I'm going to summarize everything that we kind of discussed. And for the most part, it sounded like there was a majority of kind of consensus as far as discussion and ideas and open to, there's more out there than just the vaccine. But in ending, we know that the vaccinated people spread COVID, and yet we're not testing them. We know the effectiveness of vaccines against Delta is give or take around 65% effectiveness. In England, who is farther along with Delta, we show more deaths than vaccinated than not. However, granted, Dr. Surjenko, maybe we could talk offline because you did need to look at that data, and I respect that. So we can get a clear thought on that. We know from the Israel study, who has had herd immunity, I guess they have about approximately 80% of their population vaccinated, that natural immunity confers longer lasting and stronger protection against infection. And yes, if you also have a vaccine, as was noted farther on down in that paragraph, it does help booster as well. We know the morbidity rate for COVID is down from 10 to 1%, and that overall excess death rates in California are dramatically lower than the first variant. However, we need to continue to look at that data as it comes forward because there's a lag in time as far as reporting. We know CDC does not recommend any early treatment for COVID when in fact there are basic things and we should be promoting and helping get the message out about boosting our immune systems. We know that the US, well, let's take that one out. When it comes to CDC, they've kind of been tested and true. They are slow. They're deliberate. They're very methodical on what studies they put out and what information they put out. However, with this vaccine, it is the first vaccine of its kind. It's the long-term side effects have not been studied, and it's been pushed out faster than any other vaccine. Granted, a lot of money has been put into it, but those are three things that those three things were actually provided to me by several doctors and healthcare providers. So based on this information, what I'm walking away from today is, first of all, I'm really appreciative to this board. Ryan, everybody, thank you for not interrupting me and Supervisor Kathleen. I know this is a hot topic and I know it's uncomfortable, but what I'm walking away from today is the vaccine, where we have some staff right now that in a very short period of time, they will be out of a job if they are not medically cleared by a doctor or if they don't provide a religious exemption. And many of our staff who are not religious, I don't want to force them into being liars and having to come up with information that's not true, all for the sake of retaining their job. And so we have a very select portion of our workers who are going to fall into this, where they're going to have a job. And I do believe that as this continues, if there's not enough reasonable, logical pushback, that this will eventually come onto most, if not all, employees. Last time I said that, I was criticized for not looking at what's in front of us. And lo and behold, 3 weeks later, here we are, and we're already talking about mandated vaccines and firing staff. So I know where this is headed. So what I would like to see, based on the data, is that all staff are vaccinated and that we provide, or sorry, vaccinated, that's the worst thing. I would like to see that all staff are tested and that all staff are provided N95 masking, and that if possible, that we do testing to see if they've already had the variant, and that would provide them some natural immunities to have reasons not to get vaccinated. But I will not, today or any other day, ever support a mandate, which is going, whether it's state or federal. The buck stops here as far as I'm concerned in my seat. I will never require any staff to ever be vaccinated, but I think it's reasonable to test every staff member and to provide them with N95 masks. And so that is what I'm requesting from this board today.
All right. So I do want to give an opportunity for the public to speak. We'll take a 10-minute break. Be back here at, say, a 9-minute break. Be back here at 11:45. Okay. Let's call everyone back to their seats. We're going to go ahead and get started again. Where we left off, we had talked, excuse me, could you take your seats, please? Sir? Thank you. So where we left off, staff had given their presentation, and now we're on to the point where we'd like to hear from the public. So go ahead and open this up to public comment. If you'll go ahead and come to the podium here, you can have 3 minutes. Hello, welcome.
Yes, my name is Alex Abarca. I'm a mental health professional here in Tuolumne County. I'm a Merced native. I moved over here 6 years ago, and I was told I wouldn't be a flatlander after 2 good winters. That's what I was told. So I guess I'm no longer a flatlander. Moved over here with my wife and my kids, and I've been a mental health administrator in large healthcare organizations for 13 years, and have worked in the field for 20. So I was going to speak about some of the data that's been discussed to this point. So I'm not going to go there, given that it was discussed in much detail. But what I will discuss is the anecdotal things that I've discovered in my practice. So I treat, most of my patients are from this county, and I've had about 5 patients that have taken the vaccine, specifically. Of these 5 patients, 3 of them have continued with chronic type symptoms that have not gone away. This is after several months. Excuse me. So anyways, so this ranges from chronic pain, fatigue, what's called brain fog, and I consult with doctors all the time. This is a term being used by them, brain fog or COVID fog. This difficulty with thinking or remembering, kind of short-term effect. Also aphasia, where they're having trouble speaking the words that they're thinking. So these are my patients specifically that I've observed over time. And I know we've been talking about a lot of data, both locally and nationwide, but I'm speaking about the things that I see in my practice here and in speaking to community members, because I know a lot of people around here. So the one thing I find appalling, it's actually shocking to me, to hear, with all due respect to all our public health experts here, I'm not hearing the other side of the topic, just like Kathleen said. There isn't much talk about alternative strategies for healthcare, for improving our health. All I'm hearing is take the vaccine. Also, when releasing data to the public, about, specifically about people in the hospital that have either gotten ill or dying. I would appreciate data about comorbidities, because if we're gonna start talking about demographics, and speaking of vaccinated and unvaccinated, I would like to hear how many of those people had obesity, other comorbidities. That would be important to know for the public to make an informed decision. And in regards to mandating shots, look guys, my hearts go out to everybody that's experienced deaths, especially COVID-related deaths. I know of a few. And what I would say is, you don't want the bereaved to be looking in your direction when it comes to decisions like this, where you're deciding what somebody does with their public health, their health decisions. You don't want the bereaved to be looking at you as the culprit of some ailment to their family member, be it by a disability or a death.
I'm gonna have to stop you there. I'm sorry, that was 3 minutes.
I understand. So just my respect to bereaved.
Thank you.
To the bereaved, okay?
I have to be respectful to
I hear
everyone
you.
and
But I just don't want
keep us
you
to 3
guys
minutes.
to be the target
Thank you.
of families.
Thank you. I'm
grieving.
sorry, we have to be respectful of the other people that'd like to speak. Thank you. Hello, welcome.
Good afternoon. My name is Gunther Sue, and I'm a resident of Tuolumne since 2014. I'm a retired military physician, residency trained in internal medicine, and fellowship trained in infectious disease. A lot's been said so far, a lot of the data, so I won't rehash that. But I can say that, at least from what I see, having reviewed literature, mostly from the CDC, the vaccine has been effective for now. And as we see the Delta variant coming, that obviously raises a lot of concern, especially studies done in other countries. The other thing is not everyone responds to the vaccine, and we are still not entirely sure of the duration of the protection of the vaccine, hence the talk about boosters. So what I want to at least bring up is also is that the safety of this longitudinally still remains to be established. What I will bring out is a number of studies are coming out this summer, which I guess Dr. Surgenko referenced, that imply that there is some cross-protection of people with Delta variant with the vaccine. However, more recent data in the numbers show that this is dropping down to the neighborhood of the 40 to 70% instead of the 80+% as we'd seen in the past. So with that, I'm very concerned about the way forward. Unless they develop new vaccines to be able to tweak them to better handle the variants that are here, Delta, and the future ones coming, I think that the fact that the vaccination becomes more of a moving target, and that trying to mandate something from old technology or vaccines compared to what's coming down the pipeline does seem a little bit dangerous, just with the fact that you are immunizing for something that's rapidly changing and we're not staying ahead of the curve. And last of all, I believe natural immunity is real, although testing against the Delta variant is still needs a lot more data. And lastly, I believe that employers, patients deserve to make their own health decisions. They can consult their family, themselves, and their physician, and that needs to be a personal decision, not mandated by politicians. Thank you.
Thank you.
Hi, I'm
Hello.
Pete Akel from Big Oak Flat. Supervisor Half's proposal talks about the importance of early treatment for COVID-19 with ivermectin and about the effectiveness of a strong immune system. I'd like to share with you an example from India, where a few states broke with the WHO, the WHO's guidance, and tried early treatment with ivermectin. The nation of India has been seeing a lot of COVID-19 cases, and the distribution of cases across different states in India is instructive, as the case count varies widely. For months, India's largest state was Uttar Pradesh, 230 million people, so 2/3 the size of the US. They've been distributing free ivermectin for home care. Also, the state of Bihar, 105 million, is distributing ivermectin. Looking at the latest COVID-19 data for India, I see that Uttar Pradesh has only 239 active COVID-19 cases. Compare that to the state of Maharashtra, which is not distributing ivermectin and is only about half Uttar Pradesh's size, but it has 54,000 active cases. So we're looking at 239 cases in a state using ivermectin compared to 54,000 in a smaller state that's not using it. Similarly, the state of Bihar has 80 active cases. Compare that with Karnataka, about half its size, has 18,000 cases, active cases. So we have 80 in a state using ivermectin compared to 18,000 in a smaller state not using it. I was not able to find how Maharashtra and Karnataka are treating COVID-19, so I have to assume it is as directed by the WHO, which would mean vaccinations and no early treatment, as we've been discussing here. There are other good examples I could have covered from Argentina, Mexico, and elsewhere, but unfortunately I had to cut those to fit this in 3 minutes. Tuolumne County within California can be like Uttar Pradesh is within India. We can dramatically lower our case and death counts compared to other counties. We can accomplish this by doing something similar to what Uttar Pradesh is doing by, quote, distributing free ivermectin for home care or something equivalent. This would address what Supervisor Half mentioned in her proposal as early treatment at home. If we could also distribute or encourage a small selection of vitamins, D, zinc, C, which Supervisor Half covers in her section Immune System Health, then we could see an end of COVID-19 problems in this county. And this can all be done alongside a voluntary vaccination program. Thank you.
Thank you. Hello.
Hi. Thank you for the opportunity to express my COVID concerns. With approximately 50% of eligible Americans fully vaccinated for COVID-19, it suggests that about half of the country chooses to or possibly were coerced into vaccinating. This also means that about half the country chooses not to. Whichever side of the fence you are on, please remember the government has no constitutional right to decide what we choose to put into our bodies. I ask you, our elected county officials, to seriously consider the following. Masks may help a little. If a person is sneezing or coughing, however, such a person should not be at work or out in public anyway. Otherwise, masks are basically useless since they do not efficiently capture expired virus, and they may be harmful as we are inhaling our own expelled carbon dioxide, a waste product, over and over again instead of breathing in necessary, nourishing oxygen. And the emotional toll for all ages wearing masks is yet to be known. Since it is now clear that the vaccine does not prevent the vaccinated person from contracting and likewise spreading COVID, is the county prepared to test every county employee on a regular basis, not just the unvaccinated? Keep in mind, those vaccinated may test positive from the vaccine. The natural progression of a virus is to mutate into different variants. The COVID-19 mutation is being driven by the vaccination. The variants are more contagious, but as with any virus, the variants have become less and less severe, especially to those who are unvaccinated. It is of serious concern that we are ignoring the multitude of respected doctors who are putting their careers on the line by speaking out against what they know is wrong. Hospitals are refusing to use an effective drug with a 40-year safe track record used on humans as well as animals, and which is considered one of the 3 miracle drugs alongside aspirin and penicillin to treat and heal people. This is criminal. Ivermectin is working. If using a drug that has not been approved to treat COVID is prohibited, then how can using a vaccine that had not been approved make any sense? Contrary to what we may have heard, the numbers of unvaccinated in the hospital are widely inflated now due to curious changes in CDC reporting guidelines, which include those recently vaccinated. If you really want to do something, I ask you, please consider a countywide campaign to educate on the value of health and nutrition. You might start with the tragic impacts of junk food, fast food, and soft drinks, which greatly compromise your natural immune system. To improve immunity, encourage healthy eating and vitamins.
Sorry. Thank you. Hello, welcome.
Hello, my name is Michael Royce. I don't know how much more can be said about data and science, so I'm going to speak from the heart. As far as what a mandate like this would affect my family, my ability to feed, shelter, and live my life. I ask you to find your humanity and respect me so that I can make my own decisions on what's right for me and my family. Okay? So please look to that. Look to your heart. Look yourself in the mirror. It's going to affect a lot of people. Am I going to have to move? Am I going to be able to find employment? I believe I have the right to make choices for myself and my own family. I can look up the data. I can make wise decisions. I can eat healthy. I can exercise. I've always done these things. What's changed now? So I just ask you to consider that aspect, the humanity aspect. That's all I have to say. Thank you.
Mr. Royce is certainly compelling. Thank you. We have to ask ourselves why, I'm from Groveland, by the way, why does the USA have the highest death rate for COVID in the world when we spend more money and supposedly have better experts? And it's because the suppression of the idea of early treatment for people diagnosed with COVID. So I would refer you all to the testimony of Dr. Peter McCullough, and he knows more than any doctor you have met or ever will meet in your life. He's a practicing cardiologist. He's also treating COVID patients regularly, and he's a university professor in Texas, one of the most well-respected researchers in the world. He says through the studies that he's done in collaboration with scores of other doctors and other studies that he wasn't involved with, that there will be there has been an 85% reduction in hospitalizations with early intervention after someone has tested positive for COVID, but before they have been hospitalized. So the idea that Dr. McCullough is conveying is that we should implement a policy of early intervention, which we're not. And you can look, I got this document from the county right here today. There's not a single bit of useful information in this document. People wasted their time producing this about what to do if you've caught COVID, other than wait until you're hospitalized. So given this, Dr. McCullough recommends a list of personal health care advice, what to do at home to take care of yourself. And even more importantly, a list of clinics. And there are clinics all over the country, including here in California, that provide COVID early intervention treatment. And there are many treatments, not just ivermectin. There's many. There's the steroids. I'm not a doctor. I don't know them all. But you can go see what Dr. McCullough says about this. Okay, and finally, look, if you've already had COVID, you're immune. The studies show this. It's not controversial. And in spite of what Dr. Sarjenko says, well, we don't know how good your immunity is. I'm sorry, they have a study of 67,000 people in Israel, and natural immunity is far better than the vaccine. So please exempt employees that have already had COVID. Thank you.
Okay, thank you for listening to us. I'm going to try to get this in under the shot clock here. From the CDC website, adverse effects from the vaccine. I'm just going to read from it. Anyone can access this if you wade through what they have online. As of August 27th, there have been 13,911 deaths, 14,327 life-threatening adverse events, 18,098 cases of permanent disability, and over 133,000 hospitalizations and emergency room visits following COVID vaccination reported. Facebook is censoring me from reading this, so they're blocking it right now as I'm reading this. So I can't finish it. But anyways, that's the data. According to 2 CDC whistleblowers, this VAERS data is underreported by 10%. It's soft reported and it's not required to be reported. So they say at least 40,000 people have died from the vaccine and they suspect as many as 100,000. I'm going to switch and go over here real quick. You read about this in the papers a lot, but here's 2 celebrities. They get the attention. Fully vaccinated New York Jets star Vinnie Curry diagnosed with blood clots, out for the season. That was from August 25th. And then if you guys read about Oscar de la Hoya, he's in the hospital now. He's had both vaccinations and he's in serious condition. And then the last thing, I think I can get this in, ivermectin, a multifaceted drug of Nobel Prize honored distinction with indicated efficiency, I'm not sure if I'm saying that word right, against a new global scourge, COVID-19. And it says in 2015, the Nobel Committee for, I can't see this, it's so small, for Physiology and Medicine, it's in its only award for treatments of infectious diseases since 6 decades prior, honored the discovery of ivermectin, a multifaceted drug deployed against some of the world's most devastating tropical diseases. So, thank you.
Thank you.
Hello again. So first I want to thank Supervisor Brandon and Goldenberg for attending the fire and watching the efficiency of our first responders. That's awesome. And I want to thank Anaya Kirk for attending the rally of up to 200 healthcare workers who were protesting the vaccine in the healthcare industry, that it be mandatory. And he was concerned about his constituents. Thank you, Supervisor Kirk. So, the board gives thoughtful consideration to the protocols needed to combat the sickness. No doubt about it. You guys, I see you watching. Consider the concept of promoting good nutrition and healthy lifestyles instead of promoting fear with data and statistics that would cause major concern, fear, and hysteria. That's what the statistics, every time I come here, it's not good news. The local health authorities were running a public service announcement on the radio where a young child questions her mother as to if she could eat 12 packs of sugar. And the mom naturally says, well, no, honey, that's bad for you. And she says, well, Mom, that's what you just did drinking that Pepsi. So this was something that the health department was doing. I haven't seen anything like that in relation to COVID. How about something like encouragement as to how many people are working and healthy? Every time you give those stats of how many died and how many, how about 30,000 are working and are healthy and are out there? Yay, so we can cheer on and go, yeah, we can make it. We can overcome this together, Rebecca. We can do it together. And how about there are positive things you can do to combat sickness like exercise, good nutrition, and going outside and working in the sunshine. Those things are really effective, believe me. Now, about the positive impacts of smiling, how about that? You can't do it because you're wearing masks and telling each other, hey, right on, it's good to see you today. Or the idea of using scripture instead of saying, we should need to pray about this, say something like, fear not, for God is with you. Fear not, he can take us through this. There's a narrative that you talk about all the time, and it is, there are these many cases of the sickness. There's this many deaths. And you go, oh my gosh, what are we going to do? Well, doggone it, stand up and be strong in the power of his might, if you want to know what I think. But instead, stay home, and if you go out, wear a mask, and make sure you get the vaccine. And then there's Governor Whitmer in Michigan that says, stay home, but we're going to ban paint, and we're going to ban all the things you need to fix up your house or plant a garden. Hello, does that make sense? I don't think so. So anyway, stop the government overreach and the shaming of strong, positive people. People that don't wear masks are strong and they're healthy. That's why they don't have a mask on, or they'd stay home because they're smart. Hallelujah. Thank you very much.
I'm Frances Kessel. I really didn't plan on speaking today. My husband was going to. And I know one thing he was going to bring up, and I did. So I just wanted to bring it to your attention. I think it's a matter of a personal decision where you have to weigh the risks and benefits as far as getting a vaccine. And I would certainly encourage a lot of people to, especially somebody who is obese or elderly. But the fact is the adverse effects from the vaccine are being underreported. In many cases, theirs takes 30 minutes for a doctor to report it. They're not necessarily going to do it. But what concerned me, and this is directly from the OSHA website, DOL and OSHA, as well as other federal agencies, are working diligently to encourage COVID-19 vaccinations. OSHA does not wish to have any appearance of discouraging workers from receiving COVID-19 vaccinations, and also does not wish to disincentivize employees' vaccination efforts. As a result, OSHA will not enforce 29 CFR 1904's recording requirements to require any employers to record workers' side effects from COVID-19 vaccinations, at least through May 2022. We will reevaluate the agency's position at that time. That is seriously not good. That's all.
Thank you. Hello.
Mr. Chair, my name is Paolo Maffei, and I was looking for my vaccination scar that I received as a child, and most of the people my age, mid-80s, have that. It's disappeared. And the truth is that smallpox disappeared. It disappeared because people got vaccinated. It was that simple. So anyway, we thought we were nearly through this thing. The unvaccinated, in my view, have set us back a year. We hunker down again, and so the economy suffers. The ICU is full, including at least one person who was vaccinated. So don't get a heart attack because you're likely to die. There's no room. I mean, how unnecessary this is. I can't address anti-vaxxers and science desires. Their awakening will probably happen when someone close to them gets sick, or hopefully not on their own deathbed. I will address you, responsible for the county employees. You're responsible for them. And in my view, it's irresponsible to have them go to work alongside co-workers who are not vaccinated, and people who choose to put others at risk of a virus that's mutating every day. In this morning's Union Democrat, there's a new one, the Mu virus, whatever that is. So we're no longer at Delta. And it's more viral and more deadly. Every new one is more successful as a virus. And that virus they can take home to their families, to their elder parents, and to children who are as yet unvaccinated. And it's not about being sued, although that's a distinct possibility. It's a moral responsibility. Exercise the power you have invested in you and declare simply, in my view, get your shot or stay home for unpaid leave. Simple choice, a sore arm for a day to save people's lives. Thank you.
Thank you.
Good morning, Board. I'm a Tulane County resident. Thank you for your jobs you guys do. I come here as somebody that believes that the government doesn't have the right to tell us what we do for our medical choices, and I hope that that continues here in this county. I know that the loopholes that they allow for status for people to decline from getting it, from being forced to take it, are very complicated and hard to do. I know firsthand first responder people that have worked through the entire pandemic without getting the vaccination that are now struggling hard to meet the requirements of getting an exemption. So it's like the exemptions are there, but they're in such an impossibility that really not that many people can actually achieve that status. she has a really bad blood disorder, and the doctor barely still gave it to her. And yet this vaccine has been proven not to have been studied on people with severe ongoing issues. But yet the doctor was not willing to do it, but did do it because they were going to scrutinize his license. So it's not that they can get it, it's just complicated to try and get it. And so it's not fair to say that people that want the exemptions can truly get them easily. And like Anais was saying, just because you have a strong desire not to get the vaccine because of where you are health-wise and what your choices are, does not fit into the exemption that they're even allowing. Also, as a free society that's governed by themselves, the majority of the people here show you where the majority stands as towards vaccination. Also, the people that want to get vaccinated will get vaccinated. It's available. You can get it for free from the health department. They do lots of vaccinations. Forcing people to lose their jobs or choose and coercing them because they don't want to lose their job or their pensions, that's not fair. That's not right to the American people, the people that live here that have to provide for their families. So, as a member here, and you people that are here to help serve us, I ask you to look at the majority of the people here as your majority of your constituents that are concerned about this and what the majority feel and are expressing today. Thank you.
Thank you. Hello.
My name is Ryan, and I come here as a concerned citizen. I'm going to be losing my job because I choose not to take this vaccine, and after research, I will choose to not take any more of any other, just because I hear a lot of statistics and I hear a lot of people squabbling about the truth. Well, the truth is we're not standing together, and we have a choice as an American, as a person, to make that choice, to decide. You know, just like people have choice to, you know, change who they are sexually or not, and or to choose, you know, by gender ratios and things like that. Well, that's their choice. You know, my body, my choice. So I'm making that choice, and I'm going to stand that way to the very end. So I hope you guys make the right choice.
Thank you. Welcome.
Afternoon, Board. Sheriff Bill Pooley. There's a lot of, I know you know this, but there's a lot of angst and anxiety amongst staff as to what steps you may or may not take, and I know you haven't made a decision where you're gonna go. But first and foremost, I wanna thank my staff for being out there every single day, despite the risks to them, their families. Obviously, some of our staff do not have the luxury of staying home or working out of an office. We're out with the community all the time, and I wanna thank all of my staff for being out there. Having said that, I think it would help staff if, and I believe you plan on doing this, but I'd be remiss if I didn't say it, that don't make a decision in a bubble. We have, my entire command staff would be happy to speak with you about some of the things we have in place, say in the jail. We worked with public health. We have, I think, a very good track record when it comes to the prevention of this disease. I think that there are a lot of impacts that may or may not occur depending on where we go as to how will we dispatch. You know, how will this affect fire, ambulance, the deputy's response? And I just ask that if you're going to make a decision, please come to us. We want to educate you as to some of the things we have in place, how it may or may not affect us. And having said that, we're going to still continue to go out every day, do our job, and protect the public safety. And if you have any questions of me, I'd be happy to answer them.
Thank you.
Thank you.
Questions for the sheriff? Yep, thank you. Okay, is there anyone else from the room that would like to speak? Yep, come on down. Welcome.
My name is Robert Carabas, local resident. What I'd like to say is that there are a number of things that I feel strongly that we should be considering. we have 5% of the world's population, and yet we have 20% of the world's cases. We have 15% of the world's deaths, and at this point, between 140,000 and 150,000 people are getting COVID every day. Whether they end up in an ICU, that's another matter. I regret that this has become such a political issue. I don't believe this is a healthcare issue at this point, because I think we have misdirected our efforts as people. One of the things that I think we should be struck by is that the CDC has stated that due to the anti-mask effort in the United States, of the 660,000 people who have died, 400,000 lost their lives unnecessarily. And of course, the unvaccinated in America allow the spread of COVID, and also they are the natural source of variants that are developing and are being feared by our healthcare providers, because they know that if we get a variant that can get around our vaccinations, that we will no longer have half of the people in the country helping us. I urge everyone to get vaccinated. If we were going to speak about liberties, if I took your car away, you would have lost your liberties. If you take a vaccine, you're simply protected, or yes, well protected against COVID itself. And at the same time, you're helping your community. It is what I believe is what patriotism is about, is supporting and protecting our fellow Americans. Thank you.
Thank you.
Hello, my name is Paul Royce. I'm not very good at public speaking, but I need to tell my story. A couple months ago, I tested positive for COVID, and I have pre-existing conditions. I've had my left lung removed, and I have COPD, and it's a serious thing, and you're probably wondering why I didn't get the vaccine, but I have autoimmune problems too. So I chose to just isolate, and my wife was good with that too. But when I tested positive, I became very sick, and I could feel myself going downhill. And my wife and my daughter-in-law found an online doctor that prescribed ivermectin. And I took it for 5 days, 5 pills a day, each day. And one day after taking the pills, I started feeling better, because it had gone into my chest. And I know I was headed to the hospital, but I didn't want to go see a doctor at the hospital because I'd spent months going through surgeries, and I had a fungal infection in my lung, is why they removed it. And I didn't want to go to the hospital anymore. I'd gone through enough of that. So the ivermectin was successful, and I'm here to tell you that today. And I don't care what doctors say. They're trying to take it off the market. It works. And you can overdose on anything you want, and it's going to ruin your body, okay? But if you take a right dose, and there were no side effects from ivermectin. So I'm here to tell you, do not mandate vaccines. That's all I'm saying. It's the wrong thing to do. This is America. Don't take people's rights away. So that's about all I have to say. Please consider that. Thank you.
Thank you. Okay, if there's no one else from the room that would like to speak, we'll go. I believe we have some people that have been waiting patiently on the phones, so we'll go ahead and start there. Hello.
Good morning.
We can hear you. Welcome and thank you for your patience.
Thank you very much. Thank you for letting me talk to you guys this morning. I wanted to address one issue more than others, and that's you probably heard the country Israel mentioned time and time again. And that's because their case rates are higher now than they were last year. Their vax rates are higher now than they were last year. So that begs the question, what's going on? They were given as an example of pandemic response in the world. And now they are no longer considering 2 shots to be fully vaccinated. They now want the booster to be considered the fully vaccinated level. Their breakthrough cases are alarming. And according to what I can find, at one point they had 78% of their population above 18 years of age vaccinated. So far ahead of us, making, us look like we need to catch up. But if we catch up to those rates, can we expect those same results? Because again, they're dealing with Delta variant, the same variant we're dealing with. And there is also some people talk about the variants, but not very many people seem to know how many there are. There's the Alpha, the Beta, the Gamma, the Delta, the Eta, the Iota, the Kappa, the Lambda, and the Mu, plus 4 who have not been given phonetic names yet. And all of these seem to show increased resistance to the effect of the vaccine. They are showing mutations that are changing their spike protein, which we designed our vaccines off of. And that brings me to the point that we're going to now force possibly people to take vaccinations in our country when we just heard Dr. Hurd say that if you're in a third world country, take anything you can get your hands on. Well, if we have such a surplus here and we have such a hesitancy here, how are we not also noticing that our place in the world seems kind of selfish? We have all this vaccine, we don't want to give it. Israel is already fully vaccinated, yet they want booster shots. So we're kind of creating a narrative that we don't care about the world. We'd rather force people here to take the vaccine that don't want it than provide it to these people who are desperately awaiting anything in the third world country. One more thing is the comorbidities. I don't see any information, as some other people have pointed out, coming from public health as to what the number one comorbidity is and how we may, effectively ease those comorbidities before we became a statistic. As far as I understand, obesity would be far and away one of the most troubling comorbidities, and I have yet to see anything addressing body mass index of patients, overall health as far as considered towards a healthy body mass. It seems to be take the vaccine and you're good to go, but at the same time, ignoring the comorbidities, which seem to be alarming because there is statistical trends that seem to show that people are more at risk if they have certain pre-existing conditions. Thank you.
Thank you.
That's
Okay, hello and welcome.
Hi, thank you for giving me a chance to speak. I'm calling not only as a Tuolumne County resident, but also a Tuolumne County employee. I wrote a letter to the board several weeks ago in regards to my stance on the mandating of the vaccine and also of the mandating of the testing. I won't go through the whole letter just because a lot of what I was speaking of has been covered today. But there's a few things that I did want to mention. The first questions that I have as a county employee is if this vaccine is mandated and something does happen to an employee, who is going to be liable for that? Who's going to be liable to take care of workers' families or pay their mortgage or pay their bills if they're unable to work? Who's going to be liable for those medical bills? The second thing I want to mention is in regards to the testing. Now, we all know, we've heard it here today many, many times, that vaccinated individuals can still get COVID, they can still spread COVID. And although I will state that it is absolutely shown in our data that it's less numbers of vaccinated individuals being hospitalized and less are dying, I just wanted to point out the fact that they are still being hospitalized and vaccinated individuals are still dying. And so with only testing vaccinated employees, or excuse me, only testing unvaccinated employees, that not only sends a wrong message, it's skewing numbers more than it already is. If you're only testing unvaccinated, of course more unvaccinated are going to be showing positive. If a vaccinated individual is in close contact to a positive, it's not even recommended that they vaccinate as long as they're not showing symptoms. So they could absolutely be spreading it. They can absolutely, and we're not testing for that. And so that just doesn't make sense to me. I think that really where it boils down to is just discrimination, and it's widening that line of unvaccinated versus vaccinated. I also want to mention in the letter that I wrote, hopefully you have all read it, I'm not denying that COVID is real. I know it is real. I know it is dangerous. It is dangerous to many people. In no way am I trying to downplay the legitimacy of this virus.
I think you cut out there. We don't hear any. If you're speaking, we can't hear your voice. Okay, she had about 16 seconds left, so I guess hope that will suffice with her comment. I guess if you can't raise her, then see if there's someone else waiting. Hello, welcome.
Hi. It's always been the practice. I thought that we were supposed to identify ourselves before we spoke. My name is B.C. Smith. I'm a former county employee, and I am a resident of District 4. A lot has come up in this morning's discussion, and I have a lot of mixed emotions about all of this. The one thing I would like to comment on is somebody in the room made a comment about how obviously the numbers of people in the room that are speaking to you on behalf of not requiring the vaccines and not requiring masks, the fact that there were so many people in the room of that persuasion must mean that that is the majority view in our community, and I don't think that that is quite a fair, or certainly I don't even think it's a factual thing. There are plenty of people in this community who are very much in favor of mask wearing and encouraging the vaccines to be implemented as far and as wide as we can, so that we can help be a part of the efficacy of getting this thing to turn around. A couple of things I want to mention. I think that the sheriff had a really good point that you can't make this decision in a bubble, and that you should be meeting with as many of the department heads and other key voices in getting input from the employees to get a strong impression of what is already in place and what you might be able to encourage to be in place. Personally, I believe that if a person has chosen not to be vaccinated, that person should be willing to undergo regular testing and to wear a mask. I think everybody should wear a mask. That's what I do, and many of my friends do the same. And the gentleman who said that wearing masks was a symbol of fear, and that people who didn't wear masks were positive and weren't afraid. I would love to sit down and talk to that man and hear his bio and share my bio with him, because I'm not afraid of this at all. I'm just trying to do my part for the we that the person from Human Resources spoke of this morning. It is a mindset of taking care of the we. What is the greater good, and how can we come together for a program that will serve us as quickly as possible? We did beautiful. with Washington Fire. We were doing exactly what we're supposed to do as a community. But we're not doing that with COVID. Instead, it's become the dialogue of me. And I don't understand that. It is.
I'm sorry.
Am I there?
I have to stop you there. Your 3 minutes is up. Thank you
bet.
very much for calling.
You got me. Look in the mirror. Are we a we or
Thank
are
you.
we a me?
I have to stop you
Thanks,
there. I'm
guys.
sorry.
Good luck.
Thank you.
Got it. You bet.
Okay, is there anyone else waiting to speak? Okay, we do have more people that would like to speak. So we're talking to folks that are on the phone right now, so we'll let them have their time. If it's we did close the speaking for the room, but if it's okay with the board, we can open that up again. Okay, but let's let the folks on the phones speak first since they've been waiting. Okay, please continue.
Hello.
Hi, you're on with the board. We can hear you.
Okay, thank you. This is Marvin Keschner. I am not present in person because I'm not willing to be in a room where many people are unvaccinated and not willing to wear a mask. I owe this to my grandchildren who cannot be vaccinated. COVID's not a joke. I have friends, I have relatives who've gotten COVID and are still suffering long-term effects. COVID risks are real, and please do not characterize them simply as fear. In my opinion, personal freedom ends when your actions threaten others. You can't go to school unless you're vaccinated for a major disease. People don't want to work where they can be easily exposed to COVID and then bring it home to their families, especially their young children who cannot be vaccinated yet. In addition, the Board of Supervisors has a responsibility to county residents. If a restaurant on Washington Street chooses not to require vaccinations and masks, I can choose not to go there. But if I need a building permit, I have no choice. I must go to that office. You have a responsibility to make that area safe. Vaccines and masks are the best tools we have available to us now. Let's use them. Companies across the U.S. are using these tools to create a safe workplace and also to protect themselves from being sued. Masks and vaccines together are 10 times more effective than either one is alone. Also, companies are deploying HEPA air purifiers in rooms with limited ventilation. Please do this. Please install these in county offices. The cost is really quite low. As Supervisor Half knows, I support alternative medicine. I support developing treatments for COVID. We should do that. That's not the question that's on the table. The question that's on the table is what tools do we have now, not what we will have in the future, and how do we best use those tools now to make our work environment safe for our employees, their families, and people who walk into the offices. Thank you very much.
Thank you. Hello and welcome.
Hello.
You have an echo, so if you could turn the audio off on your listening device and just speak through the phone, and we can hear you.
I thought I hit the off button, but that's fine. My name's John Kiter. I'm on the phone to speak about mandated vaccination requirements for county employees, and I urge you in the strongest terms possible to oppose such a requirement. It would be unethical to favor imposing a coercive requirement on our county employees. Unless a vaccine is found to be 100% efficacious and 100% safe, there'd be no need for coercion. People would line up to take it as a personal choice. But instead, some governments convince themselves they can impose a mandate on their employees in a classic bait and switch maneuver that's clearly unethical. hire an employee under one set of conditions, then impose new conditions under threat of loss of employment and income. It is coercion, pure and simple. Please, please, please oppose the imposition of such a requirement on our valuable county employees. Let personal freedom be a hallmark of Tuolumne County, not coercion and compliance. Thank you.
Thank you. Hello and welcome.
Hi, good morning. My name is Jessica Lanier. I am a registered nurse. I have my bachelor's in nursing, and I'm also certified as a public health nurse. I am actually speaking as a former resident of Tuolumne County. I was born and raised there. I grew up there. And last year, when all of this started happening, my family kind of saw the writing on the wall, and we saw forced vaccinations coming down the pipeline, and we decided to move. And we left a lot of our family there, and we do miss it. But I wanted to kind of echo some of the opinions that have been shared today, and the data and the facts that have been shared today, and a perspective as a public health nurse. I worked at our local prison there as the infectious disease nurse, and one of my jobs was to draw what are called titers on inmates, and to make sure that they had documented immunity to things such as chickenpox, for example. I want to ask you to think about all of the people who have had COVID and have documented immunity already, who are being forced, if a vaccine mandate was to be passed, who are being forced to get a vaccine that would never be forced in any other type of virus. If I had a client or a patient who had documented immunity to chickenpox, I would never recommend that they get a vaccine for chickenpox. That would never be good practice, right? That doesn't make any sense. So that's one element to consider. The other is I know this has already been brought up, but the data of Israel, the highest vaccinated country in the world, is experiencing the highest amount of breakthrough cases, an unprecedented amount of hospitalized, very sick COVID patients. And then you look at India, and I heard that data was already brought to the meeting, so I will not repeat it. But if you go and truly search what India has done to significantly drop their sick COVID patients by using very safe medication and very cheap medication such as ivermectin, it is something to definitely consider, and something to make available to people in Sonora. And I'm pretty sure that no pharmacies in Tuolumne County are filling it right now. I encourage everyone to go look into the COVID-19 Critical Care Alliance online. You can write that down. It is an incredible resource of doctors that are effectively treating COVID in outpatient and hospitalized settings with proven protocols that are working. I also, this is something that really bothered me when I did live there, is the fear. The daily death stats that are being given to our community, the daily positive cases. What if we also shared the daily people that maybe tested positive and were asymptomatic, or the people that were completely fine? If we're going to share how many people die,
Jessica?
how about we also share how many people were okay with that?
I have to stop you. I'm sorry. Jessica, I have to stop you there. I'm sorry. Your 3 minutes are up. Thank you very much for calling in.
Thanks.
Hello and welcome. We can hear you.
Hi there.
Hi.
Hi. My name is Amy Peterson, and I am a teacher in the community. I just wanted to mention a couple of things, just for the county to possibly be proactive, and a couple of things for them to think about. Just this week, we've had a couple of people that have passed away that were fully vaccinated and that wear their masks. People on campuses that have been vaccinated are now testing positive for COVID. and having to quarantine and quarantining multiple people when they're fully vaccinated. As the nurse that just came on and spoke said, it's really, really important that we look at the fact that when people go and get the vaccine and they sign the sheet that gives their okay to get the vaccine, they do sign that they can still get it, carry it, and pass it. And we've noticed lately, and I know that some county workers have said that the county doesn't want to report the fact that people that are getting the vaccine are getting the second round of the coronavirus twice as bad. And we've also had some deaths from that aren't reported. So the thing that worries me with pushing these mandates is the fact that we don't know the long-term effects, but they're starting to come out right now and people need to pay attention. It's sad to know that we have to be coerced into doing something and not knowing the facts on it. And again, a vaccine, like the last nurse said, it eradicates a disease. This is not eradicating anything. It seems to be starting to make a difference on the other side where more people are getting sick and more issues are starting to happen. So I really hope that we pay attention to those things and that we know that the vaccinated can still pass it. I wanted to talk about the flow chart that the county put out for the public schools, our county health department. For one, it's extremely discriminating, but we've seen at a local school this last week just how poorly that flow chart works. So discriminatory, number one, because students who are a close contact to somebody who tests positive, if they're vaccinated, they come right back in the classroom within 24 hours. If they're not vaccinated, they have to test to go back in the classroom and then test twice a week for 10 days, and they're excluded from extracurricular activities. So if you can go sit in a classroom with students and you can go do PE, why are we pulling the extracurricular activities? I don't know. Is it a way to try to push everybody to vaccinate? I don't know what the answer to that is, but it's extremely discriminatory, and it caused a shim sham in one of the schools this last week, and you guys can look that up. So
Amy, I have to stop you there. Amy, your 3 minutes are up. Thank you very much for calling in.
Well, thank you, and I hope you look into those things. Thank you very much.
Thank you. Okay, do we have anyone else on the phones? Okay, so there was one person, I lost track of where they went, who wanted to speak. If there's anyone else in the room that would like to speak, would you please line up on the wall? Because we do need to continue on with the meeting. So it gives us an idea of how many folks are left wanting to speak. Yeah. Hello, welcome.
Thank you, Mr. Chairman, members of the board. My name is Cooper Kessel. I've been an employer in Tuolumne County for over 40 years, and I wanted to speak briefly today about informed consent. And my personal opinion is that a choice that a person makes about their own health care needs to be made by them, not mandated by government. What I would look forward to from government is accurate information so that an accurate choice can be made. What I wanted to bring to your attention today is a piece here related to the Occupational Safety and Health Administration, OSHA. So we've been dealing with OSHA for a number of years, and I'm going to read, I did some online research, and this was the recent publication, Vaccine Related, addressing the question, are adverse reactions to the COVID-19 vaccine recordable on the OSHA record-keeping log? The answer to that is Department of Labor and OSHA, as well as other federal agencies, are working diligently to encourage COVID-19 vaccinations. OSHA does not wish to have any appearance of discouraging workers from receiving COVID-19 vaccination, and also does not wish to disincentivize employers' vaccination efforts. As a result, OSHA will not enforce employers to record worker side effects from COVID-19 vaccinations through May 2022. We will reevaluate the agency's position at that time to determine the best course of action moving forward. So I don't appreciate a government agency choosing to not report accurate data and make it available to the public. And that's my statement for today, and I think my 3 minutes is up. Am I right? Oh, 30,
About 38
I'm gonna
and
keep
counting
going now.
seconds.
Okay, so as an employer, I would, and I have maintained to all my employees that their choice of getting a vaccine or not, how they choose to treat the COVID is up to them. We enforce or we recommend all of the precautions, wearing masks and whatnot, but ultimately whether or not to get a vaccine, that's up to the individual themselves. I would not want to, as an employer, to be mandated that I would have to have my employees get vaccinated in order to come to work.
I do have to
Lastly,
stop you there.
I really
I have to stop
appreciate-
you there. Thank you very much.
You're welcome, and thank you.
I'm sorry, it's just hard to sit here all day and listen and not get up and say something.
Welcome.
First, I want to talk about anti-science. Unless I'm mistaken, science is a open discussion of conflicting ideas. And somehow we've come down to there is a right point of view, and that is science, and anything that's opposed to that is anti-science. That's the antithesis of science. I'm sorry. We need to have an open discussion. And really, this has led to a loss of trust. People have been watching the CDC flip-flop. They've watched Fauci say he didn't fund the lab and then later said he had to fund the lab. There's all kinds of just loss of trust created by the government. Why are frontline doctors being suppressed? Why is it so hard to get information from places like Dr. Corey and Dr. McCullough? One of the reasons I think that we're talking about vaccines and escapes of infections from vaccines is because the COVID vaccines are what are categorized as non-sterilizing. That means that when a person is vaccinated, they are not necessarily immune to passing on the vaccine. So the vaccine isn't really a vaccine. It's probably more of a therapy than it is a true vaccine. And when it comes to managing county employees, I'm reminded of a great proverb I heard when I was working that said, "The beatings will continue until the morale improves."
Thank you. Okay, so we're well past the time when we would normally break, and so we have to give our staff time to have a break and get lunch. So we're going to break until 1:30 and then reconvene on this issue. So welcome back to the meeting of the Tuolumne County Board of Supervisors for September 7th, 2021. We left off on our 1 a.m. appointment, and that was a presentation and direction on novel coronavirus, COVID-19. What I had asked was, I know that some board members had additional direction they'd like to provide. I asked Public Health, is there any area, Public Health or CAO Riggs, is there any area that you need particular attention to or need direction on from the board at this time?
I personally would like to see some direction from your board if you would like Public Health Department to come in and do these on a weekly basis or maybe the first and third Tuesday of the month, just because of the amount of time they're taking up in our board meetings. They are putting out information on a daily basis, and it is competing with your ability to do business items that also have importance as well. So just looking for some direction on how you would like us to proceed with that.
Okay. You want to start?
Yeah, I'd like to see once a month. I think that's sufficient.
I was going to go with twice a month. I think we've still got enough activity going on that I hate to see that much of a lag in time without, and I know the daily reporting's here, but we don't have the interaction that we have here.
Supervisor Brandon or Kirk?
First, want to say, let me turn on my little 3-minute timer there. I definitely appreciate the packet. I think you took into consideration our comments before and trying to kind of get to the heart of the update matter. We do get the daily updates, so I do like this. I would say twice per month. If it's going to be just a matter of updating and presenting to us. If we're planning on having a more in-depth discussion, is our 9 a.m. appointment, and it's about 1:40 right now, once a month would be fine. My direction on it would be when we write these agenda items, we should try to be more clear on whether we're having a presentation, I think a discussion about a topic to then give direction, instead of it kind of being open-ended each time. That I think maybe would help kind of, right now each time is a discussion and a potential time when we are giving direction, whether or not there was a particular issue brought to us or we needed to kind of focus on. Anyway, hopefully if that's clear, I would be fine with once a month or twice a month, but just being more clear in the agenda language as to what we're going to be discussing or deciding for it.
Supervisor Kirk, do you have a preference once a month or twice a month?
I think with the trends that we're seeing, things are settling down, so I'm fine with once a month. I kind of would be curious to hear what Dr. Shevchenko and staff recommends, but I think with the trends going the way they are, once a month to me seems fine.
Yeah, and I agree with that. I do think once a month is sufficient. I mean, I take it upon myself to kind of follow the updates, and usually what you bring to the board is not a surprise by the time it gets here in the morning, but then there is that element of educating the public and having the public an opportunity to speak on it. So we do need to maintain some kind of public presentation there. But I think once a month is sufficient, but obviously if public health thinks that more is warranted, then I would defer that way, but I agree with what other supervisors have said, that I think once is enough.
So I think, if it works for the board, once a month in person, and then we can do the third as a third week, that I make sure I get a detailed up, more so than the daily briefing, but something that covers sort of what's in the slide deck that we do on the first. If that would meet the needs, and again, have more of a little, you have the opportunity for a conversation if needed. So, but I think, again, I think once a week, or correction, once a month is probably enough from my perspective, unless we've got something that's urgent.
Okay. All right, does that work for everyone there? Okay. Okay, so any other specific items you want direction on first? Okay. All right, so I'll let Supervisor Half, I know you had some direction you wanted to add to what you said earlier.
Yeah, but I wanted to call attention to what Supervisor Brandon just said, because I agree. I've been caught off guard when we were making a decision, and it wasn't clear to me we were making one. I was under the impression that at today's meeting we were going to make a decision about some of the guidelines that are coming down from the state. So from now on, I really would appreciate having very clearly defined, this is the place at which we're going to decide what we're going to do with the employees and so forth. And I know we have to take the state mandates, the stronger ones first, before we get to just the other employees. But I will state, because Supervisor Kirk did, and I'm prepared to state what my recommendations are to the board right now. So I might as well finish. I was caught off guard by the clapping and the standing ovation, and I did have a few more things to say. So I'd like to say those right now. It's been called to my attention that our board, every board in the state of California, operates as an executive branch on some occasions and as a legislative branch. This is kind of unique to our counties. It's not like the state and it's not like the federal government. We have the ability to make decisions. And I wanted to call to your board's attention that there are currently, this is new, but there are currently 2 counties that are not following the mandated decisions of the state. that they are Sutter County and Siskiyou. Siskiyou has added, they've written a letter, besides that, they've written a letter and asked the governor to acknowledge natural immunity besides vaccination status, on top of not wanting to follow the vaccination mandates. I have another piece hot off the press from August 30th, news item. Former Food and Drug Administration Commissioner Scott Gottlieb, who is also a Pfizer board member currently, noted that natural immunity gained from a prior COVID-19 infection needs to be included in discussions about virus-related policies and mandates. So I just wanted to call that to the board's attention. We had a member from the public get up and give his testimony about how ivermectin works, or worked for him. And I wouldn't suggest taking the veterinarian version ever. So that's not what we're talking about. We're talking about under a doctor's, say-so and direction. And there was another piece that was not included in, I know I put in the position paper a lot about ivermectin. And I'm not going to put this up on the screen, but I think there's enough copies here for the board and public health to take a look at. And I'll describe this to the rest of the people listening in or in this room. There was a really interesting study done by Johns Hopkins. And it was actually, it was done in Africa. And in Africa, they have a lot of river blindness. And so for river blindness, they give ivermectin. And there are 31 countries in Africa that they have a lot of the people there taking ivermectin, I don't know how often, but to avoid river blindness. And you can see from this chart, it's really telling the number of deaths in the countries that do not take ivermectin versus the ones that take it for river blindness. And it's startling. So I really do think, I put a lot of other studies in about ivermectin specifically in my paper, but this one's very compelling. So I just wanted to add that to the mix. And then finally, my recommendations for the board are the following. You can go to either side of the science and make a case for wearing masks or not wearing masks. I'm going to lean on the side of caution and say we should have masks for everyone. It is something you can take off. You can put it on and you can take it off. Unlike the vaccine, once the vaccine is in you, it's in you. So I am agreeing and think we should do masks for everyone. Secondly, all employees of the county have free choice to vaccinate or not. Number 3, natural immunity needs to be recognized. The fourth point, I can go either way, it's just a suggestion. We may want to do temperature tests upon employees entering their workplace. The kind where you take your temperature reading on the forehead. And I would be okay with that if we wanted to do it. I would also be okay with having somebody taking a temperature reading out in front of any mass gathering like this, like the board meeting that we had today, and those who don't pass that test, the public included, would not be allowed to come into the meeting. It's an indication that somehow they're sick. And then finally, I've heard the pro and con about some employees testing, and I think it's discriminatory to, based upon what I've already said, to have a certain category of employees tested, like the unvaccinated, and another category that are not tested. The studies show everybody's getting COVID. So I would suggest that all employees be tested on a random basis. Their number is up for this week, they get tested. And it's one of those random, you can get one of those apps that just randomly pick. And that's how we test. We don't have to test everybody every week, but it's a way of doing some kind of testing to show that we're being responsible. So those are my recommendations going forward. Thank you for letting me speak that.
Thank you. Okay, do we have any other recommendations to change course or adopt other measures that we're not currently?
Hey, Campbell, this is Kirk.
Yeah, go ahead.
Since I think Kathleen and I were kind of headed in the same direction, I will put just my last comments on it and then recommendations. And it's funny because Supervisor Half had mentioned the random sampling, which after I heard Dr. Hurd speak about how they don't have enough tests to even test those who are unvaccinated, the idea came up, yeah, about random sampling, random testing. So I would agree that if we don't have the testing capabilities to test our folks, we do random samples. I wanted, first of all, I just want to say this before I get into my recommendations. I think the data that was presented, the information that was presented, the questions that were presented today, I think what I walked away from today is we have a lot of really smart, educated people who have done the research and they're informed citizens. At the end of the day, they just want to make their own personal health care decisions. And I know we keep talking about this as it's an organization and it's a part of employment, but it's really not if it's coerced and you're going to lose your job. And I know, in some previous conversations, we talked about other businesses were going to, require people to be vaccinated. The businesses that were mentioned were Facebook, Google, and it was some healthcare provider. So that doesn't really do a very good job of explaining how the majority, 99.9% of businesses, how they're going to handle this. But what is known is a lot of businesses are going to look to their local governments to see how we respond and how we act. And I think all the data that I presented today, all the data that constituents brought forth was what I call the reasonable person standard, the reasonable objective. I think anybody who's reasonable, who can look at data, who can make an informed decision, can look at what we looked at today and say, you know what? You should not be forced into this with the fear of losing your job. We've done the research, and it's very reasonable to arrive at the conclusion, which the data has presented, which is nothing is for sure, nothing is finite, and nothing is going to be long lasting. So I think with that being said, what we do know is that vaccinated and unvaccinated people both get COVID and spread it. So with that being said, I like how Supervisor Half put it, a mask you can't take on or off. I have seen some data that is kind of damning towards masks, but the majority of the data that I've seen does support masks. It supports the reduction of inoculum levels, which helps fight off the virus should you get it. So I would support the masking. You can take it on, you can take it off. I do support no forced vaccinations as part of employment. I do agree that natural immunity needs to be recognized. I don't know how we do that other than I think it should be part of our policy that if an employee believes that they have already had it, that they should be given the opportunity to have their natural immunity tested and reviewed by a doctor and given some sort of recommendation by their private healthcare provider. Ran the temperature reading, sure. Anything we can do that's not going to be intrusive into somebody's body, I'm fine with that. And then again, the random sampling. I think those 5 points are very well taken. And again, it's something on the outside of the body. It's not intrusive. But what I would, one thing I would like to have possibly, and I know Dr. Surjenko is extremely busy, is if there's any way that maybe at the next board meeting we could have more discussion, if there's any data that you could present that would talk about data on infectious people, data on antibody testing, and then also if you could kind of maybe digest that England study that we were talking about earlier. And the reason why that England study to me is so important is because if England's a couple months ahead of us and they were showing the death rate, I don't want to misrepresent that data, but if the data showed a higher death rate amongst vaccinated folks and unvaccinated people, and I don't want to just walk away from the conversation making that statement, I want to possibly know why that data is the way it is. So I would, again, that would have to be supported by the full board, but I'd love to see an understanding of that because I do believe Europe, is a few months ahead of us. Israel's months ahead of us. And so I think we're going to repeat whatever they do. So those are the 5 things I would request as far as policy goes. And then if we could have further discussion from Dr. Surjenko at another date, maybe on those 3 topics, I would appreciate it. So I will leave it at that. I want to thank you guys for listening. Public Health, Dr. Surjenko, for being here all day. This conversation is needed to be had, and I appreciate everybody listening and being able to have this talk today. So thank you guys.
All right, thank you, Supervisor Kirk. I think Supervisor Goldenberg.
Yeah, so no matter what the percentages say and the different types of rates, we still had 22 deaths in the last 30 days. We're approaching 100 deaths in the county. We can't disregard, that that's occurring. And yeah, we're having more people get infected. Certainly we've had a lot of cases, but we've never had this amount of deaths anywhere all the way through this whole pandemic. I'm personally, we already had a board vote. And our board vote addressed masking for all employees. It addressed, at that time, unvaccinated employees to be tested. Now that said, I understand, and we've had discussions, I would be personally in favor of having all employees tested. And not, it makes sense, right? We've got people that fully vaccinated, that have gotten COVID. We have people that had COVID before that are getting reinfected. And, we still have people that are vaccinated, of course. So I'd be in favor of that. I didn't realize we were even working towards making that type of decision at today's board meeting. But if we're looking at doing that, then I'm also in favor of, just as we've done all the way through, that we've held to the state health orders, and I think we should continue to do so. I'm not personally in favor of random testing. I know it can be a challenge that we would have to see how we can get to, testing all employees. I think it's workable. And we've, I think that would be the best way to go, is to do the weekly testing. Thank you.
Supervisor Brandon.
So 2 questions first for admin and public health. One is on the feasibility of testing, our supply of tests, the staffing to be able to conduct them. If we were to put them across as a county-wide requirement, do we have the capacity to be able to handle that? And is there anything that can make that a little bit easier?
I think that will be a challenge. Someone remind me how many county employees we have. It's like 800 or ish.
687 or something.
We have 600 full-time positions that are filled, and then we have all of our relief positions,
Okay.
so probably 800 to 900.
Yeah. So the state testing site now is able to do about 190 tests per day. Sometimes they can go over. They've gone above their capacity. For example, today they've got a line of people out there trying to get in that don't have appointments, and so they're impacted. We can request a second lane, which would increase that twofold on, I believe, 3 days a week that they're able to do that, and we can probably make that happen relatively quickly. Aside from that, the challenge of getting supplies, testing supplies, and staffing to do the testing would definitely be a challenge.
Okay. Is there an option between? For example, folks that work with other colleagues in an office or customer facing versus those who may be in a role, say telecommuting at home?
I'm not sure I understand the question. I mean, that's a policy decision that you would make as to who you would include in that testing regimen.
Okay.
Is it, yeah.
Right, remember that these decisions are conversations, but we will make the final decision, you will, in a closed session in bargaining, because all of this will be subject to meet and confer requirements, as you've been, we've relayed that already. Just want to make sure I put that reminder out there. But as Michelle said, what your board wants is the policy that you set up. So whether you want it to be all employees, weekly, semi-weekly, whether you want them to be just who are unvaccinated, all of those would be up to your board. Anything that's above and beyond the state public health mandates that are already in existence.
Okay. Thank you for that clarification too, because that's a very important one. And the next one is just regarding those who have had COVID and feasibility of any type of an antibody test. What are the limitations and challenges of that if we wanted to implement something like that?
So, I think the limitations is that you can determine that a person has had a prior infection. You don't know the level of immunity they've developed. As mentioned earlier during the session. And then in terms of implementation of that, you'd have to figure out who would be covering the costs of that. And again, that not my lane, but if we were to do that, I would go with an established lab and an established antibody testing protocol. So Quest would be an example. There are others out there that would be equally acceptable, but
do we have a guesstimate of what the cost might be to conduct one of those? Any range at all? $100 or $1,000?
I'm trying to remember that earlier on that it was somewhere around $100, but I really couldn't speak to what that is right now.
Okay, yeah, I'm just napkin math understanding there. All right, with that, I think I have my direction here. I also agree. I think it is a fair all in this together mentality to do universal testing, masking, and temperature checks at the county. We do have a responsibility, as one of the callers in, that when folks come here, there's not another county they can go to. Colleagues, workers here need to be safe. As employers, we have to provide that. And also anybody that comes into our facilities, they also need to be assured that they are safe. And I find that to be a really reasonable accommodation. There has been some mention about health promotion campaigns. Pre-pandemic, public health does a lot of that. That has sucked up a lot of resources away from that. I would be willing to hear public health's ideas on, because I think the comorbidity issue is something that is under-discussed, and I don't think that is the fault of public health here. I think it is a medical system-wide issue that we don't talk about living healthier lifestyles and preventative types of medicine as much as we do about fixing disease. So as far as something of trying to promote folks taking vitamins and supplements, which I think we already do for mothers and children and stuff like that, and WIC and whatnot, better diets, exercise, and those types of things in conjunction with blue zones, I'd be interested in hearing those proposals, potentially partnering and seeing resources be able to go to that, because I know that it has been very strapped right now, public health, to do that as well. I would agree, and I think I would call it, I guess, a dissenting majority opinion. From what I have seen, the discussions I've had, from presentations on the experts we hire on this, that vaccines are effective. They have proven to be very, very safe. I don't doubt that natural immunity, it might be better, it might be equal to being vaccinated, but there's a 1% chance on average that you're going to die. And I mean that in acquiring that is extremely dangerous. And there is not that chance with vaccination. That said, I also believe in, when I think of this, not the legal authority of government so much, but the ethical principles related to medicine. The Beauchamp 2002 biomedical ethics, they list 4 things that are important in making, I think, medical decisions. It's beneficence, so that it needs to do good. It's non-malfeasance, and that it needs to do no harm. It is autonomy, and that the person is informed and gives informed consent. And it's justice, that it treats everybody equally. It gives everybody the same access to it. And this is how I weigh this in my head. I have said in other previous times that I agree that the county should not be enforcing a mandated vaccine. I think we should do everything that we can to try and provide information, to answer questions, to get people vaccinated. And at the same point, there was a good point made, in that government mandating a seatbelt, you can take the seatbelt off. The mask, the environment, those types of policies, they make sense. This is, even though I think a rational, justified medical procedure, we had discussions about this, that, for example, a kid that needs a bone marrow transplant, and you're the only person in the entire world that matches that kid, and getting the bone marrow can be relatively painless, easy process, extremely low risk. There's no law that can mandate you have to give that bone marrow transplant to that kid because of ethical principles. Even when you die, to donate your organs, you still have to sign up to be a donor. You have to give that opt-in. So even if you die, you still have the right to bodily autonomy. That is something that I take very, very seriously. And so with that, I'd be willing at looking at, obviously we are not on the same level of a state or federal government. We are an organ institution of the state. At the same point, as to how we can accommodate without having to enforce a mandatory vaccine, public safety of our employees, those coming to office to discuss with our workers and their bargaining representatives as well, but to provide every alternative available, whether it's telecommuting, whether it's the antibody testing, to avoid and oppose any type of mandatory vaccination for that. I tend to be a moderate, which means I make nobody very happy, and I got my little 3-minute timer here, which I'm obviously well over on that. I do a lot of thinking about this. This is something we talk a lot about. And I believe the best way to reach people is the right message at the right time in the right medium. It's listening to what people really care about, and it's talking to them. And it's really hard, and you got to win a campaign the same way. You can't just make yourself win. You got to talk to people. And I know that's extremely difficult, but I think that's the approach we have to do. Is if we want people to opt into this, we have to put in that work. And I know public health is putting in that work, and I think we have to continue doing so. So if there's a way we can provide those tools, please present those ideas. That's really what I want to discuss, is how can we help you with that. Some last little tiny bits. One was the discussion brought up about HEPA filters. I don't know what that would cost for the entire county, but we do have a few unique rooms like this that do get large gatherings of people. That might be something to explore. And there was a discussion about additional stats. One thing was on mentioning all the people living their healthy, nice lives. I don't think that's a very effective way of looking at stats. We don't measure cancer rates on how many people don't have cancer. But I would say on looking at asymptomatic cases, that type of statistic, if there is more information we can provide to the public, I think that's good. That's a good thing, and that's good for public discussion. So thank you.
All right. So obviously we heard a lot today. I don't really agree with a lot of the information that was shared. I think a lot of it was kind of more half-truths and or misunderstandings. I did read your the document that you produced, Supervisor Half, and I still maintain that I think public health is doing the right thing with respect to public health policy and vaccinating. We've had this virus washing over us for the past couple of weeks, and if the choice is to stand here and do nothing or to support public health and fight back, I choose to fight back. So what are the weapons that we have available to us? There really isn't that much. It's vaccination, it's masking, it's testing, and it's staying home if you're sick. And beyond that, there's not a whole lot that's been proven to be effective, but those things are. And so I support continuing with the work that public health has been doing, promoting those elements, and not really any of these other changes that have been suggested, apart from adjusting the frequency of these presentations.
Hey, Campbell, can I speak?
Sure.
So I respect, and again, you're the chair, so I want to cut you off in any way. And I hope I didn't cut you off, did I?
No, go ahead.
Okay. But what I'm hearing is a majority of the board who disagrees with you and Goldenberg. And I don't say that in a mean way. What I'm hearing is that there's more information to be discussed. There's other ways to go about doing this than to force vaccinations on employees. And so I think what we need to do is come back to the board and figure out those details, because I know I had some, Kathleen had some, Brandon brought up, Supervisor Brandon brought up some things about air filters and some other things. And so I think we need to figure out what we're going to do moving forward. But I'm hearing a majority, and that is what we were going for, was to give our staff the best fighting chance to make the best informed decisions for themselves.
I will have to disagree with you. I didn't hear any real consistent direction. I think I heard all 5 of us give different opinions. And so to me, that's kind of indicative of what happens when you ask politicians to make healthcare policy. And so what I'm saying is that I think we should let people with training and expertise in healthcare make healthcare policy, and we should support them and make sure that we have ways to fund and otherwise be a check on those avenues. I think the confusion that we've actually seen is really a case in point why you need a strong public health agency with the support of a governing body like the Board of Supervisors. Because if I was to, I wouldn't know what consistent message to take away from what we've heard from the 5 board members today. And actually, that's a good question for staff. Do you have any, I mean, I didn't pick up on anything. Do you have any consistent consensus on a change?
Why don't we start with the most?
So, Supervisor.
Why don't we start with the elephant in the room?
Campbell, can I?
The
Sorry,
majority of the
Here,
board does
let's-
not want to force vaccination. Okay.
Is that?
I do want some clarity,
Okay.
because that would be really helpful. So I also want to
That was not
provide
what I heard.
additional information, because I want to make sure I understand what we're focusing on here. So there is what CDPH, the state, has ordered, and there are consequences for not following those orders. And in fact, just last Friday, they issued a new guidance letter basically stating that all of their enforcement entities will be taking enforcement action in order to implement their orders. So there's consequences for that. Then there is what I call sort of beyond the scope of the CDPH orders, which is something that your board would have the authority to determine. And I want to make sure I'm understanding, are we talking about not implementing CDPH state orders and we understand the consequences of that? Or are we talking about going beyond the scope of those orders? Because those are 2 different items.
So, thank you, Sarah. I think it breaks down, Supervisor Kirk was going to bring up into 2 things. One, CDPH has put out this order and I think this is a lot of the public discussion, which I think has been inaccurate. The board here is not looking to go beyond CDPH recommendations on mandatory vaccination to the public. Forgive me if I'm speaking out of turn. I get a lot of those questions, and I think that's what the discussion has been, and that's not what's being proposed. And certainly, I do not support that. When it comes to looking at CDPH and the enforcement of their policies on vaccinations for the state-mandated vaccinated groups, I need to have a lot more clarity on what specifically those types of enforcement actions would be on a county. I will say that where I'm at right now is I would like to explore that. And I'd also like to explore anything we can do that makes a good faith effort to meet as best we can those standards without making that step. I do not think that vaccinations should be mandatory. I think that they should be able to stand on their own 2 legs with that. And I hope that the state would see that we're not being defiant. We're here trying to make the best good faith effort that we can on that. Hopefully that's more clear. And again, I'm not an expert on what the state enforcement looks like. Is that going to be a monetary fine upon the county? Does that look like the state taking over that effort? So those are things that I would need more clarifying information on.
One item, so you do not think vaccinations should be mandatory for employees, or could you, well, he didn't say employees, he said
Sure, I can
vaccinations should be
clarify
mandatory.
that. To the first point, I don't think we should go in excess of the CDPH orders on vaccination mandates. I do think, I guess, we should go in excess on the testing and the masking requirements, as I think was discussed on here. As an employer, and speaking about the employees of the county, yeah, I believe that we should not be enforcing a mandatory vaccination policy. We should be looking at a policy of maximum flexibility, and if that ends up being antibody testing, if it ends up being telecommuting or rotating roles away from tight offices or the public, every opportunity to try and figure out a different way to do it. It's not a matter for me, again, of constitutionality or policy. I believe that the state does have the authority to mandate that. I just don't think it is an ethical approach, and I think in the end, it is a battle of hearts and minds in the community. That is how you actually get to that herd immunity and that vaccination rate. We don't do that through a mandate, we do that through discussion.
I'm going to break it down. Okay, you have two opposing ideas here. One is that you do want to follow CDPH guidelines, correct?
It depends on the guideline, I think, is what I'm saying.
And the other is because mandatory vaccination or testing of employees is part of the CDPH guideline for a number of positions within the county. So if you support the CDPH guidelines, in some respects, that would be these vaccinations for employees. So if you don't support any vaccination whatsoever for any mandatory vaccination whatsoever for employees, then that means that you would want to go against CDPH guidelines.
Right. I said not to go in excess, except where we talked temperature, masks, and testing. For the rest, I wasn't saying to follow all of it. And I should say, too, I'm not flippant about, I know this is a state regulation coming down. I know there's an enforcement process that exists, though I need clarity on that. I believe there is a point when we do have to be able to speak up on that. So I think on that specific policy, that yes, we should dissent.
So we should not follow CDPH guidelines, is what you're saying?
On that specific guideline. Again, I'm taking, the majority of them I think are very rational, reasonable policies. I do think that is one that we should not follow.
Which one? So
That would be
vaccinating,
the
for example.
mandatory vaccination.
Mandatory vaccination for employees, for example,
I would look
behavioral
to
health.
public health and legal if I was clear in that, if there's any ambiguity to my position, any clarifying questions, I'm happy to answer.
So can I address just a couple things?
Yeah, I'm just saying, this is directly counter to what we had been doing. So I'm just trying to make that clear.
Okay, so as of Friday, CDPH issued additional FAQs, and it says, in terms of enforcement, the state's regulating entities will enforce the requirement, which includes the vaccine mandate for certain workers, and again, exemptions apply. For example, California Department of Public Health will enforce the requirement at hospitals, skilled nursing facilities, intermediate care facilities, and other health care facilities at licenses. California Department of Social Services will enforce the requirement at adult and senior residential facilities and adult day programs licensed by CDSS, and California Department of Health Care Services will enforce requirement at residential substance abuse treatment and mental health treatment facilities, and then local jurisdictions may enforce also. So this is the most recent, as of Friday, guidance. In terms of more clarity, we can certainly continue to ask CDPH what that looks like, but we know that they are saying that their state entities will be enforcing. And then when it comes to these are orders of the state, and so we just have to understand that by not following all of them, we will not be in compliance. And the other thing is, in each order, they address what are considered alternatives. So the accommodations for vaccine mandates are qualifying medical reason or sincerely held religious belief, and then when you meet those, then you do the additional testing. So those are the accommodations. I want to make sure that the board understands, and I get the policy distinction here, but from the employer perspective, we have a duty, and we're also under Cal OSHA regulations, to maintain a safe workplace for our employees, which includes following Cal OSHA regulations, CDPH regulations. We do create a liability by not following these regulations. Your board just has to understand that. So I think that it's something that we definitely can talk about more, but in terms of alternatives and options, those have already been sort of thought through by CDPH, and they provided what those alternatives are. So unless they are going to change what their recommendations or what their orders are, then even if we did something else, we still would not be in compliance.
Understand. Thank you.
Hey, Sarah, this is Kurt. I've been hearing discussion about like some firefighter unions in the Bay Area basically sending letter to their HR departments asking saying that they'll take the vaccine, but they want HR to be liable for any adverse reaction to them or anything. So is there any liability on the county? All we hear about is a liability if we don't follow the state mandate, but what's the liability on the county?
Right, so that is something that's kind of the evolving law, whether or not workers' comp covers those kind of things. So I was just doing research earlier because I know that that was a question, and I can't give you a definitive answer yet, but it's something that I am definitely looking into, and as soon as I have an update, I'll alert your board.
We've definitely heard today that Cal OSHA doesn't want to hear about it, any kind of adverse events from vaccinations.
Well, I can tell you that in the CDPH orders, we are required, the employer is required to track the testing, vax status, et cetera. So whether or not and how that gets transferred to Cal OSHA, I don't know, but CDPH has made it very clear that we have certain mandates that we're supposed to be adhering to.
Okay. All right, how about this? Can we agree to allow public health to continue to do the work that they've been doing up to this point that we've directed them to do, and then come back with more information about what those potential, what would be the downside of not following CDPH guidelines, and return with information in that regard? Would that be acceptable?
A question that to public health is what deadlines will be coming up? So for example, to implement the state CDPH guidelines, when would that date start? When would enforcement start? Is this something that is a policy you can develop while we don't implement it yet? I guess those are the things I would need to understand to be able to say whether we could delay or not.
Yeah, I think the distinction needs to be made between the role of public health and human resources on this particular issue.
Could you get a little closer to the mic?
Lean in has always got it. So I think the distinction needs to be made between the role of public health and the role of the county as an employer on this particular order. The one dated August 5th regards to us as employers of healthcare workers. So it really falls more to human resources in terms of adhering to this. So more in the CAO's lane. And it has to be implemented relatively soon because the intent is to have the first dose of a 1-dose regimen or both doses of a 2-dose regimen completed by the 30th of September. So in regards to the CDPH mandate for healthcare workers in clinics and doctor's office, which applies to us, we're kind of behind the power curve at this point.
Supervisor Brandon, there's 2 CDPH orders that impact the county specifically. There's the July 26th order that is about verification of vaccine status for certain employees. That was effective August 23rd, so clearly we're behind there. Then there is the August 5th order, that is the vaccine mandate for certain employees, public health and behavioral health, and then a few others. And that is effective September 30th. So those are the deadlines, and that's partly why we have wanted to address some of this conversation with your board, because those deadlines are looming.
So what I'm hearing is we're already behind the 8 ball on some stuff. And my recommendation would be that we look at, I think, what is it, Siskiyou, the other 2 counties that aren't going, because my guess is their council and possibly some of their staff have already reached out and gotten some information clarifying this. So I would recommend that so the full board is aware of what we're looking at, reach out to those counties and get that information and we can report back. But it sounds like no matter what, we're going to be since the full board does not support a mandated vaccination, that we're going to go through that August or that September 30th deadline.
So based on that and the answers from council as well as public health, it sounds like to be able to meet those deadlines, we can't necessarily delay that decision. But I would say with new evidence and new discussion, if there is something to change there, I would absolutely be willing to, I think in our presentation discussion when we have want to give direction to public health, to be able to relook at that. Because we do need to see what the enforcement consequences are. At the same point, I think right now at this point, I think that's a decision we should make.
Supervisor Campbell, if I could just weigh in for just a second here. As we had alluded to earlier, there are certain aspects of this that we are required to meet and confer with our bargaining units. And Sarah has been taking that part of it on with HR since we have someone who's out ill right now. So I just want to remind you, we will carry on this conversation into our closed session later, which we will need to get into a bit more detail than what we can do today. So this will not be the end of the conversation. Remember, this is personnel related, which does take place in closed session. So that's the difference between what Dr. Sarjenko was saying, his role as a public health officer and our role as policy and legal. And some of that does need to take place in a closed session.
Well, I just wanted to nail down the question, though. Are we allowing public health to continue with the work that we had? So what I'm saying is, are we reversing the policy that we had set out previously right now to not follow CDPH guidelines? And I'm kind of taking the temperature of the room, and I think I know where Supervisor Half stands and where Supervisor Kirk stands. And it's sounding like you agree in that regard, that you do not want to follow the state guidelines, because we do need to make a decision about it.
On those specific guidelines.
So
And I
you
should
do not
say-
agree on vaccinating being mandatory for employees?
Correct.
Okay, all right. Well, there you go.
There was one other that we had, which was the testing, masking, and temperature checks, I think was the other general idea.
And that's for closed session, right?
Admin or council.
So again, I need to make sure I'm understanding, because again, we've got the CDPH orders, and I also want to make sure public health, what I'm understanding is the direction from the board is not really to public health, because it is as the employer trying to implement state orders. But I need to understand implementing state orders as they are, and then it sounds like we are exceeding some of those orders because we want to apply additional requirements on all employees, which your board can do, but we have to meet and confer over it. We cannot immediately implement it. The other thing that we will come back with your board is not just the consequences for violating CDPH orders, but also Cal OSHA and how that, because I feel like it's really important that your board understand if you're willing to accept that liability, just like you have people who are adamantly opposed to a vaccine mandate, you also have staff on the other side, your employees who want to be protected and don't feel like they're being protected. And so you have this balance. And as the employer, again, under Cal OSHA, we're going to come back and we will discuss in more detail what that potential liability looks like for not following the mandates.
But Sarah, and that's kind of where I want to know where the liability is on the county if we force a vaccination, because I know that conversation's coming. And again, I think the data that we discussed this morning shows that you're not protected if you're vaccinated or not completely. You can still get it and spread it. So we need to stop blurring those lines.
Yeah, Supervisor Kirk, I will definitely include that into the addition, because I need to do more research. So I will definitely include that.
Okay, thank you very much.
Just one thing to keep in mind too, Supervisor Kirk, is right now, if an employee contracts COVID while they are at work, no matter what levels of what that is, and we know we just had the worst level just happen to one of our employees, the employers also has some responsibility for that. So I just make sure it goes on both sides of the spectrum here.
So I guess the
I'm sorry.
question I have is, can public health continue with the work that they've been doing? Or are we asking them to stop?
Just, public health does not enforce any part of these. That is something
Or
that our office does.
your
Yeah.
office?
Yeah, so we right now, because we are meet and conferring, and we plan to talk to you about this in a closed session, we will be able to have more detail of conversation in there as our part of our meet and confer process that Sarah can give you an update.
All right. Any other comments?
I guess my only direction.
I do have one.
You
Go
can
ahead.
go,
Go ahead,
Supervisor
Brandon.
Kirk.
I think, did you have something to say, Supervisor Goldenberg? Oh, I'm sorry. Okay, Supervisor Kirk.
Sarah, I'm just curious, are we going to be self-reporting? I guess we'll be reporting to the state if we're not adhering to any of their mandates through the regular data that we're supposed to be submitting. Is that how we're basically telling on ourselves?
Do you mean if we do not comply with the CDPH orders?
Correct.
Is that what we said? Yes? Okay. So that one, I actually am not sure. I can look at that too. I know when it comes to Cal OSHA, when we have, for instance, an outbreak in our facility and or a death, we are required to report that. There would likely be an investigation. If we violated any of the protocols, the county would be liable. There could be fines. And then from the Cal OSHA perspective, I know that a little bit more. I'll have to look at the tracking. I think
That's fine.
Okay.
It's fine.
Yeah.
I know you got a bunch of research to do, so I hear you.
So to Chairman Campbell's point on any alterations, not speaking about HR, but to public health and current policies, again, a lot of resources and I think time have been diverted away to handle this pandemic from other efforts for health promotion. If there's something that this board can be able to do to help, for example, work with Archer and Hound or any of these communications groups to try and get out a better message about a good diet, maintaining a healthy weight, using vitamin supplements, and I would not be, I think, in a position to sit here and tell you what health things to promote. But if we're able to get that message out and maybe use this as an opportunity too to see people live healthier lives in Tuolumne County, and there's tools we can provide and resources for that, because I know you're already stretched and you're doing a great job with this, and that would be just another thing added onto your plate. I'd like to know what those options would be. So that's probably not direction right now, but I would like to see those options presented in the future, and we could even do that offline potentially and just have a discussion about that.
Okay, I'm going to call this, we need to move on. We've got a lot still to cover, and we're still on our 9 o'clock appointment here at 2:30. So if we're going to move on to our item 16, do we need a minute to set up for that? Let's take a 5-minute break. We'll reconvene at 2:35. Thank you. Okay. All right, welcome back, everyone, to this meeting of the Tuolumne County Board of Supervisors. It's September 17th. We're back on our regular agenda, and we have some very patient people here with us today. Thank you so much. Here to talk about a very important item on our agenda, item 16. I'll look to our board clerk to please read that item for us, and then I'll invite you up here to please speak for us.
Item number 16, consideration of adopting Resolution 87-21, recognizing September 5 through 11, 2021 as Suicide Prevention Week in Tuolumne County.
Hello, welcome.
Well, I was ready to say good morning, but good afternoon, Board. Michael Wilson, Behavioral Health Director, and that was a nice introduction to this very important topic. National Suicide Prevention Week is September 5th through 11th, 2021, and World Suicide Prevention Day is September 10th, 2021. As COVID-19 became the third leading cause of death in 2020, suicide dropped from 10th to 11th leading cause of death for all ages. While national rates of death by suicide have risen since 1999, California's rate has remained relatively level and is likely as an outcome of continued concentrated efforts on a statewide and local level to bring awareness to that issue is going to remain level. In 2019, California ranked as the 5th lowest state for death by suicide at 10.7 per 100,000. Suicide rates are generally higher in rural northern California counties. In 2019, the California Department of Public Health Epic Center database reported 11 suicide deaths in Tuolumne County, a rate of 20.2 per 100,000, or about twice the state's average. Facts from the Center for Disease Control and Prevention, the National Institute of Mental Health, are in 2019, suicide was the second leading cause of death among individuals between the ages of 10 and 34, and the 4th leading cause of death among individuals between the age of 35 and 44, and the 5th leading cause of death among individuals between the age of 45 and 54. In 2019, among females, the suicide rate was highest for those aged 45 to 64 at 9.6 per 100,000, and among males, the suicide rate was the highest for those aged 75 and older, 39.9 per 100,000. Suicide is preventable, and each one of us can play an important role in keeping people alive, safe, and connected with hope. Since 2010, Tuolumne County Behavioral Health has funded suicide prevention efforts, and since 2013 has sponsored a suicide prevention program, which is coordinated by Amador Tuolumne Community Action Agency. ATCA's programs provide local training, education, outreach on suicide prevention and awareness, and stigma reduction to individuals and groups of all ages. The 3rd annual Hope and Honor Walk will take place on September 11th, 2021 at 9 a.m. at the Courthouse Park in Sonora to remember those who have died by suicide and to bring attention to local suicide prevention efforts. And we're going to talk more about both ADCA and the Hope Walk. The Tuolumne County Board of Supervisors has recognized Suicide Prevention Week since 2014. With continual focus on mental wellness, self-care, and awareness of others' actions, behaviors, and well-being, trainings and outreach across California have empowered community members with information on how to identify and manage risk factors in others and for themselves. So with that, I will turn it over to the next staff, who I will let introduce herself.
Hello.
Good afternoon. This is my first public speaking experience, so you're gonna have to bear with me. Good afternoon, board. My name is Jennifer Gohl. I have worked with Tuolumne County Behavioral Health as a program specialist for nearly 4 years. I oversee the Tuolumne County Enrichment Center, the day-to-day operations of that. It is a peer-run wellness and recovery center that is funded through the voter-approved Prop 63, known as the Mental Health Services Act. A large part of my role is dedicated to suicide prevention, and I currently serve on the Striving for Zero Suicide Prevention Strategic Planning Learning Collaborative and represent Tuolumne County in its Rural County Collaborative as well. The Striving for Zero Learning Collaborative aims to advance local strategic planning and implementation in alignment with strategic aims, goals, and objectives set forth in California's Strategic Plan for Suicide Prevention. It builds on a previous learning collaborative offered by the California Mental Health Services Authority. In my role as program specialist, one of my duties is to create the bi-monthly Tuolumne County Behavioral Health newsletter, which is distributed to more than 350 community members representing various agencies, organizations, and nonprofits, as well as Tuolumne County employees. September's newsletter highlights numerous suicide prevention resources, including local events. I have some for you, but I'll get them to you afterward. I also maintain the Tuolumne County Behavioral Health social media Facebook page. Our Facebook page has featured Know the Signs campaign materials to help spread awareness about Suicide Prevention Awareness Month. Know the Signs is a statewide suicide prevention social marketing campaign with the overarching goal to increase Californians' capacity to prevent suicide by encouraging individuals to know the signs, find the words to talk to someone that they are concerned about if they are expressing suicidal ideations, and to reach out to resources. Next, we will have 3 community members give presentations. They will be Bob White, Cynthia Hallman, and in place of Thurman Orman Oaks will be Aaron O'Hare. Thank you.
Thank you.
Good afternoon, members of the board. I appreciate the opportunity to speak to you this afternoon about the importance of suicide prevention in our community. My name is Bob White. I am the Yes Partnership Director and the Prevention Programs Director for ATCA. The Yes Partnership is a community-wide coalition that was established in 1986 as a result of several teen suicides in our community. For the past 15 years, the partnership's mission has been to support Tuolumne County youth and families to promote resiliency and prevent suicide, substance use, and child abuse. We receive funding from the Tuolumne County Behavioral Health Department through the Mental Health Services Act to promote suicide prevention and prevent stigma around mental health challenges. One of the vital things that we do is provide trainings to equip people in our community to be alert and aware of people who may be having thoughts of suicide. There's a statement in the resolution before you which reads, whereas no single suicide prevention effort will be sufficient or appropriate for all populations or communities, all are asked to join together and take a stand to prevent suicide. I'll say that again. All are asked to join together to take a stand to prevent suicide. This is an important statement because we know that at any given time, 5% of a population could be having thoughts of suicide. The population of Tuolumne County is roughly 54,000 people, and that means that at any given time, roughly 2,700 of our neighbors, friends, family members, or colleagues may be having thoughts of suicide. We often say when training others to be alert and aware of people that might be struggling with suicide, that suicide is a crisis of hope, and that at some point in everyone's life, the odds are that you will experience a crisis of hope. And how you move through that crisis of hope can determine whether you have thoughts of suicide and act on those thoughts. During the last 18 months of the COVID pandemic, many people have experienced a crisis of hope. Now more than ever, we need people in our community to take a stand and prevent suicide. My friend Serena Ormanoaks, who you would have heard from today, but she was unable to be here, she shared with me a quote recently, and I'll share it with you to conclude. We may never know what was inside that took them away from us, but they did the best they could until they couldn't any longer. They never wanted to leave us. They just didn't know how to stay. It is my hope that as we recognize Suicide Prevention Week in Tuolumne County and Suicide Prevention Month throughout the nation, that all of us will work together to help anyone that is struggling with thoughts of suicide, to know that we want them to stay and that we'll do everything we can to help them know how to stay. Thank you.
Thank you.
Good afternoon, Board of Supervisors and all those in attendance. Thank you for your time and allowing us to share. So I'll be talking today about my own personal experience with suicide, my experience providing suicide prevention trainings, and about a new faith-based effort to prevent suicide. I lost my father to suicide 43 years ago and my grandson 4 years ago. The loss of a wonderful, brilliant, caring loved one in an instant was excruciating. My grief was filled with shoulda, coulda, wouldas, and a lot of guilt, which is so typical of suicide grief. But with the help of my faith community, lots of prayers, and the Survivors of Suicide Loss Support Group, I've gotten through this. With God's help, I've turned my grief into a passion to prevent suicide and provide support to others who experience this kind of heartbreak. My suicide prevention work began in 2005 and 6 after 2 high school students suicided. Many of us became involved with community efforts and forums to find answers to prevent suicide. With the help of behavioral health and evidence-based training for suicide prevention was identified, Living Works trainings. And with the Mental Health Services Act funding in 2010, 4 of us were able to become Living Works trainers for a class called ASSIST, which stands for Applied Suicide Intervention Skills Training. 2013, 3 of us became Living Works trainers for a class called Safe Talk, which is suicide awareness training. It's been a privilege to provide Living Works trainings for Tuolumne County since 2010, and to have done trainings with individuals such as Mike Macon, Calais Brown, Wendy Pound, our beloved Carrie McCluskey, Bob White, Martha Golay, and Kim Garo. Kim became an assist and a Safe Talk trainer in 2019. I'm happy to report that these trainings work. And I know a lot of people have shared after the trainings that they were able to use the information and the knowledge they learned to help somebody. I've personally provided about 200 successful suicide interventions using Living Works techniques in my line of work as a former school social worker, school counselor, home health and hospice social worker, and currently as a faith community social worker. In 2019, a faith-based suicide prevention ministry was founded by Kim Garo and myself called Lantern of Light. It operates under the sponsorship of Word of Life Fellowship in Miwok, under the supervision of Pastor Bob Wilk and our senior pastor, Pat McDonald. So why a faith-based approach to suicide prevention? Well, the National Action Alliance for Suicide Prevention states that faith leaders play a key role in supporting mental health and preventing the tragedy of suicide. Lantern of Light's mission is to provide evidence-based prevention training for our faith community, thereby educating and empowering the faith community to help bring people out of the darkness of suicide and into the light of God's love and hope. Lantern of Light has trained 137 faith community members in Safe Talk and 20 faith community members in Assist, representing 16 different faith communities or churches. Thanks to a grant from Sonora Area Foundation, we are pleased to be offering a free 6-hour online class in suicide prevention for 30 faith leaders called Living Works Faith. Through this training, faith leaders will learn how to save lives from suicide. In closing, I'd like to express my thanks to Behavioral Health and the YES Partnership for providing the opportunity to passionately educate our community in suicide prevention. As we all work together, we hope Tuolumne County will have 0 suicides by the year 2025. No more tears, no more sorrow, but instead hope and light and life in our county. And I'd also like to mention that oftentimes when public speaking and information about suicide is given out, that it can trigger people. And we know, as Bob shared, that 5% of our population at any given 2-week period of time is having thoughts of suicide. So we want to say, if anybody today listening in is having thoughts of suicide, we want to give you the National Lifeline number. It's 1-800-273-8255, and our own behavioral health crisis line, area code 209-533-7000. Thank you so much for listening today.
Thank you so much for your words and sharing your personal story.
I'm a little taller.
That's all right.
So my name is Erin O'Hare, and I'm here on behalf of Serena, as was mentioned previously. I am with Peaceful Valley Farmers Market. I started Peaceful Valley Farmers Market and currently operate it, and we are one of the sponsors of the Hope and Honor Walk. The reason that we sponsor the Hope and Honor Walk is because 6 years ago, we lost a very dear family member to suicide. Interestingly enough, today would have been her 29th birthday. So interesting timing, but I'm going to read a letter from Serena. That's way easier than talking about my personal story. It says, "Hi, my name is Serena. With the help of YES Partnership, I founded the annual Hope and Honor Walk for Suicide Prevention and Awareness. I was asked to speak to you all today about my experiences with suicide. Around 1997 is when I had my first encounter with suicide. One of my closest friends' family members had attempted to take his own life. All I wanted to do was help, but felt so helpless and didn't have the tools or skills to make any difference. Luckily, this was only an attempt, and he is still living today. Around 2002, I had my second encounter with suicide. My mom's best friend took her own life. I again felt helpless and longed to make a difference, but did not know how or what to do. From 2004 to 2014, I was consistently threatened by my husband at the time that he would commit suicide and or go down in a blaze of glory if I ever left him or reached out to authorities. He is the father of my children, and I felt responsible to keep him alive, not realizing I was being manipulated and abused. After being told by an amazing LCSW who knew him and the situation that he was the most second manipulative client she had ever encountered in her long career, I gained the strength to make a change. On September 1st, 2014, I finally had my spouse leave. He's still very much alive, and we are very much divorced. He very unfortunately still holds his own life and livelihood over our children's heads. On September 4th, 2014, just a few days after he moved out of our home, I found out my mom had taken her own life. I again felt helpless, angry, and so full of many overwhelming emotions I couldn't understand. The outweighing emotion was guilt. What could I have done better to save her? Was I so consumed with trying to prevent my manipulative, abusive ex-husband from taking his own life that I missed signs of my own mother needing help? This shook me to the core. I knew then that I had to make a difference somehow, some way. I had to do something to prevent any other family from experiencing this tragedy. I didn't want to make this about me and my experiences, though. Suicide affects everyone in different ways. I have reached out to many friends and acquaintances. These are some of their anonymous quotes. I bought a gun for one specific reason. I just wanted the pain to stop. It was so bad and so dark. The gun is still around, but thankfully I made sure to give it to a loved one for safekeeping. I have had thoughts of suicide, and having other people pass away from suicide has made my depression worse during that time. Their suicides caused me to have more thoughts pop up again. I have missed these people so much and wish that they were still alive to talk to, and wish I had had more time with them while they were here. I never once thought to bring awareness to this, not until it happened. It wasn't to make such an impact that it's something everyone just thinks about, keep it on their minds because it's such a silent killer until the act is done. I missed so many of the signs that were right in front of me, and if I had some insight on it, maybe I could have made a difference. I know I couldn't have changed anything, but the thoughts are still there, and the guilt is so rough. I've learned the new normal, as we talk about in my suicide grief group, but this isn't normal. I've learned to put a smile on my face, go through the motions, and pretend that I'm okay. Truth is, I'll never be okay. To know that my son was in so much internal and emotional pain that he saw death as his only escape rips my heart out. I once believed if my mother's overdoses were accidental. It wasn't until the first attempt that I realized they weren't suicides or they weren't accidents. I was called and told that my mother wasn't eating and just was sleeping all day. So I went there and asked her what was going on, and she said she just didn't want to live anymore. I called 911. An officer arrived and stated that he couldn't take her unless she told him she was a threat to herself or others. At that moment, my mom explained to him how she went looking for a gun, and the only reason she didn't shoot herself was because she couldn't find any bullets. I remember falling to the ground crying because it was the most graphic way for her to finally admit she wanted to die. To this day, I worry anytime my mom's phone number pops up on my phone. I worry that it's a call that something has happened, accidentally or not. Suicide is still, and likely more than, the 10th leading cause of suicide. The latest numbers haven't been released since 2019. These last couple of years have been difficult and confusing for all of us. Isolation has not helped. In fact, the 5th most populated high school in this county had to reopen against mandates due to the uptick in student suicides in 2021. This is alarming. The YES partnership itself was established in January 1986 in response to several teenage suicides in Tuolumne County. Thankfully, the YES partnership offers trainings throughout the year, but what else can be done? Suicide can happen any day or time throughout the year. An average of 22 United States veterans and/or service members take their lives every single day. In 2019, 47,511 U.S. Americans died by suicide, and there were an estimated 1.3 million suicide attempts. My goal is to bring more awareness and prevention to Tuolumne County, first with the annual Hope and Honor Walk for Suicide Prevention and Awareness. It's held on Saturday, ending the National Suicide Prevention Week every September. This year's event will take place in downtown Sonora, starting at Courthouse Park, Saturday, September 11th, 2021, from 9 a.m. to 11 a.m. There will be various agencies with tables that provide suicide prevention support and handouts. T-shirts will be available for sale, and there will be a raffle of many locally donated gift certificates and baskets to support this cause. Eventually, I plan to start the Hope and Honor Foundation that can bring more suicide awareness, prevention, and outreach to our community, and also provide scholarships to those who have been affected by suicide and want to make a difference. Please contact me with any ideas, questions, or or concerns at hopeandhonorwalk@gmail.com. That's hopeandhonorwalk@gmail.com. I have flyers in case anyone is interested in information on the Hope and Honor Walk this Saturday. Thank you for your time.
Thank you.
I really want to thank the speakers that came up, Jen, Bob, Cynthia, and Aaron. That was really good. Thank you very much for that. And with that, it is recommended that the Board of Supervisors recognize September 5th through 11th, 2021 as Suicide Prevention Week in Tuolumne County.
All right, thank you. Questions or comments from the board? Who wants to start? Supervisor Heff.
Yeah, I want to thank every single speaker who came up to speak. In 1960, when I was 7 years old, my father committed suicide. Back then, there weren't the services that you have now. So, without going into story, I'm just so grateful that the services are here for not only the people who are thinking about having ideations for suicide, but those family members and friends who are left in the wake of their passing. That's so critical, especially for the children. So I just honor you and thank you.
Same here. Thank you all for coming up and speaking. It's you know, I had a couple of friends over the years that committed suicide, and it's terrible, and you just think, you know, why? You know, what could have been done? What could I have done? You know, and recognizing the signs is a huge part of it. But yeah, thank you for the work you're doing.
Supervisor Kirk, any comments?
Yeah, I don't know. I think Haff's statement is most powerful. I'll just simply say thank you guys. And we've all known people who've taken their lives, and there are signs. And if you can read those signs, you have to intervene, because people like to deny or like to think that this couldn't happen to this individual, or it's not as bad as it looks. But there are signs, and if you pick up on the signs, if you act on them, you could potentially defer life from being thrown away so needlessly. So I would encourage anybody to understand what those signs and symptoms are, and act and get people help if they can. So thank you guys for what you're doing, because you're basically bringing that information and that stuff forward to the community. So thank you.
Yeah, and really thank you for those of you that shared the stories about your personal lives, and particularly our coworker here, Supervisor Happ. There remains this stigma against having an honest conversation about suicide in our world, in our county, and anywhere you go. That it's one of the things you just are not supposed to talk about it. How are you ever going to fix a problem if you don't talk about it? And how are these families supposed to heal if they're not allowed to grieve and communicate? And the fact that you're there to do that for them, I think, is marvelous. You know, it's truly something special, and I think our county has better resources for this than a lot of other places. Yet it's not. I don't know how to say it. It's not something you want to have to need in a community, but every community needs people like you, to be honest and to be there to communicate with if you're having suicidal ideations, or if you've experienced it in your family, you need help. It's a fact, and it's for lack of having that help that I think we've lost people in years past, and so we'll never know the lives that you've saved with the work that you're doing, but you've saved lives. So thank you, and continue doing the good works that you're doing, and let's continue working on removing that stigma and talking about these things. And even though they're painful, sunlight is the best disinfectant. So yeah. I'm really grateful to have you in this county and working. And Bob, we've worked on these issues for a long time, and things really have improved. So thank you, truly. Do we have any public comments? I'll open it up for if there's any community members that would like to speak. If not, I'll bring it back, and I will read the resolution before us, if that's okay, or would you like to? Okay. Clear my throat. Resolution of the Board of Supervisors of Tuolumne County. Suicide is a public health issue that requires vigilant attention and preventative action. And each death by suicide directly impacts numerous family members, friends, loved ones, and by extension, the entire community. And whereas in 2019, suicide was the 10th leading cause of death overall in the United States. And whereas September 5th through the 11th, 2021 is National Suicide Prevention Week, and September 10th, 2021 is World Suicide Prevention Day. And whereas Tuolumne County Behavioral Health Department is committed to raising awareness, providing education and training on suicide prevention and reducing stigma. And whereas since 2010 through the Mental Health Services Act, the Tuolumne County Behavioral Health Department has funded suicide prevention efforts, and since 2013 has sponsored suicide prevention programs, which is in coordination with Amador Tuolumne County Community Action Agency to provide suicide prevention awareness and education in Tuolumne County. And whereas no single suicide prevention effort will be sufficient or appropriate for all the populations or communities, and all are asked to join together and take a stand to prevent suicide. Whereas September 5th through the 11th is recognized across the United States, provides an opportunity to educate our community about the warning signs of suicide and how best to help those in need. Now therefore be it resolved that Tuolumne County Board of Supervisors hereby proclaims September 5th through the 11th, 2021 as Suicide Prevention Week, calls upon all Tuolumne County citizens, government agencies, public and private institutions, businesses, and schools to recommit our community to increasing awareness and understanding of suicide and suicide prevention in our community. I'll look to see if there is a motion on that resolution and a second.
I'd like to move that we approve this resolution.
I'll second.
I have a motion by Supervisor Half and a second by Supervisor Goldenberg. I'm sorry? Yes, you're right. Thank you for reminding me. So we'll go ahead and call for the roll.
Supervisor Goldenberg,
Aye.
Supervisor Campbell,
Aye.
Supervisor Kirk,
Aye.
Supervisor Half,
Aye.
Supervisor Brandon.
Aye.
All right, thank you, everyone. The motion passes 5-0. And thank you. If you could please read the next item for us. I think we're on item 17.
Item 17, consideration of approving a grant agreement with the California Business Consumer Services and Housing Agency for Homeless Housing Assistance and Prevention Round 2 funding not to exceed $192,075 for fiscal year 2021-2022, and authorize the county administrator to sign the agreement and all related documents.
Good afternoon, Chairman Campbell, members of the board. A little over 2 years ago, the first round of the Homeless Housing Assistance and Prevention Program, also known as HHAP, received funds that were intended to focus on moving homeless individuals and families into permanent housing. The county redirected our allocation to the Central Sierra Continuum of Care to serve as the administrative body on behalf of the county, with the understanding all redirected funds were only to be used in our county. The second round of HHAP funds became available, but at this time, the county determined it was best to retain the administrative oversight of the funds, which allowed the county to use the administrative funds to in part support the homeless advocate and outreach coordinator position. On July 8th, 2021, the HHAP Round 2 application was approved by the state's Business Consumer Services and Housing Agency, and the county was awarded $192,075. And those funds are due to expire in June 2026. In order to receive these funds, the state requires us to perform 4 main tasks. We needed to strategically braid HHAP funds with other local, state, and federal funds to reduce homelessness during the COVID pandemic, demonstrate a commitment to address racial disparities in the homeless population who are disproportionately impacted by homeless and COVID-19. Also, we need to establish a mechanism for individuals with lived experience of homelessness to have opportunities to inform and shape program planning and implementation. And lastly, we needed to utilize the Housing First approach by offering low barrier shelter in a trauma-informed, culturally responsive manner, which means individuals receiving assistance must not be required to receive treatment or perform any prerequisite activities as a condition for receiving services. In closing, it is respectfully recommended your board approve the grant agreement for HHAP Round 2 funds between the County of Tuolumne, specifically Health and Human Services Agency, and the California Business Consumer Services and Housing Agency, not to exceed $192,075 for fiscal year 2021, and authorize the county administrator to sign the agreement and all related documents. Thank you.
Thank you. Questions from the board? Okay. Questions?
I do have a quick question, Campbell.
Okay, we'll start with Supervisor Kirk, and then I think Supervisor Half has a question. Go ahead.
Hey, Rebecca, just real quick, this money, is it to directly purchase housing or kind of like a pass-through to support agencies that are purchasing housing?
Yeah, it is not to purchase housing. It's more supportive services, case management, hotels, transitional shelter, permanent housing too. If we have some, it definitely will pay for that in addition.
Okay, thank you.
Yeah, I just want to make sure I heard correctly. There are restrictions on this grant where you can't require services Is that correct?
We are not allowed to require individuals to participate in services in order to get assistance from this grant. Very low barrier shelter mechanism.
Okay, so how best do you see that we use this money, assuming we get it?
Case management has been really the item or the service that has most effectively supported our individuals that are homeless. Putting them in a hotel is not sufficient. They need supportive services. They need case management, and we've invested many dollars in case management, and we continue to see that is a good investment.
So you can give them some kind of supportive housing and offer case management, but they don't have to accept the case management.
They don't have to accept the case management that drives them into, or not drives them, but requires that they go into substance use treatment, or that they have to stay clean and sober for a couple of weeks before they're able to get services. So basically, it's low barrier. We have to be able to support them where they're at that moment.
So it sounds like it's okay to still do wraparound services.
Absolutely.
Okay, just wanted to make sure we're not just giving them a bed and a warm room for a day or two, because that would defeat the purpose.
You're absolutely
All right, thank you.
Could you kind of, since we've gone over a lot of similar things to this over the years, is this similar to, I guess last year we had an issue where it went through the continuum of care. Are we talking about the same funds here? Or is this different?
It's the same type of funds, except this time it did not go through the continuum of care. We applied on our own.
Okay, gotcha. That was all I needed to know. Thank you. Okay, is there any public comment? Anyone like to speak on this? Okay, if there are no other questions from the board or comments, I'll look for a motion.
I'll motion to move on staff recommendation for item 17.
Second.
All right, have a motion by Supervisor Brandon, second by Supervisor Half. We'll call the roll. Please, could you help us, Ms. Ryan?
Supervisor Goldenberg,
Aye.
Supervisor Campbell,
Aye.
Supervisor Kirk,
Aye.
Supervisor Half,
Aye.
Supervisor Brandon.
Aye.
All right, thank you very much, everyone. Motion passes 5-0. So I'm going to look to our CAO and our county council. We do want to go into the budget, but the question was, you'd prefer that we did closed session first?
Correct.
And then go back to the budget?
Correct.
Okay. So let's go ahead and do that. So we'll look at, could we go ahead and read our closed session items?
Number 18, closed session. Conference with labor negotiators, Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, and Kimberly Phipps, Senior HR Analyst Relief. Authority Government Code Section 54957.6, all bargaining units.
Okay. If there is any public comment, now would be the time. And we've had a very patient gentleman waiting, and I really appreciate that.
I always learn something when I come to Tuolumne County, so I appreciate the fact that you all listen to folks, and that's important to me, so I have no problem staying. Again, I'm Mike Egner with Operating Engineers Local 3. I'm the business representative for 2 of your labor units, approximately, well over 300 people altogether. I'm here because you're going to be talking about negotiations, obviously, in your closed session. And I'm here because your employees are very frustrated right now. And just watching what happened with the COVID issue today, you can't blame them to be frustrated with what's happening in the world today. But you throw in negotiations for a new contract right now. You throw in the fact that their medical insurance is changing. There's a lot of frustration with your employees. They're not happy. In fact, you're losing employees. I'm not here to be mean or be disrespectful, but our last negotiated contract, we actually had a salary compensation study that was implemented, and you all, when I say you all, I'm talking about the board, brought the employees up to within 10% of what the median was, which still left them 10% below everyone else. Well, during the last 4 years, those folks have gotten raises as well, so they're well below that. In fact, there has been 2 studies done now internally, one with behavioral health, which I've seen, And there are employees that are 60% below it now, so we're not catching up. We're pretty frustrated in the sense that we had 2 negotiation sessions where your negotiating team was not given any authority. I actually handed a proposal across the table, which you all saw was for the American Rescue Plan Act of 2021. And I'm really disappointed in that because that was one of the best things you could have used to make a bridge to your employees, which are your biggest asset in the county. It's not too late to do something, but you need to do something with those funds because you can. Because the perception was I saw a document come back to me where it looked like the county was looking for excuses not to give money to the employees, when that's not the case. Just because they worked remotely at some point in time, at one point, everybody was working here. It took some time, so everybody would qualify for that. We have other employers that are providing some money to their employees. Heck, Little Sonora is giving their employees something, even their part-time employees, and they got a fraction of what your county got. So, right now you have employees that are making such little money that they qualify for benefits. With COVID, we've had them exposed to COVID, we've had them infected with COVID, we've had them pass away from COVID. So these folks are out there, and you really need to rethink this American Rescue Plan money and think about incorporating that into your negotiations for this next MOU, because you're making a mistake by not doing that. We see, employees right now that are working in offices where the sewer system is broken. They've got plastic tarps up because of asbestos. They've had to bring in porta potties. So your employees, they need you to do something. Offering us a 1% raise over a year and saying, hey, we need to come up with a better way next time, that's not acceptable. I'm sorry. So do something, please.
Thank you very much. Okay, is there any other, okay, so we have someone on the phone that would like to speak. Okay, you're on with the board. Welcome, and thank you for your patience.
Hi, thank you. Thank you for having me on. My name is Shauna, and I am a Tuolumne County employee, and I am actually part of the management bargaining unit. But this phone call is actually not for my bargaining unit. It's for my employees. I'm a supervisor at the Department of Social Services, and I supervise the eligibility department. And one of the things I wanted to mention is not just have our employees are not only extremely overworked, extremely overwhelmed, but they are, because we are so severely understaffed, they are doing the work of not just 2, but 3 or 4 employees. And that doesn't include when we have more employees out due to quarantine or isolation. One of the things that I did some very quick math on is when I started with the county. When I started with the county back in 2013, minimum wage was $8 an hour. Minimum wage now, just today in 2021, is $14 an hour. That's about a 75% increase in minimum wage. Now, my starting pay when I started with the county at the pay scale of step 1 for eligibility specialists, I was making $12.42 an hour. Step 1 for an eligibility specialist today is somewhere about $15.47. Maybe I might be off a couple of cents, but the increase for the eligibility specialist position has increased 24%, 24.5%. So minimum wage has gone up 75%, but eligibility specialist hasn't. Now, McDonald's right now is hiring for $16 an hour. Taco Bell, if you get a night job, they're hiring at $18 an hour. This job is too hard for our workers to only be getting paid $15 an hour. And a 1% raise truly is just a slap in the face. Thank you very, very much for this time.
Thank you very much. Is there anyone else on the phones that would like to speak? Okay, anyone else from the room? All right, so we're going to go into closed session. Do we anticipate a report out? All right then. So we will go into closed session and then return, and we'll discuss our 1:30 appointment on budget. Thank you very much, everyone. All right, welcome back, everyone, to the meeting of the Tuolumne County Board of Supervisors for September 7th. So we are back from closed session, and we have nothing to report. We have one more appointment today. It's our 1:30 appointment. And I'll look to our board clerk. Ms. Ryan, could you please read our 1:30 appointment?
1:30 p.m., consideration of providing direction on the development of the fiscal year 21-22 adopted budget.
All right, good afternoon, Mr. Chair, members of the board. I am Jason Terry, joined up here with Liz Peterson, Eric Earhart, and Tracy Riggs from the County Administrator's Office, as well as Debbie Batista, your elected auditor controller. We are here today to discuss the 21-22 budget with the year-end accounting, settling things down, and give your board an update of where we are in the budget process, and look to your board for some additional consideration as we finalize the development of this budget. So our mission statement: to commit to providing exceptional public services that creates a healthy and safe community, exercises natural, cultural, and financial resource stewardship, promotes economic prosperity, and enhances quality of life. So in this section, we'll kind of just do a brief look back and recap of where we've been up to this point. And here's a brief snapshot of the budget process. Obviously, you can see the arrows extending both ways. There's a lot of budget meetings in between here and beyond what we're seeing here, but really what we're seeing is within the last couple months, the process leading up to this. As in the diagram shown, we're at the blue arrow. We're bringing the budget to your board for additional direction. And as you can see, the next step, the budget being brought to your board on September 21st for approval and adoption. So this is a brief synopsis of where we were with the June recommended budget. You can see it was $223 million, and that's across all funds. It has had $7.5 million in contingencies, and that's once again across all funds, with 682.8 FTEs. There is no concessions in the June recommended budget, and it did not include the majority of the American Rescue Plan funds beyond the initial approved amounts of fire inspector, code compliance, those types of things. So with the fund balance that we projected during the recommended, as you can see on the bottom here, it was about just shy of $3 million. And this should look very familiar to your board. These are the items that your board approved under those projected fund balance. Various items are working their way through the process of being purchased here, and we're at various stages on a variety of these. And this one is another blast from the past here. The American Rescue Plan on the August 13th, $2.5 million allocated for that. Things that were discussed, of course, the cybersecurity solution, county fire equipment, the different equipments needed for various departments, as well as a mailer for business innovation and assistance. So here's where we start to get to actual fund balance. So during the recommended budget process, we were guessing, we were projecting where we thought we were going to end in the May timeframe and early June. Where were departments going to finish as far as expenditures, what revenues were going to come in? Well, as we extend through and get into August and all the year-end accounting is done, we start to actually see where fund balance is actually landing. So you can see all the different, well, not all the funds. There's a couple relatively minor funds that had no changes that aren't listed on this slide, but most of the major funds and all of the changes are listed here. Of course, the largest being the general fund there, with the second column there is the projected, the third column is the actual amount, and the variance being the final column there. We'll spend the next couple slides going over why the variance is there for the general fund. As you can see, there are some additional revenues came in under our road fund, fire as well. That solid waste, that is an amount that was transferred over to a trust fund. And then, yeah, just some other changes there across the funds. So for the general fund balance, general fund from, and we're going to be talking a couple different data sets here. For this, we're talking where we projected year end to end and then actually where it ended. So between that, the general fund expenses were about 4.9 million lower than we projected. A lot of those were our grant funds, our state revenues, about $3 million. And those don't have an effect on fund balance because if we don't spend it, then we don't claim it. But we do see some savings that did impact fund balance, including some vacancies and salary benefit savings. There were some timing as far as software and maintenance. If we don't expend it in the last year, it gets rolled forward and budgeted in this year. That's a lot of those are what we're seeing there, and some other equipment and vehicle charges there as well. And then on the other side, revenues higher than anticipated. The major outlier here, as you can see, we have a couple depictions here, is the sales tax. That came in significantly higher than we anticipated. So it was $1.2 million higher than we projected. And you can see on the table on the bottom kind of how we've seen year-to-year changes. And as you can see, this year's, and specifically in the fourth quarter, just jumped up, and that's a higher variation than we've ever seen on the sales and use tax itself. So that being $1.2 million higher. Of course, property tax and transfer taxes, we saw that $150,000 approximately each, and then the TOT as well at $370,000 higher. So that's all leading up of where we've been, and now we're going to jump into some of the built-in adjustments from recommended budget. And I think Eric Earhart will take it away from there.
Yeah, I'll go ahead and take it over from here. So as we move forward, we're going to start talking about some of the adjustments that are built in and just a high-level overview of where, across all funds, where the funds are going. You can see roughly 33% goes to public protection. That's your fire, law enforcement, public health. We have 15% for general government, 13% for health and sanitation, 12% for public assistance, and so on. That's all done with allocated positions of 687.8 positions, which is in the budget right now. Unfortunately, right now we have about 585 filled positions, so we're down about 100 positions right now today. And this budget does include the ARP expenditures as well that was previously discussed. As we focus in a little bit more on the general fund budget this fiscal year is set at about $95 million. 2.8 million of that is set aside in contingencies as well. And this encompasses 404.5 employees. And again, it's just a little more focused on where those general fund dollars go, 58% to public protection, 27% general government, and so on. So as I mentioned, this does have an increase of about 1.9 million in contingencies, bringing the general fund contingencies up to $2.8 million. This is comprised of $1 million carried forward from fund balance, plus another 1.8 million from increased miscellaneous revenues. Across all funds, we have 12.7 million in contingencies, which is an increase of 5.1 from the recommended budget you report saw in June. Increase in general revenues contribution, or to the general reserve, sorry, of about $1.2 million. This would bring our reserves up to $4 million, which is higher than we've seen in about 2 decades. This is about 4.5% of the general fund for fiscal year 2021. And it is your board's policy to work towards 5% of governmental funds. That excludes grants and capital. So on the next slide, this is just a graphic of what the general fund reserves look like in the balance of that account over the last 20 years or so. As you can see, it stayed fairly flat for a while, and it's slowly been increasing, and those last 2 columns there is recommended and adopted. This is information that our county auditor controller has tracked and kept for us. The line you see there is the percent of general fund of what those contingencies are, those reserves are. Debbie, did you want to add anything to this slide? Since this is your data set.
Thanks. I think one of you wrote to me, actually, no, one of you wrote to me and was, thinking that the amounts, are saying pretty consistent. What you don't have, which would have been better if it was on the slide too, is that way back in the 20 years ago, the general fund balance or appropriations for any given year, in some of the cases were more than 100% less than it is today. So the fact that we have $4 million today, but with a $95 million budget, and we had, $2.9 million reserves, but we only had a $43 million budget, is significant. And we need to look at the risk, which is the answer I gave to one of you. As the general fund gets bigger and larger, the risk is higher for us. Tuolumne County has been very, very fortunate that even though we've had a lot of fires and we've had some really big fires, where one may need their reserves with a fire is that, like what happened in Sonoma, what happened in Butte County, what happened in Calaveras County, that yes, the cost of the fire was very expensive, but most of the times the feds in the state will help us pay for that. What the Fed and the state doesn't help us pay for is lost revenue. If we had a large percentage of our structures like they did in Sonoma County burn, in Lake County, that's when Lake County had major problems because they didn't have the reserves to take care of the lost property tax revenue. The assessor is required immediately to lower those property values down to zero or close to zero. You have to give the money back to the people if they've paid some of the taxes. We don't have the money in reserves for that. Like I said, we have been really fortunate in the Rim fire and the other fires that we've had very little structure. But if we have a major fire with structural damage, the feds and the state won't help us. And that's where you need your reserves to come in. So just the fact that the reserves are going up a little bit, or the reserves are $4 million, $4 million to $95 million, or $4 million of what we could have with some catastrophical, flood, fire. We need to start protecting ourselves because I'm not sure that we're always going to be as blessed with our disasters as we have in the past.
Hey, Debbie, I have a question real quick.
Okay.
This is Kirk. What would be a comfortable number in your idea for reserves? If we're at 4, what would make you feel comfortable?
I think somewhere between, the way that we're building it up, I think that we want to be somewhere, believe it or not, between 8 and 10% of our appropriations for the general fund, because that's where we're going to have a problem. I mean, there's lots of areas that the county is going to or could be hit. Let's say we have a major recession and realignment for HSA is built on sales tax. What happens in major recessions? In major recessions, what happens to the demand on HSA? For food stamps, for all of that, if the realignment goes down and their revenues go materially down, they will be, and the general fund needs to help them, they will be looking at the general fund to help them support the demand on their services. We've only had a couple times in my memory where the general fund had to give HSA, mainly social services, additional funds because they didn't have the revenue sources for that. So it's not just fires, it's not just disasters. Think of what could happen to us in a major recession. Property tax goes down, sales tax goes down, the demand for services go up. We would be pretty vulnerable. So for me, 8 to 10% of having that set aside. There's things that you could do with that, but still keep it there, to make it more comfortable if there was things that you wanted to do, have a major expenditure and over the next 3 years, pay it back. There's things that we could do. We, the County of Tuolumne, have just been really lucky that we aren't Lake County, we aren't Calaveras, we aren't Butte County, and that our local revenues, because of disaster, was materially hit. That's not covered by the federal or state government for OES.
Sorry.
So
Let me-
got a
can I just
couple of
clarify
comments here as
something
well.
Real quick. When Debbie is speaking to that we don't get revenue, they don't backtrack, they don't backfill our lost revenues. But where we do get assistance is if we have public buildings that have been destroyed by an event. So we do get assistance for that, but there is usually almost no assistance for individuals. And so when we get the calls that someone is under or uninsured, there's usually nothing available for those individuals. And it's only been once, I think it was at the Sonoma fires, or maybe it was Paradise, where we saw them actually put something into the state budget to backfill lost property taxes. So when people's homes burn and we no longer have property taxes because the value's not there, there's only 1 year that I remember the state putting monies back into the budget for counties and cities to be able to backfill some of that lost revenue. Otherwise, as Deb said, it can be catastrophic when you lose hundreds of homes and that's your base for property taxes.
Yeah, and I was just going to make a couple of comments. So basically in 20 years, we had $3 million in reserve, roughly, 1999, 2000. And 20 years later, we had the same. But our county budget, general fund side, rose from 36 million to about 90 million. So, we're just, like Debbie was saying, 10%, we really need to be up around $9-10 million in reserves. And so I'm supportive of what we're trying to do here to, let's get this bumped up, but we need to keep bumping it up because, when you look at, personal households, generally accepted, they say you should have 3 to 6 months of expenses, put in a savings account. Nonprofits, about the same. Homeowners associations, they need to put money away typically for, major improvements over the years. So we're just far, far behind on what we should have in reserves. So thanks.
Yeah, so just to kind of
Amen to
tag
that,
on.
David.
So just to tag onto that, you can see in 2000, we were at 8% of the general fund budget, and now we're down to just over 4%, which represents exactly what Debbie was talking about. So continuing on, some of the other changes we see in revenue is we have a $900,000 increase in the homeless advocacy grants. That's obviously offset by matching expenses. Additional $150,000 for the sheriff and state revenues, grants and donations, and another $140,000 in air pollution control, which is again offset by some expenses. Increase in expenses in this in the adopted budget so far is about $2.6 million, which include again that homeless advocacy grant. Increase in facilities management cost center, that is to bring our building and maintenance improvement line item back to what we spent this last fiscal year, as well as a groundskeeper position for the additional properties we were adding. $330,000 in the sheriff jail expense line item, $185,000 which in the library, which is specific to the staffing, which we'll talk about here shortly, that your board directed us to add back in. $140,000 in air pollution control. And then we're estimating approximately $114,000 on the Washington fire and expenses that are built in there right now with no matching revenues as of yet. We are requesting reimbursement for that fire. So moving on. So what this includes.
So quick question,
Yes.
Erica. On the sheriff jail expenses, are those attributed, is a lot of that the overtime issue that we were looking at, or?
No, so
where?
those, some of that is for additional equipment and also being offset by the revenue on the prior slide from grants and other sources as well.
Okay.
So I think the sheriff is here if he wanted to speak to any of that.
So I'm sorry.
Eric actually answered part of it because I didn't equate for the grant funds from the previous chart. Yeah, I was just looking at the $330,000 expensive, but if you took $150 off of that,
And
you know,
just
then
to be
it's-
clear, the remainder of it is for the health care of the inmates. It's
Okay.
coming out of our budget now, the increased costs.
Okay, good. Thank you.
Okay.
All right, so if we're good, we'll move on to library. All right, so as previously discussed, we're adding staff back to pre-COVID levels in the library. This includes reclassifying the office assistant to the library assistant 1-2, adding 2 full-time library assistants 1-2, 1 senior that would be responsible for the bookmobile, and adding a half-time in each of the Twain-Hart and Tuolumne branches, and then also adding a half-time senior library assistant to the Sonora branch for the literacy grant as well. So this is an increase of 4.5 FTEs for a total of 10, which brings us back to where we were pre-COVID per your board direction. So this year's cost is estimated to be about $182,000, almost $183,000, with an ongoing cost of about $245,000 for a full fiscal year. Since we last discussed the use of ARP funds, we have received additional information on the reporting requirements for ARP funds. So one of the things we did is we kind of swapped some expenses out. So previously your board had directed us to pay for some code enforcement and fire inspectors with American Rescue Plans. The reporting requirements for staffing under ARP are extensive. So essentially, we're still covering those, but instead of using grant or ARP funds, we would use general fund dollars or fund balance and pay for the additional space needs study with American Rescue Plan, because the reporting is so much easier when you're buying services versus paying for personnel. So that is included in this budget as well.
Okay, so now we would like to talk about a couple things that we are requesting your board give us some direction on. Jason spoke about where we were with recommended. Eric spoke about what is currently in this adopted budget. And now we're looking for some direction from your board. So we're going to hit a handful of items. And then Rebecca Espino from Health and Human Services is going to come up and talk about something that she's looking for direction from your board on, and then we will kind of summarize at the end and look for some direction specifically on these items. So we're just going to cover them, highlight them for now. Yes, so first, looking for some direction on access to Tuolumne. So when we spoke to your board previously, we talked about these 2 options for sustainability of access to Tuolumne. Your board did direct us to come back with a more detailed budget for what it would look like to bring access to Tuolumne into the county as its own department. And so that's there under option 2, knowing that we have salary and benefit costs. We also have mandated costs, leave liability, a whole host of things that are mandated for each department that they pay for. And then, of course, various equipment needs, training, those kinds of things. PEG fees, as I discussed previously, PEG fees can be used for certain equipment things, but they can only be used for capital purchases. They can't be used for operating purchases or costs. So we're not confident that we can use PEG fees to cover the entirety of equipment needs for access to Tuolumne. We could, but we're not confident. We also have the cost for their current studio rent in this budget as well. So as you can see, that would be about $182,000 a year. We wanted to bring back option 1 for your board to see once more. If your board opted to simply pass through 25% of the franchise fees that is collected each year, if we're using last year as an example, it would be about $136,000. So it would be a savings of almost $50,000 for this coming year if your board opted to go with option 1. It also, the staff costs or the department costs overall always increase every year. So $182,000 is kind of, what we expect to be the base, knowing that potentially things could increase. Things could decrease too, but just wanted to give your board this fuller picture of what we're looking at as far as costs. And just to be very clear, the CIO's office is recommending that your board consider option 1. Secondly, we wanted to talk about the organization, recruitment, retention, a variety of things. We wanted to show your board that, as Eric mentioned, we have about 585 filled positions right now of the 687.5 that are allocated. So about 100 vacant positions. But of the filled positions that we have, over half have worked here for less than 5 years. The significant majority have been here for less than 10 years. So when we look at recruitment, but also retention, it's a big deal. I mean, the data shows that it's this kind of 5 to 10 year mark where people start really within the 5 years that people start to look at, if they don't have roots in their current organization, that they start to look kind of elsewhere. So we've been thinking, with 58% of the employees who have been here with the county less than 5 years, of course that includes the 100 vacant positions that are currently not filled, knowing that when they come in, they're starting at, year one. And then, as your board is aware, we have, just an inability to recruit for some specific positions, but overall we're having a real difficult time recruiting and difficulty retaining our employees. We also have trained over 200 employees through the High Performance Organization course. That's that 3-day course that we've been working with some consultants to train our employees to really focus on employee engagement and leadership at all levels of the organization. We have a lot of ideas from the HPO or High Performing Organization that we would like to implement, but it's difficult to implement those with everything else that we have going on. Also, we have a department head, Rebecca Espino, who is leading the recruitment retention steering committee, which is made up of a variety of staff members, some department heads, who then chair subcommittees to address the recruitment retention problem. This is, as I mentioned, a problem across the organization. Every department is struggling with recruitment and retention. So we have these subcommittees made of staff that are meeting, coming up with ideas, but we would like to keep that momentum going. And it's difficult, again, with all of the other duties that we have and with the vacancies that we currently have. It's just really, it puts a lot of strain on the organization. And then lastly, of course, there's the opportunity for employee coaching and development that maybe we don't always take the time for, because often we're focused on the employees who are causing some difficulties and not really spending time focusing on the engaged or committed employees. And that also starts to lead to the potential for a retention problem. And so with that, the CAO's office is recommending your board consider hiring, this is a working title, but an organizational growth and retention coordinator. So this would be a specific person who would focus on implementing the high performance organization, the recruitment retention, keeping the momentum going, coaching and development of employees, helping them see where they are, where they want to go, and helping them get there. This would be a cost, an annual cost, because it would be one FTE of about $124,000 a year. So we do feel like that this is an important investment. When we train and or when we deal with vacancies or the loss of employees, that is a significant cost on the organization. Training takes time, and time is money. So that's all I'll say about that. And then we have some also recommendations for some cybersecurity and disaster recovery, and I'm going to have our IT director come up and speak to. Well, first I'll just mention, your board has previously made some investments in this area, and so we're asking your board to consider some additional investments. And so, I'll let Roger come up and speak to this.
Good evening, members of the board. How are you doing? Roger, your IT director. As you can see from here, I think I probably mentioned during the ARP meetings that I was going to be back asking for more stuff related to security. So I'm here asking for more.
Thanks for the warning.
So currently I have a vacant position that became vacant in July, and I wanted to hold off on recruiting that position because my goal was to remove that vacant position and add 2 additional positions into the department. One of them would be a security officer or security administrator, something focused in with that kind of title that would focus on our cybersecurity needs for the organization. And then to offset some of the work that we're going to be losing from that network analyst, we would add the IT technician to help offset that. I had mentioned during the last presentation the impact on an incident that was taking place in our organization at that time. And with my staff, we had estimated over $40,000 of staff time was spent just addressing that. And most of it was handled by myself and my supervisors. So it's overtime that we're working on the weekends and working the nights trying to address it because we still have our full-time jobs. And so I think that kind of leads to why it's so important. We also had to spend $60,000 on a consultant last year to address some security concerns. So I think that we'll overall see a savings in what we're spending in security in this area by adding this position in. And then the $150,000 for the virtual environment does a couple of different things. It allows us to do virtual desktops, and what the virtual desktop environment is a lot more secure than what we're doing with our employees today as they're working remote and they're using the VPN to get into our network. It's actually just them going to a virtual desktop that's going to be housed in the cloud, which is really just somebody else's computers in the cloud, where we can keep our environment secure here and reduce the amount of staff that have secure access into our network from remote locations. It also allows staff to use any devices they want to. You can access you could access our current environment from your MacBook. You can access it from your personal devices across the board. It looks like we're going to be increasing remote work again, and if that happens, we have a lot of staff that struggle to do the work that they need to do from the devices that they have. So with that, that's the two things that I was asking for, and I can answer any questions you may have.
Just one question real quick. So you mentioned the $350,000 from the ARP plan. These two additional are you proposing these come out of ARP, or are you asking us to make, you're just saying you have these needs and
I think
you're
there's a
asking
later
us to
slide.
Yeah,
determine
so
how
actually
those-
the next slide, we'll talk about kind of our proposal for how to fund these needs using ARP
right.
or fund balance. Yep.
That sounds good. Did you have a question?
Yeah, I had one. So this, the virtual desktops, is that basically like a VPN type of thing? Or is that different?
We'll still have the VPN available for the staff. So like when you get home and you connect with the VPN on your laptop, that'll still be available. But our goal is with the virtual desktops, is to probably not make it available to all our staff, but make it available to the staff that are remotely working that don't need VPN access. Maybe they just use one or two applications, and we can customize for each individual what they have access to. So if it's Debbie, she would need access to all the financial stuff, but she probably would say, well, I don't really need access to some of these other applications that I have here at the office. I just need this application when she's on the virtual desktop. It is secure, and it is, they can't install software on it. Viruses can't load on it. They have a lot of different options that have improved over the last 10 years from when I was last using virtual desktops, to where we use a feature at the libraries where once someone logs off and they log back on, it completely re-images the computer. So anything that was done on that computer is wiped out. And there's features like that with the virtual desktop. I want to look at a subscription model where we only pay for the users that we want to use the virtual
I was
desktop.
just going to ask how many users, yeah.
And
Okay.
with that model, we see a little bit higher annual cost, but our initial cost would probably be less than what this $150,000 would be. If we have it in-house and we have it in our environment, then we're looking at that being the initial cost, and then our annual cost would be slightly less, probably about $10,000 less a year.
Okay, thank you.
Roger, I did have a question real quick.
Go ahead.
So this is specifically, the expense is to help fend off hacks or potential liabilities in that aspect. Is that the purpose of this?
The virtual environment?
Correct.
Yes. It does a couple things. One, it allows our staff to be more mobile and work from any location. The second thing is it allows a more secure solution for our staff as they're working remotely or in different locations. And I mean, with the virtual environment, you could even, I'd never recommend using the kiosks in a hotel to do anything, but I would say you're safer doing it in the virtual environment than what you would be doing it trying to connect through VPN or do any other kind of work.
Okay, thank you.
Yeah, my question was similar. Maybe it's just really late in the day. But I'm not getting why we need the virtual environment. So maybe you can kind of give me some bullet points for that. And you said it was located in the cloud. Is that what you said?
Well, my preference would be to find a solution, to use a solution that's located in the cloud.
And so I need to also understand why that's more secure. So if you can answer both of those.
So it actually technically probably wouldn't be more secure. It's just gonna cost the county less, long-term and short-term. It also takes the onus of the hardware and everything that's involved in that and puts it on somebody else. So that's where most of the cost savings come from. As far as the benefits, aside from the security, it allows staff to really use any device they want. One of the big pushes for this 10 years ago was BYOD, right? Everybody was bringing their own device to work. We're trying to do that. We have staff who have to work remotely today that we don't have laptops for. And we struggle to share laptops between staff and swap them over between departments. We keep a loaner program so we can try to get some to staff when they have to work remotely, whether they're quarantined or whether they're just working remotely because of the staffing model in their department. We still struggle with that. But they have computers at home and they could do some of the work on their own computers, but not in our current environment. The virtual desktops would allow them to work from any of their devices.
Okay.
Roger, just the backlog. So if we explain the backlog, you haven't ordering new
Yeah.
computers, even if we wanted to, how long that is?
Yeah, so right now we're telling all the departments, if you want a laptop, you need to order it now. So hopefully we can get it before the end of next fiscal year. We're 6 to 7 months at a minimum on the laptops that you guys have here, and you kind of experience that. We order your guys, it took 3 or 4 months, I think, at least to get them, but right now our waiting period is about 6 to 7 months. There are options, and I mentioned this. We can go to different devices that are almost twice as much in cost. So, which is another substantial impact on the county. We're not able to get as many devices for the amount of money that we have budgeted for it.
So Kathleen, there may have been times when you wanted to go home and work, you forgot your laptop, or you didn't have a county-issued laptop. You could go home and log in through the virtual environment, and you could still do what you wanted to do on your own laptop, which you would not be able to do right now. So you can get to your emails, but getting into the softwares and to the network, you are limited in having that access. And so you can also access it from anywhere when you're working as well in a little bit safer environment. But as we continue to see the requests coming in from department heads for hardware, and then knowing that hardware is difficult to get right now, and then Dory can tell you during the fire, we didn't have enough computers in there. So if others would have had something, they could have shown up with it. So we're just trying to be more creative with, this could save us from having to buy, like I say, I have 4 different types of, Roger's laughing at me. So I have a tablet, my phone, a laptop at home, and my desktop, right? Well, I really wouldn't need all of those, but I cannot access everything I want to access from home from my personal computer, so I have to have a work-issued computer. So that's what we're trying to get to, is to try and reduce some of that redundancy as well.
And we do have a lot of staff that have multiple devices. I don't know how many have 4, but we have a lot. Any other questions? Good.
Thank you very much.
Okay, so I get to talk about how do we recommend paying for these items. So one of the things that we didn't have actually in a previous slide, that is one of the first things on this slide, is we have been talking to your board about the need to look at a different way to do our board committees and commissions. We know that sometimes we've gone all virtual, and in the world that we're in now, there's a lot of people who want to do in-person and they want to do virtual. Unfortunately, we don't have the room or the proper equipment to do that. We've tried doing it in this room, and it really does not work well. You can ask Quincy, who's tried to do our planning commission meetings out of here. So what we have talked to your board about in the past, and we've kind of put together here, is what we'd like to do is take a building, and honestly, the one that we're kind of looking at right now is the old rec building. It's right centrally located, it's ADA accessible, is to put the equipment in there, and so that means microphones, that means cameras, audio, all of that, so that people could participate remote. people can come in and be there in person. So we would need to invest in the equipment and the building, but that would be where all board committees and commissions would take place. This communications tech is meant to be the person who would run all the equipment, ensure it works. So when you show up for one of your committees or a department head shows up, they've already posted the agenda. They have the PowerPoint ready. All of the microphones are working. So you literally show up and it's ready to go. So we've been trying to think of a better way to serve our community who wants the best of both, right? I don't want to come out of my home yet, but I do want to participate in these committees or commissions. They could do that in this model. And that is part of the reason the American Rescue Plan funds are out there. However, you'll see, because we were trying to mitigate the use of each, that we are actually recommending for the communications tech, because it would be an ongoing cost, that would be out of fund balance. And the communications tech, again, is a full-time individual that is dedicated to ensuring that equipment and everything is up and operational for every single one of those boards, committees, and commissions. The IT position, it says conversation. So the conversions that Roger we're going to talk about it, yes.
It's an expensive conversation.
Yes. So what Roger was just talking about was he would like to take and eliminate one position and add two positions. I will tell you historically who your security officer is your HR director. And obviously, Anne, if she were here, would tell you that's a problem. So we really would be taking one more step in ensuring that we are secure with the information that we have within our network. And then another IT tech, which we all know, there's probably no end to the number of IT techs that we could have with all of us who, like myself, who doesn't know how to work anything anymore. Heather's laughing at me over here. So the recruitment and retention coordinator, I have to tell you, I'm pretty passionate about this one. I've had some conversations just talking about department heads, and one of the questions that came to me is, isn't this something department heads should be doing? In an ideal world, yes, this is what we should be doing. However, we're not in an ideal world, right? We have a lot going on right now. Your department heads are running their departments. And unfortunately, when there's a lot of high stress, there's a lot of personnel that act out. And as a result, you spend more time on those specific issues that are happening that might be violation of county policies, and not enough time really engaging with the staff who are committed to our community and to our organization and to seeing us go into the future. So that's why that is on there. Again, we're saying because both of those three there are positions, that they should be something that would come out of the general fund. Access to Tuolumne contract. Now, I did hear Supervisor Half, and we had this conversation, and we had gone back and looked back at our notes. You guys had directed that you thought you wanted a department, but you also said, please come back with additional information of what that budget would look like if it were a county department, which is why we did that. If you would like to see it again, we can go back up. Obviously, the board, our staff will put into place anything you want. That $136,000 would be 25% of the current, what we received this last fiscal year, in our franchise fees. It could be any percent. We went with the 25, which is what your board had discussed. Now, from my perspective, Deb and I were sitting here going back and forth a little bit about it. We know that anytime you have an employee, there's other costs that come along with it. We end up with unfunded mandates when it comes to workers' compensation, leave liability, and PERS especially. So this is why when we compared the two, we're making the recommendation for the direct allocation to the Access to Tuolumne, but of course your board, we're looking to you to tell us, now that you have what it would cost to be a department, the minimum, or to do a 25% allocation, we're looking for your direction on where you would like us to go with that.
Can you go back to that slide if you want to start there?
Yeah. So this is the slide. These are the things we know for sure. There will be some line items that will be missing in there, but we took the mandated costs related to one other cost center, so our innovation and business assistance, a cost center that has one individual in it, and we looked at what their mandated costs. Again, those are going to be your unemployment, your post-retirement medical, your leave liability, workers' comp, yes. And then salaries and benefits are going to include the base salary. It would include cafeteria, PERS, FICA, that type of cost, and then you can see what the other ones are.
I think the PEG fees are exceptionally low. They get a lot more in PEG fees than 26,000. I'm not understanding that.
Yeah, the intention was that our estimate, so as you know, PEG fees can only be used for really specific costs, for capital costs. So the intention was that if, say, 40,000 is in the budget each year for purchases for equipment, we weren't sure that the full 40,000 could be covered by PEG fees. So we were sort of estimating that maybe 20,000 of the 40, about half could be covered by PEG fees, and then the rent also can be covered by PEG fees. But the rest of the budget can't be covered by PEG fees. Yeah.
But
So the 26 was sort of the increase in revenue to that cost center that we expect.
So is there assumption that they would stay where they're at?
We don't have an assumption
Studio,
at this
I
point.
see
We don't know.
studio rent. So where did you get that figure from?
That's the current rent for the studio.
For the studio they currently
right.
have?
That's right.
Okay. So was there any intent on actually physically bringing them into the county and finding a place for them, so this would reduce that cost?
Yeah, we don't have any plan on that right now. We don't have a location, and that, of course, would be a significant increase in, or just expense to pay up front to set up a whole location to turn into a studio.
Supervisor Half, they are included in the space needs study. That would just be something that's not on here. So if we were to then go in, obviously, and buy the equipment and get a separate building and all that, that would just be in addition to what you see here. But they are in the space needs study, so they'll be included in that process.
Well, I'll tell you, we had a board meeting with Access Tuolumne just recently, and we let them know that the board decided to go with option 2. So this is kind of a shock for me to see this as 2 options again, when I thought we decided.
So echoing that, I did feel that we made a decision to move Access Tuolumne in-house, so it is disappointing somewhat to see this again back basically with option A and B. That aside, so one thing is talking about the PEG fees. I believe there's a certain amount, I think, still set aside. It does seem low, that would be able to cover the equipment costs. And so to add 40,000 for additional equipment, I feel that with even assuming 26,000, there'd be the possibility of maybe waiting a year or two to upgrade, but being able to still run an effective studio there. I also question, and these are the same when, at least with my direction before, was trying to get more of a budget coming back. My main concern was the pay structure for that position. So I believe we were looking at Calaveras directly across, what the pay for station manager there was. I think it was in 60 to 65,000 range. This with 124 for salary and benefits is obviously much, much higher. You can go on, look up ZipRecruiter TV station manager within 75 miles of here, and the average pay is 50,000 a year, or about $24 an hour. So if you look at that, and rule of thumb, let's add just 50% of cost onto that for everything else, right? 75,000 without the equipment, it starts looking much smaller. There's also some things, for example, that don't feel like they're represented in option 2. For example, the amount that we would save from the meetings here under a contract like that. It doesn't seem like it accounts for some of the private service done to other entities like the superintendent of schools. That is revenue that we get. And so those credits don't seem to be here. So I don't think this is the budget that I was really looking for. I was hoping for an absolute minimal cost range. Here's what it would be if we're really just trying to make this as lean and mean as it can be. And here is, I think, a flushed out version of what it would look like with, say, the full 25% that we were considering before. So this doesn't provide the information that I think I would need for that, especially related to the salary.
I'm sorry, Roger's just letting me know that we're not broadcasting at the moment, Access Tuolumne, so they're working on that. I don't know if we want to take a little bit of a break so that we could come back to this while they work on that.
Do you know, is this something that'll take a couple minutes or longer? Not sure? Okay. Okay, so let's take a Is 10 minutes gonna do you? Or less? Okay, so we'll take a 10-minute break, reconvene at 6:28. Okay, welcome back to the meeting of the Tuolumne County Board of Supervisors for September 7th, 2021. So when we left, we were talking about the budget. We were on Access Tuolumne, and I think Supervisor Brandon, you had finished, and Supervisor Kirk, did you have comments?
Who's going first? Is it Brandon or myself?
It's up, I think Supervisor Brandon already went, and so I was going to check with you to see if you had any comments on this, and then Supervisor Goldenberg.
I mean, my comments haven't really changed much on this item with Access Tuolumne than before. I heard that there was still going to be some discussion of potential. I don't have the second. Let me look at the paper. It's right in front of me. I can't find it. Anyways, there's discussion that there might be another provider out there who hasn't paid fees, and we're looking into it. So I kind of wanted to wait until then to see what revenues that might bring up. But just excluding all that, I would rather go with option one. I don't want to do either. I kind of want to wait, but I'd rather go with option one just because it's cheaper. This money is going to be taken out of the general fund, but I could also get a little bit of Haas frustration if we decided on option two. So I guess my question to staff is: did we already decide on option two, or were we gonna bring this back for further discussion?
So your board did direct us to put a more detailed budget together and bring it back for you to see. So there was
Specifically for both
consensus on
options,
option
or-
two, but, and then as well as, your board was also going to have to decide on the classification and, assigning a bargaining unit for this position, et cetera. So there was still more work to be done.
So on that, do we have any? I'm trying to find it in this presentation. Do we know any more regarding if there was going to be another? Here it is. Franchise fee. I know there's discussion that there might be another franchise fee being investigated.
Supervisor Kirk, I can answer that. Our office sent a letter to AT&T and I think one other provider. We heard back from AT&T last Thursday that they don't believe they owe the fee and haven't been paying it because they're not providing the service. So that's the most recent correspondence we have from them.
So if my original request is that we don't really have an answer, the answer is there's not additional fees coming in, then my recommendation based on just the numbers is to go with option one. But again, I don't even really want to, or actually no, option one, because we're not bringing them in-house. I think it's important to keep media separate from government. I think once they become an employee, if you're, more left-leaning board, I don't want the media to be more left-leaning. If you're more right-leaning, I don't want the media to be more, I want the media to be fair and on their own and be able to do their own thing. And so that's just kind of where my thoughts are on it. I think they can manage it well. I think they've already done a great job managing it. And I think giving them the 25% to continue on, in my mind, is the best route. So I will leave it at that. Thank you, guys.
Supervisor?
So Supervisor Half expressed that the PEG fees might be a bit higher. Do you have an idea of what range? I think that makes
So
sense.
each year the county brings in between 90 and 100,000 in PEG fees. So it's not to say that we don't have PEG fees, but it's what can we use the PEG fees for to help cover these ongoing costs. That's the concern. So we estimated about 26,000 can be used annually for the ongoing costs for this new department.
And I think the best person to ask is our Access Tuolumne person right now, because there are lots of needs that we haven't even talked about that have gone we've foregone those, and there's all sorts of, I talked about making this sustainable, whichever way we go, option one or option two, it needs to be sustainable. And if we had the franchise fees for Access Tuolumne, they would be able to do more and not have to cobble things together. But definitely in option two, they would be spending a lot more than 26,000 for the needs that they have. I don't know if we want to call Jerry Day down to talk about that, or if that's appropriate right now.
If you have a question for him, absolutely. Can you break away?
He can let it run on automatic.
Here, let's see. Well, you got a pretty good, so we won't be able to have a shot of Jerry speaking at the podium, but folks will be able to hear you, and they'll be watching our reactions to you. I'll try to be real flamboyant with my reactions to what you say.
Okay, hello.
Hi.
So,
What was the question?
well, on the PEG fees, so I'm looking at this chart and it shows equipment of 40,000, studio rent 6,000, but we're only showing $26,000 PEG fees. So
I believe what they're saying is the PEG qualifies. I think what Liz is trying to say is that some of the equipment needs that we may have may not be able to be paid by PEG fees. They might not qualify for that. Is that accurate?
But, to Supervisor Half's point, that if there is, say, a larger expenditure that the department would want to make that would qualify for PEG fees, you can pull in that PEG revenue that exists currently, that lives in its own fund, and use that to pay for some of these larger one-time extra costs. What you're seeing here is like an ongoing, every
Right, and
year,
that's
sort
what
of
I'm
just
trying
normal
to-
budget, yeah.
to get that pinned down. So the mandated costs on this chart is that all the fees that we were paying for services before, or how does that?
So in both option one and option two, it eliminates our current contracts that we would have with Access Tuolumne. So you really are looking at apples to apples there as far as what our costs might be. The mandated costs are things like leave liability, workers' comp, PERS fixed, unemployment, the cost for the telephone. So those are mandated costs that every department in the county pays. And the amounts vary based on the number of employees that each department has. We pulled this number, as Tracy said, from the Business Innovation and Assistance Director Cost Center, because he also is a department with only one employee. So the mandated costs would be very similar. So they're comparable.
Right. So the looking at about a $46,000 difference between option one and two. And I'm not sure, Supervisor Brandon spoke about the salary and benefits, and I didn't know if there was some room there, that would bring this down somewhat. I don't know that I'd want to see it go down the level that Supervisor Brandon said, but, I certainly am interested, in the overall cost to see if we can get that to balance, a little closer. Anyways.
You mean like to match option one and option two? Is that what you're saying?
Not necessarily match, but get it, closer than it is.
And just knowing part of I think why we're having this conversation in part is because pulling in an employee and creating the department, while maybe we could bring the cost down for the first year, the cost will increase every year in large part because of those mandated costs. All other kinds of costs too, but so that would be sort of the base year. But yeah,
Okay.
it's possible that we could reduce some of that.
Thank you.
So, well, one thing I wanted to kind of go over real quickly is that we did ask staff to come back. I just heard some comments that why is this coming back? We did ask staff to come back with those total cost numbers because we didn't have that when we were talking about this the last time. So I do think that these are reasonable estimates. Obviously, things could change. I'm kind of not clear. It doesn't sound like I didn't hear a whole lot of consensus on much. But I kind of feel that I'm worried about the unfunded liability and bringing on additional unfunded liabilities by creating a new department. And I've just seen how those things can, in a year where the county struggles, where they can be a strain and it can be really difficult. And so that's why I tend to support the staff recommendation, not necessarily because it's a lower, the cost is lower. I'd rather put the money into the agency and then let your board figure out how to use it. You and your board work on that and not have it be the county's responsibility to determine how that money's spent. So I support the staff recommendation. I heard that Supervisor Half's and Supervisor Brandon, I think, were in support of option 2. And I wasn't real clear for you, Supervisor Goldenberg.
So I tend to be more in support of option 2,
Okay.
just because it allows us a lot more flexibility in what we can do with the position. We talked about things like OES use and making videos and other areas. I think there's a pretty strong need. I do hear what you're talking about, but I think the mandated costs is accounting for some of your concerns, it appears. But I think there's a lot we could do with the position, in different ways.
And to be clear, I'm not advocating for option 2 because I'm not trying to limit it to either option 1 or option 2.
Yeah, we
Sure,
have to make a
but
decision.
there's details in this too. So
We are looking for direction from your board and how to build it into the budget that's coming back
Yeah.
on the 21st.
So as we broke it down last time, one was whether to bring it in-house or not. I do support bringing it in-house, which is like option 2, but I do not support it at those numbers. What I'd asked for was the salary classifications, benefits in that type of detail to then make that decision, so.
Can I clarify, just Supervisor Brandon, because I don't think we actually answered your question. So this salary starts out, I can't remember, it starts at 26 and goes to 32? Just so you know, the rest of that is FERS. I'm doing FICA and PERS together. PERS, FICA, health insurance, that kind of stuff, and just want to make sure you knew where that was so that it gives you a better idea. That is everything that would be related directly to the salary as opposed to mandated costs, which are workers' compensation, unemployment, post-retirement medical, leave liability. None of these account for, as we don't account for them, and just to be in all fairness, any of those other positions, I didn't account for the unfunded liabilities that would be generated by bringing them on either. That happens with any position we ever bring on. Just so I make sure that I put that out there.
And I guess a question on that would be, what's the salary this is based on?
That's what I just said. It's $26 up to $35 per hour. It's benchmarked at the administrative analyst 1, so it starts at $26 an hour. And if they make their way up to a 2 at the E-step, they would top out at $35 per hour.
Which is what for salary?
So for 26, it's 50. We just did this 54,000 a year. It just depends on where they start. Normally, an individual who has 2 decades of experience somewhere, you're not going to bring him in at the A. You'd probably bring them in at the D or the E. So for example, if you were to do, so topped out, and that's the 2, topped out would be $72,800 for base salary. On top of that is $20,000 for cafeteria, for family benefits, PERS, and then FICA. That's why it adds up so quickly. Management.
Okay, so I'll point out the obvious that we've got 2 in favor of option 1 and 2 in favor of option 2. If we don't have a majority, then we're not going to have option 1 or 2. So looking to see, or if we have a third idea that can get that much support. So I'm open to ideas.
Well, I have an idea I'd like to express, and that is that I just because AT&T said that they don't think that they owe it, that's going to be their first answer no matter what, and I understand they're doing that all over. So, yeah, so following up is important because in either case, option 1 or option 2, assuming they owe that money, there's no question about that. It's whether they're going to pay and whether we can get them to pay. It will help cover our costs in either case. So, that's important for us to remember. I did include, which I did not see it included in the package last time, I included a contract for the 25% of the franchise fees, and I didn't see it included in our board packet. But I think it said something to the effect of, or, 25% of the franchise fees. It didn't imply just the existing fees. It talked about future fees too. So I want to make sure that if we end up going with option 1, that is kept, because we do stand to make quite a bit more money when we can finally catch up with them. So I don't know if there are any questions that the board has. We do need to make a decision. I thought it was already made. Like I said, the Access Tuolumne Board was told it was made, so this kind of leaves us in limbo land. And
So I'm still
Perhaps
a
we-
little unclear on one area. The income that's generated, from like Sonora City, TUD, or other areas, that's not accounted for?
Right, because we don't have any of that right now. There's nothing that's solid right now. Perhaps we could develop some contracts with some other entities to bring in some
I would presume that
revenue.
they'd want to continue on what they were doing now, and I don't know the numbers.
Yeah, I don't know what contracts they have, but those contracts, remember, are with Access Tuolumne, the nonprofit agency. So those would have to all be redone as Access Tuolumne, or as the County of Tuolumne, providing service to those agencies.
So I'm sure that could be accomplished.
Oh, of course, yeah, I'm sure it
it,
could, but it would mean likely the cost that those agencies are paying would probably increase because our costs for services would probably be higher than what Access Tuolumne's costs are right now currently that they charge. It's not to say it very much can be done, it's just not something that we have solid information on right now. So those types of revenue options are not included for those reasons. But there's lots of opportunity to generate revenue.
So as they are now, do we have a rough figure on what they total for the ones
That would be a
even if
question
they
for
went
Access
up a little
Tuolumne.
bit?
Yeah, I don't know.
All right, Jerry, come on back down. Need to have an idea. So trying to get an idea of income from, what City of Sonora, TUD, or other entities might be currently paying that's not accounted for here.
Well, so the county is our primary client. Excluding the revenue from the services to the county, we received about $20,000 from other entities over the year. So our full revenue for the year was about $50,000.
Okay, so that's, I guess I'm looking even including what the county's currently paying is not even being deducted here, correct?
Right, yeah, because that contract would be eliminated under either option. We would no longer be paying a contract to Access Tuolumne.
Okay. All right.
Is it true then that you would still be doing outside services and bringing money in? Or if you were operating under option 2, would there still be other sources? Like, for example, I know you're in discussions with the superintendent of schools for the E part of the PEG channel. Are there other options for bringing in revenue regardless of the option? Can you talk about that?
Well, I'm not sure that would be up to me, or up to whoever was hired for that position. But I mean, certainly, I would say our rates are quite low for what we do. So there's a lot of opportunity to generate more funds.
To me, this is just feeling like a very familiar conversation that we had at length. I think we gave clear direction to bring it in-house, and some of the numbers we're talking about aren't on here. So it's not to say that no decision should be made. I think that decision was made. It is 6:48 right now. We do have a lot of other budget items and staff here waiting, so I feel like we should, bring this back at a different time to go along with what our initial direction was.
I just want to make sure you do know, if we bring this back and you don't decide on September 21st, you will have to have a 4/5 vote to make that happen. And that's okay. I mean, we're just looking, if you want it all in, we'll put it all in. If you don't, you don't. But we felt as if we were directed to come back with additional information, and that's why we are here today. But if there are 3 of you who are telling us to put it in, then that means we come back, we have a job classification, we have an assignment to a bargaining unit, a pay range, and that would be part of the budget package that your board would be approving on September 21st. But I just want to make sure any change after September 21st is a 4/5 vote, and I just want to make sure you guys know that before we were to move on from there.
Yeah, I'll make it real simple. That's the cost of bringing this in-house. Whether or not you like it or disagree, that's a pretty good estimate of what the cost would be. So the question is, do we make Jerry an employee, or do we cut the agency a check? Which one would you prefer? That's the only question. I don't know what other options you're talking about are, but the question is, do we bring it in-house, bring it as a staff position, or do we use a set percentage of the franchise fee? That's the question.
Well,
I don't know why.
that question doesn't account for.
We have 2 affirmative answers. We have 4 affirmative answers, and then 1 answer that I can't really discern what it is. So that's where we're having an issue. Somebody either needs to come up with another idea, or we move on.
How many times?
So it doesn't account for any revenue. That's the part that any revenue is not included
Right.
in this. So there is a big difference because that part of the equation is missing.
So let's have another vote. Are we going to go with option 1 or option 2? And no other discussion. Let's just make it clear. Option 1 or 2. I'm going for 2 like I did originally.
Neither.
See?
Okay, so we don't have a vote then.
Yeah.
How about this? We're trying to figure out a way that we might be able to help. If your board wants to allocate $182,000 in the budget towards access to Tuolumne, I'm trying to think if we can do this. It's in the budget. We bring it back for a later discussion on how you want to bring it together. Do we still need 4/5 vote? Because we're changing the budget.
After the 21st.
No, we'd make it on the 21st, and we'll put money into it.
On the 21st.
On the 21st, we put the money in there, you have it in there. We could always bring it back for creation of we've done this before, creation of the job classification, the pay range. In the event the board to take it apart, it would still take 4/5 vote, because you're changing it to do an allocation. So that would be.
Just to be really clear, we're going to establish a brand new, Just to be really clear so that we're all on the same page, we're going to establish a brand new department and call it Access Tuolumne or Tuolumne, whatever we're gonna call it. We're gonna have 1 line item that says that it's $182,000 of cost. And then if the board decides to go with internal, it won't be a 4/5 vote, it would only be well, the board doesn't even have to do that. Between you and I, we can move that. But if we just made a line item in any other department, then they would still need the 4/5 vote. We would need to establish a brand new department, whether we use it or not.
Well, okay, one point on that. From our previous discussion, I remember stating very clearly that I thought this should be under IT. and I also spoke with our IT director. We also discussed about the potential of this position being able to offer some type of audio-visual support for the county in some way with part of the time. This was part of the discussion. This is an option that I think we wanted more info on. We were asking for that, and it's not here. So we never actually made a vote on whether it would be a department on its own. Again, these are the details that I was looking for the proposals to discuss. I laid out last time, I think, 4 decisions was like whether it's in and out, whether it's its own department or it's IT, the salary and classification for it, and then how many employees in it, or for the head position. And we only got to the first one, and we said, bring it in-house. The rest, we want to see options. So.
Yep. Thanks. With the PEG fees and all the requirements for the PEG fees, I would highly recommend that you don't commingle this with anything else and you make it its own department. There's just a lot of regulations with the PEG fees, and if all of a sudden it's in IT and it gets lost, I personally don't look good in orange, and wouldn't want anybody else to have to wear orange. So I would recommend that you make it its own department. They certainly could report to IT. I mean, there's different things you could do internally, you know, kind of like our radio person and how he reports to IT. But with the legalities of the PEG fees, because we're still going to have to keep the trust fund of the PEG fees. It can't sit into the general fund. It only can be moved in once the expenditure is happening. I just highly recommend you make it its own department if that's the way you want to go.
This is Kirk. I'm just going to say this last thing because we've been here talking about this for a long time. I think we all have consensus that we need to better fund Access Tuolumne, and there's monies that need to be diverted to them, even though I disagree from the onset of the conversation. I think we all agree we want to better fund them. So why not do option 1 now, and then in the future, we could bring this back around, see what is needed in the future, kind of reevaluate. But I think the need is to help the agency now. So I'm just going to leave it at that.
So even in discussing the franchise fee at the beginning, we had a range of numbers that we talked about up here. I think I was the most conservative amount there at, I think, 15 to 16%. We had it all the way up to 25%. But I just reject this false dichotomy that there are only 2 options we have to pick between. There was a range of discussion that we had on this, and the details do matter.
The whole reason for bringing this to the board was to make it sustainable. And so the 25% makes it sustainable. Anything less, they'd still be cobbling things together.
I want to try to be like Samson and the baby. Why don't you all do option number 1 for the next 12 months or until next fiscal year? Give Jerry the ability to use this new funding source of the franchise fees and build up what he wants or do what he thinks that he can do. Use the PEG fees and then bring it back. If it's really, really successful, bring it back and discuss whether or not you want to bring it in-house and do it that way.
So as a question,
take baby steps.
as a question,
Kind of what I was saying.
PEG fees here doesn't seem to accommodate the entire amount. The rest of it, I think in option 2, was going to be able to be recovered by the county for potentially other purposes, part of the discussion. As I understood in the previous option 1 we voted down, that was inaccessible to us. It would stay with Access Tuolumne. We couldn't use it, as was stated, I think, at the podium last time, for other AV needs at the county potentially. And so that was a big difference between option 1 and 2. 1 allowed us to recover some of the PEG fees for some purposes. The other one, it stayed aside. So 1's $136,000 we pay without recovering necessarily any money. And option 2, we had access to the PEG fees in the account and about $80,000 a year.
I'd vote to go with staff recommendation from Debbie Batista. Option 1, and look at it again.
Okay. So, you need any more direction on that?
Is that three of you giving us direction to go with option one for now and bring it back later to talk about it then? Is that what I'm hearing?
Does that work for you, Supervisor Kirk?
That works for me. Let's fix the need and then we'll fix it. We'll fine tune it as we go.
Okay.
Okay, let's go back to the other slide.
so-
Because we still need answers on all of these.
We're going through some of the decisions, or you're still looking at funding? Because I did want to give an opportunity for public comment before we made any more decisions.
Well,
I
that's the
didn't want
only
to
de-
interrupt this.
Right, that's
pro-
the
this
only
last
decision you've
process.
made, that's the only one. So if you want to wait and go through all of these, I'm fine, or we could just go with the one that you've made and then do the others.
Okay, so, hey, guys. Sorry, what I was saying is we have other individual decisions with the budget to make, correct? And we're at that stage where we'll be making those?
Yep.
Okay. So I would like to give the public an opportunity to comment before we get on to
Can I go
that.
through the other items before they comment? Because they may want to comment on items I haven't actually discussed.
Okay, that's
that
what I was
work?
getting
Okay,
at. Did you have
okay.
more to
Yeah,
go
there's that
over?
whole list. We've
Okay,
only gotten
please do.
to access to Tuolumne. So we're bringing up again the OES vehicle, and for those of you who've ever had to drive up in an incident, when you're trying to drive through and you don't have a vehicle that actually has you identified, sometimes it's difficult to get through. I remember the first time I was in my SUV and I had a hard time getting through CAL FIRE lines to get to where I needed to be as the OES coordinator. And we've had that during the rimfire as well, as we were going further and further back in there in our own vehicles. So again, we are recommending that we look at an OES vehicle. The reason for the price for that one is we're also looking at one that can actually tow a trailer that has other equipment that might be needed in there. You see the virtual text desktop that was already discussed. I think we called it a environment in the previous tab. So those are ones we would recommend that would come out of a use of fund balance. And then on the ones on the left, we are bringing up the generator again, remembering that your probation department is mandated to provide services for the courts. And so when they don't have service, we find places, but it definitely is disruptive for them and their clients when they're trying to work. Document management system, we actually have reduced that a bit. We do feel this is incredibly important. Roger has been looking for some other creative ways, like would it be less expensive if we bought the software and hired part-time staff to come in and do that scanning for us? So we're looking for a way to get it started. We would start with Public Works again because they have so much paper. 1,200 square feet of space is a lot of space, and that we could start working to eliminate that and get it to either archives and or destroyed. The EOC AV systems, for those of you who were there during the Washington fire, even the projector went out while we were there. So it definitely is needed. And we did scale that one. It did get scaled back a bit. You know, honestly, until we do an RFP, we won't know for sure. The community meeting room, that's when I talked to you about with the community's technician. And that actually is the cost of equipment and then renovating that building a bit. We just need to move a few walls so we can have one big open area that would accommodate individuals that are of the committee members, so they could sit around tables, have the screen, and then members of the public who could be there in addition to being able to be there virtually. And I think community projects. Oh, and then the community projects program. We had talked about $500,000 and $250,000, and we had this idea yesterday while we were all working on budget. In my past life at Behavioral Health, I worked with the Sonora Area Foundation a lot, and they did a lot of work with us with matching funds. So I would say, hey, if we come up with this much money, will you meet us halfway there? So we went that direction here, is if we come up with $250,000 for our nonprofits, might they be willing to meet us halfway? So Liz was texting Daryl yesterday. He said he would take it to, and I can defer to you.
Yeah, they were open to the idea, but they need a lot more specificity on how the program would be run, you know, all of the details, as you know, that we're planning to bring back to the board for discussion anyway. But they won't be able to discuss with their board until the 28th of September. So what we're proposing here is that we put this money in, knowing that perhaps we could do a matching program with Sonora Area Foundation, and if not, then maybe your board could consider allocating additional funds to this program if that's something that you wanted to do.
So, I'm sorry.
I'm wondering, I was thinking, I forgot about the community projects program, what it was. And I like where you're going with that. But I'm reminded that we still have 2 resiliency centers that are not equipped. And in order to make those centers resilient, where they pay for themselves, I think if we have some remaining ARP funds, I think we should consider and discuss outfitting those 2 so that we can actually rent them out and bring in the kind of money we need in order to make them sustainable.
And Mo is working with the state, while they won't pay for people or certain things, there's a possibility. They may be, they call it budget dust, right? $5 million with budget dust for them. They may be able to find another million or 2 that we would be able to maybe apply towards equipment. So she's working really hard to see if she can go down that route instead. And then, of course, eventually we will end up getting an RFP, which will help us identify exactly what those costs will be.
And I was going to say, before are you down the line?
We are just
you
gonna
done?
tie it
Okay.
together, so you can see we gave you where your board ended up with what you already allocated out of ARP. You had $2.9 million left over. You had $732,000 of fund balance left. If you were to do the items as they're listed on each of those columns, you would have 1.5 million left out of ARP and 100 and almost 34,000 out of fund balance. Recommendation would that both of those would be put into contingency, so your board still had access to use those during the year should you need to. And yes, I'm finished.
Okay, so I did want to give the public an opportunity to speak. So that will be that time is now. If there's any public comment, please go ahead and come up to the podium. Okay, anyone on the phones? All right.
I think they've all gone to bed.
Yeah, I know. That's where I'd like to be. So what I would,
We do have, I'm sorry, Supervisor.
Oh,
We
go
do
ahead.
have one last sort of proposal that we would like your board to hear from
Okay.
our HHSA director about some reorganization stuff that she's working on.
okay.
I'm sorry, before you go there, I really do need some direction on what you want for the general fund, because hers will not be general fund.
Okay. So what I'll say is if we can pick off the things that, yeah, I guess we'll have to go through each of these. Well, let me put this out. Is there, so taking off excess Tuolumne, since we've already kind of reached a agreement on that, so subtracting that.
No, I think you would leave it in. We said we would still give them the money. You just weren't.
Ye-
Okay, I'm sorry, I
So it'd be,
misunderstood you. I'm sorry.
yeah, it'd be slightly less than that, but accepting that we've already made that decision, okay? Is there any support on the board to approve of staff recommendation as it is? Or do we want to
I've
do
got a
additional tweaks?
couple of comments.
Sure.
You know, one would be the OES vehicle. I'd rather see that come out of ARP funds. I think it's a good use of one-time money. Excuse me. The document management system, we had a fair amount of discussion about that, and I'm very supportive of doing that. You know, I think originally it was 600. It's trimmed down a little bit here. I would still rather see we dedicate 300 on that for, you know, CDD, I think it was, and we're going to have more ARP funds next year and pick up from there. That would save us a couple of $100,000 here that we could, you know, just put back into a balance. Or, anyways, that's just my thought.
Hey, Campbell, this is Kurt. Can I make a recommendation?
Sure, I actually had one follow-up question on something Supervisor Goldenberg said. Can we do that? Divide up the document management system,
Well, we can get to.
paying for it?
Yeah, definitely, just so you know, CDD did cost more. We had to put more in this year's budget in order to complete their project, so they're probably closer to 400. And but we can always start it, and then we can come back just knowing that it's possible that it could come to a stop, but we can keep your board apprised of where we're at and how things are going. And kind of also how much we'll be able to get done with the amount of money that was allocated, and then go from there. So completely up to your board what you would like to.
Remove communications tech, approve potentially from IT to virtual desktop and then not approve all of the ARP fund expenditures. Is that correct?
Right, ARP wait, scratch the tech, and then the only way I would support the recruitment coordinator is if there has to be at the end of a year, I have to see that it's successful and it's working and retaining positions, at the sheriff's office, at other departments, make sure that it's actually, because I think when, if we have raises coming, that in and of itself is going to be a huge retention factor. So it's just, I'm going to need to show proof that it's actually that's worth 124,000 a year.
Okay. All right, Supervisor Brandon, do you have a preference on this? Any kind of minor adjustments, or shall we go line by line?
I don't know, what would you prefer? I have my own personal thoughts.
Well, what I was looking for is kind of like what we've discussed, where what part of this do you approve of? What part do you disapprove of? Can we trying to find some kind of
Like everyone else.
Yeah.
Right, yeah. So, looking at some of these items, the OES vehicle, I would say we shouldn't do right now. I think that can be accomplished. We shouldn't be buying a vehicle because we need one with a decal. You can get a magnetic decal for $100 to be able to modify that for an emergency. And similarly, I look at the EOC. If a projector went out, we can buy a projector. We don't necessarily have to have one that comes down from the ceiling and a very high-tech audiovisual system. I think that would be fine. For the communications meeting or communities meeting room, I wonder why don't you use the library meeting room, which does seem to be hooked up in an audiovisual capacity. I guess it's kind of understanding the other options between that, also the resiliency centers. So I'd want to wait on, I think, those items. I would be in line with, I think, the recommendation to wait for ARP funds. I do feel we passed the community projects program along with the RAD card at the recommendation of 500,000. We could wait to do that. And if Sonora Area Foundation can pitch in, I think that's great. I would still say if we can do 500 and then have them pitch in extra, this is, again, a direct investment in a lot of community groups as part of a recovery effort that might not be eligible for other funds. And then for IT, there was a recommendation of eliminating one vacant position and creating a security position and a tech position. The security position, as well as the virtual desktop, both of those I think are good ideas for security purposes. I would wait right now on a tech position. It may take a little longer for staff to be able to get some of the tickets done, but I think as CEO Riggs mentioned, we can also keep hiring a number of those techs and just continuing to improve the service. At right now, it seems to function pretty well and be able to meet the demand. Last bit is the recruitment and retention coordinator. I would agree with Supervisor Kirk on having performance metrics. At the same point, I had a lot of discussion with staff. I was hesitant about this. Looking at the cost of doing it position by position seems to be expensive in dollar values and then expensive in the department head staff time, where they end up having to take on a lot of this burden themselves instead of the position that we end up paying them for. So I think this actually will end up making every department more efficient, probably help with our retention issues as well. So I'm in support of that.
And just to clarify for my owners, so of the items listed on ARP, were you in support of any of those, or did you want to wait on all of them?
I would wait on all but the community projects program, which I would recommend at 500,000.
Okay, so now we'll see what, this is why I do, and I agree with Supervisor Goldenberg. I think he had good ideas about how to divide this up. So, okay, here's the method to my madness. What I have is, we have majorities on communications, tech, IT position, recruitment and retention coordinator, Access 12Me, of course, virtual desktop, and community projects program. Is that what you have as well? Oh my gosh, shaking a head. Okay, what did I get wrong?
So from what we've heard so far, the only consensus we have is on the IT positions, the recruitment and retention coordinator, access to Tuolumne, the OES vehicle, and the virtual desktop.
I think we had,
No,
Three supervisors in favor of waiting to spend the ARP funds. That's what I heard.
yes, you're right, with the exception of the
Yeah,
community
correct. So
projects program.
those are the only items I heard consensus on keeping in the budget or adding to the budget. Those will be the only items built into the budget.
Yeah.
Based on what we have right now.
Isn't that what I said? Because, so,
The communications tech, there was not consensus, and if we don't have the building or the space for it, the
Okay.
position's not needed. So that is not in there.
okay,
The IT positions, we had consensus, however, one member said only for one of the positions though, so it's almost consensus to add it in. The recruitment and retention coordinator, there is consensus on that to add it into the budget. Access to Tuolumne, there is consensus to add it to the budget.
Supervisor Campbell, we only have you on one item, and I think that's because you haven't finished telling us what you want. So if you told us what you want, we would have a better idea as if we have consensus.
I want everything Supervisor Goldenberg said,
He
so.
had two items that we had, is what.
No, what Supervisor, so, let me correct it, so we're in support of staff recommendation with the exception of moving the OES vehicle. Oh, I see what you're saying. With the exception of moving the OES vehicle to ARP funds and then reducing the document management system. But there isn't broad support for the document management system, so you can take that out. So really the only thing we'd be talking about is, whether or not to leave the OES vehicle in fund balance or ARP, and I'm fine either way, to be honest. Okay, so let's start with communications tech. Supervisor Half.
Excuse me, I think we can wait on that. I don't think there's a dire need for that right now.
Okay.
Without the building, you can't have the tech anyway, so.
I can't hear you.
Without the building, you won't need the tech. So the building, the room with the communications room goes with the tech. Those two go together. So we have to have a room that would be dedicated to all your boards, committees, and commissions.
Right. Okay.
That's an ARP. So what we're hearing is a lot of you don't want to do anything with ARP, and that's okay. But that means without the room, we wouldn't need the tech anyway. So we would have, staff would have eliminated that and not brought it forward as that result.
Okay, so take off communications tech. All right. Are you okay with that, Supervisor Kirk?
Say that again, take off what?
So the first time is communications tech. If there's not broad support for a community's meeting room, then we can't support that position anyway. So the proposal is to take that off of the recommended use of fund balance.
Yes, take that off, yep.
Okay, and then there was support for IT. Okay. There was support for recruitment and retention coordinator, correct? Or did we still need to work on that?
About that. Is
Yeah.
that going to be a staff person on staff salary, or can we contract for that?
I would have recruited for the position.
You can recruit for it either as an employee or as a contracted?
I would not have done an RFP. I would have recruited for a position for that so that they would be able to, again, I'm looking for someone who knows HR, rules, policy, and laws, in addition to knows how to do the coaching, mentoring, recruitment, and retention.
But maybe this is a question for legal counsel. Can we contract for that so we don't have to bring?
Yes, you can. My recommendation is to not do that. I guess that's where I'm going.
I'd like to see that brought on as a contract position.
And Supervisor Brandon.
We could run into some issues related to personnel, only in that if we're controlling their work and directing their work and controlling their environment, that makes them an employee. So that's part of, in my mind, just let me clarify that a bit more, as you know those rules, that's why I would have gone that direction.
Okay, Supervisor Kirk, do you support a recruitment and retention coordinator? The third item on the list?
Only if in the job application and description and duties, there is some sort of metric to gauge if they're being successful in this. That's the only way I'll support it.
I'll agree to that. Can we do that?
What, no. So there's no
Oh.
way in a job class spec that we could put what those are, but we can do if they're, say they have a year probation to identify if they are being successful or not. If they're not being successful, and we make that very clear when we sit down, but, well, there's no way we can put that into a class spec.
Does that work for you? So if they're not doing their job, we can get rid of them within a year?
I guess my question is, how do we know if someone's doing how do we know if that job is being effective? That's where it's going to come down to who are they going to be reporting to? Is it you, Tracy?
Yes. And what we would do is bring back, I would work with the executive team and we would draft up what success would look like to department heads in order for us to see, are they making a difference?
Yeah, and I've worked for Tracy
Then I
before,
would just simply
so
ask.
I'm going to say she doesn't usually let people coast too easily, so.
That's fine. I would just like to know, I would like to have that discussion, have you have that discussion with the department heads before that position's hired, so we know what they're looking for and what success looks like to them. And then we can, as a board, understand that moving forward.
Yeah. I think it would take a certain level of trust of staff to develop a plan for that position, which I think they're capable of doing. So does that work for you?
Yeah, and I don't mean to come off mistrusting or whatnot, but I mean, we are growing the county organization with this department. So it's important that we're just prudent. And I know Tracy will, I have to say it since we're actually creating a position moving forward. So that's all.
Okay. Supervisor Brandon, do you support the recruitment retention coordinator position? Yes, okay. And then Supervisor Goldberg. Okay, so you have consensus on that. Access to WOMI, we talked about. Virtual OES vehicle. Do we still need to decide on that? There were some caveats about it. I'll just start with Supervisor Brandon. You weren't in support of the vehicle, correct? I'm sorry, I can't hear you.
No, I was not.
Okay. And then Supervisor Half, were you in support of the vehicle?
I could go either way. We were talking about whether we would use fund balance or ARP fund balance, funds. It doesn't matter to me.
Doesn't matter to me either. Do
Okay.
you support
Yeah.
it in concept? Okay. Supervisor Goldenberg, you were the one that recommended we move it to ARP. Do you have a?
I'm okay either way.
Okay.
I think we need the vehicle.
So why don't we just use fund balance since that's staff recommendation? I imagine you recommended that for a reason. Is that true or? So you have support for OES vehicle and we'll go ahead and keep it in under fund balance.
Correct.
Okay. Does that work for you, Supervisor Kirk?
Yeah, I think especially with where OES is headed and working with other organizations, I think they need to be able to tow stuff around and get to emergencies. So I'm okay with it.
Okay, cool. Okay, virtual desktop. You'll have to remind me where we ended up on that. I am a little fuzzy right about now.
I think you're the only person I didn't have a direct answer from, but
I do support that and add a fund balance.
all right. So that's 5 out of 5. Agree with that.
Okay, well don't even need to revisit that one. Okay, and so I don't think we had much consensus on all of the ARP fund items, save the last one, so I'll go ahead and throw that out again. Supervisor Brandon, you supported that, but you wanted it to be $500,000. If it was $250,000, would you decide to not support it?
I would still be in support at 250, but it feels like we've approved this, at least from my recollection, twice, and it was both times at 500.
So just to clarify,
Yeah.
this one actually was not approved. It was to be brought back for discussion later. Yeah, so just.
Okay, Supervisor Kirk, what are your thoughts? Can Can you support just one of
On
the
community
ARP fund
projects?
items? Yeah, the very last item on the list, Community Projects Program, $250,000.
On community projects, I just want to clarify, it sounds like instead of handing the money over to Sonora Area Foundation, we actually might get matches. Is that correct, Liz?
Yeah, so the county would put up $250,000 of ARP funds that would be administered through the Sonora Area Foundation. Liz and the CAO's office has been working with the Sonora Area Foundation to potentially set up a one-to-one match for those funds. I don't know if we have a firm agreement. I think we've just been in talking with them, but they are open
Right.
to the idea. So the total amount that would be put into the economy or put into local nonprofit organizations would be $500,000, with half of that coming from ARP funds. Is that correct?
So
That's it.
Okay.
I think it'd be great if we did put 500,000 in there, and if Sonora Foundation could figure out a way to match that, because now we're getting 2 for 1. And just the reason why I agree with Brandon is because we're going to get so much of a bang for our buck when we put this into the community through our community partners. It's free work, and they figure out ways to make it go much further. So I'm actually in support of Supervisor Brandon's $500,000 pitch.
Okay.
Just want to make one, I'm sorry, one clarification. Because of the rules related to this, we would not now or ever be recommending that we give that money, essentially like a sub-grantee to Sonora Air Foundation. We would actually be the ones administering it because of the headache that the COVID, the funding, the American Rescue Plan. And we'll work through that, but because you all seem to be going on that road, Debbie was just leaning over. We already knew it, but she's reminding me, we probably don't want to do that because the reporting on it is incredible as opposed to if we were to work with them and do it a different way.
So basically we put the parameters around it and we administer it, but Sonora Foundation can distribute it. Is that what you're saying, Tracy?
No, we would distribute
No.
it and then we could submit claims to Sonora Area Foundation so they could reimburse their shares, more like it.
Okay. Well, either way, I still think getting money into the community is a good use of funds, and I'm okay with 500,000.
So I'm going to answer this, but I want to know, we put off we agreed for the RAD card for 500,000, and we agreed that that money would be, in our minds anyway, set aside for October 1st. So that would come out of the remaining balance from the ARP funds, is that correct?
No, that's part of the 2.9 you had left over. That included the 500 already for the RAD card. We already accounted for that in our
Okay.
budget.
Okay, I just
So
want to make sure.
It's not additional.
Yeah, I just want to make sure it wasn't lost. And I'd be in support of making it 500,000 as well for the community projects. I think that would be, I'm surprised of the latest developments you're talking about, because I thought it would be easier if we gave the parameters to Sonora Area Foundation so our staff wouldn't have to deal with that, 'cause that's extra work for us. And I'm sorry to hear we're not going to be able to do that, but I still support the 500,000.
If you recall, the reason why we pulled some of these off last time was because we did tell you guys that if we do anything with some sub-recipients, that the accounting for it, and even on their side, and the auditing side on their side, and the different things that they have to have in place, they may not be willing to work with us. And it may be a whole lot more time-consuming for staff than staff just administering the program themselves.
Okay. Supervisor Goldberg?
Well, I was just wondering if there was a way if we could shift enough over from fund balance to ARP funds as allowable, and perhaps use fund balance to do the community projects program to get away from the reporting requirements. But I don't know that.
Does that make a difference?
With personnel that we
No,
could do
because then you're
that.
looking at doing it for staffing. Sorry, then we end up with the staffing thing, and the staffing's
Right.
a nightmare. It's like FEMA when you're trying to do staffing with them. I know, it's, it's fun.
Well, I agree with Supervisor Brandon. I think I think $500,000 is a good number for that, and if we can find a way to work with Sonora Area Foundation, I think they're a great group, and they'll bring a lot to it. So I agree with that. Okay. So do you have a good idea, consensus on that? Because we went through everything. Okay. All right, so let's move on.
Good evening, Chairman Campbell, members of the board, Health and Human Services Agency Director Rebecca Espino. First, I need to apologize because I know everybody's exhausted, but I have a ton of things to ask for. So we're, might be here for a bit. First, I want to thank you for the opportunity to once again advocate for over 200 of our Health and Human Services employees. Your Health and Human Services Agency started the journey of reorganization back in December. And of course, the first phase of the reorganization focused on building infrastructure, creating parity, and building efficiencies. Today's presentation focuses on building and supporting our workforce, continuing the next phase of building infrastructure and efficiency. Your Health and Human Services Agency, as I mentioned in past presentations, is part of a county system. And this system serves the most vulnerable members of our community. And the inability for the HHSA department to attract and retain skilled professionals leads to a system failure. Failure in HHSA manifests in other systems, such as increased strain in law enforcement, the courts, emergency room visits, food insecurity, homelessness, and responding to elderly and children in crisis. On February 2nd, your board adopted the goal to modernize government and increase effectiveness to better serve the community, and this proposal aligns with that goal. So first and foremost, it is imperative I continue to support labor negotiations for our staff, but specifically the hard to recruit and retain behavioral health clinicians and their supervisors. The Behavioral Health Department bears the sole responsibility to serve the most severely mentally ill community residents. As I mentioned before, currently 60% of our clinician workforce is vacant or has less than 1 year of experience. Recruitments are impacted by the department's inability to compete in the labor market. Data shows Tuolumne County clinicians are the lowest paid clinical professionals amongst the counties traditionally used for salary comparison. The lack of adequate staffing levels leads to negative outcomes, such as delays in patient care, time and cost of training new staff, the time it takes for new clinicians to reach capacity, and the requirement to continually review and audit the work of novice employees to ensure services rendered meet state requirements. So the first request is to convert 2 vacant clinicians to senior behavioral health workers. This is necessary just in case our labor negotiations are not successful. If we convert 2 vacant clinician positions to senior behavioral health workers, a classification not impacted by recruitment challenges will help ensure the department continues to serve the community and will reduce costs by approximately $20,000. Our next request, the Mental Health Services Act Coordinator is a unique standalone classification responsible for multiple tasks, all within the purview of an existing agency manager classification. Therefore, it is proposed we convert the MHSA coordinator to an agency manager, which aligns with the HHSA's philosophy to eliminate standalone classifications to increase flexibility and efficiency. And the annual cost for this change is $13,000. I'm going to try to talk as fast as I can. For the same reason, it is
You're
also
doing fine.
for the same
What's
reason,
another
it is
couple minutes?
okay. It is also recommended to convert the standalone senior medical records billing technician position to a staff services analyst. During the past 6 years, the incumbent's tasks slowly expanded to include staff development, program integrity, developing protocols and policies. This assignment and the added tasks associated with 2 large changes in the Behavioral Health Department aligns with the existing staff analyst classification. The annual cost to make this change is about $5,000. The responsibility required to oversee a health clinic and the administrative functions of managing a health plan are diverse and substantial. So for our next request, in 2020, public health successfully transitioned to a new model that bifurcated clinical oversight and administrative operations, which has proven to work well. In public health, the medical licensed health officer oversees clinic and external medical operations, and the unlicensed peer serves as a department administrator, so Dr. Surjenko, Michelle Jaquetta. We are recommending the same model for behavioral health, which is designed to streamline administrative processes, serves as a checks and balance between the mental health clinic and the mental health plan. To operationalize this model, we are proposing to convert an existing deputy director to a behavioral health director of administration. The annual cost for this change is about $11,000. This converting a deputy director to a behavioral health director does not mean we no longer need a deputy director. We do. So we are recommending to convert one agency manager to a deputy director for an annual cost of $7,000. Lastly, for this one, every time a position is vacated, it provides the agency an opportunity to review operations and make necessary adjustments. The workload of our transportation officer has slowly declined over the years, while the growing need to invest in grant writers has grown. So far, millions of dollars in revenue have resulted from investing in our analyst positions. The cost to convert the vacant transportation officer position to a staff service analyst is about $18,000. So in closing, for behavioral health, a full cost for making all these adjustments is a little over $35,000. And again, this will be funded by behavioral health funding, no general fund. Next, social services. What you will hear as a common theme is our commitment to support labor negotiations for all employees, again, specifically the hard to recruit and retain, social workers and eligibility specialists. During the past 2 years, we have conducted 23 recruitments which have been unsuccessful in filling our vacant social worker positions. 34% of our child welfare workforce is vacant or has less than 1 year of experience. And I mentioned this during our last budget hearings, but it's worth mentioning again because it's extremely important. The inability to retain social workers is far-reaching. As I mentioned before, research shows children who have been assigned to multiple social workers are less likely to reunify with their parents and spend more time in foster care. A foster child with one social worker has a 74% chance to find a permanent and stable home. That dips to 5% when assigned 3 or more social workers. Another equally impacted position is our eligibility specialists, who are responsible to assist low-income residents obtain food assistance, employment services, medical insurance, and those are just to name a few programs. Similar to our social workers, 23 recruitments during the past 2 years have been unsuccessful in filling vacant eligibility specialist positions. 39% of this workforce is vacant or has less than 1 year of experience. This poses a challenge when this classification serves over 20% of county residents who currently receive safety net services. So let's start with our positions. The first proposed change in DSS is converting the personnel assistant to personnel assistant / confidential. This single person position is responsible for all Health and Human Services recruitments, but the existing classification specifies that she only serve DSS instead of all 5 of our departments. The new classification aligns with serving all 5 departments, so this change in classification will allow her to serve all 5 departments. And also acknowledges the most significant increase to her workload, which includes the responsibility to perform live scans, so she does all the fingerprint rolling for our new staff. This means she has access to state and federal criminal history and maintains ongoing responsibilities for subsequent criminal history events through a program called RATBAC. The work is highly confidential, and the annual cost to change his position to a classification that better aligns with her position is about $3,000. Next, the ability to remain successful in securing highly competitive grants is contingent upon analysts with the proven skill sets to identify, secure, monitor, and procure grant funds. The department has successfully recruited 2 staff service analyst 1-2 classifications with the skill sets required to perform at an advanced level. We must be well positioned to be at the forefront to take advantage of the competitive grant funds anticipated through the American Rescue Plan Act. As mentioned earlier, HHSA has secured approximately $1 million in extra revenue to help support community services. Therefore, it is essential that we are well positioned with the highest level analysts, which has proven to be a good investment. So converting 2 staff service analysts to senior staff service analysts the cost is about $11,000. Next. The next request could be considered a selfish request on my part. So I will support whatever decision your board delivers on this request. Almost 5 decades ago, the Department of Social Services became part of the Health and Human Services Agency as primarily a cost savings measure. The Director of Social Services, which is the largest department, also serves as a Health and Human Services Director. Although this consolidation created one large agency, each department continued to operate in a silo. The intent of any consolidation is to efficiently deliver services by integrating, braiding, and leveraging financial and human capital. Integrating complex federal and state funding, delivering mandated high-risk services, leading a team of dedicated professionals, absorbing the responsibility of supporting the county's efforts regarding homeless, and retaining a 30,000-foot level view of health and human services business operations is difficult when serving as both a director of the largest social services department and the Health and Human Services Agency. It is critical for the Health and Human Services Agency director to get out of the weeds and provide the leadership needed to drive a unified vision, network with applicable professional associations, build trust among the leadership team that integration is paramount, and create effective cross-functional teams. Government is frequently criticized for the lack of innovation and strategic planning, and this change will provide your Health and Human Services Agency director the opportunity to fulfill the intended role. Your board has already experienced the fruits of other investments in county infrastructure, such as the Innovation and Business Assistance Director, who is a department of one fully dedicated to innovation and strategic planning. And we all know that Cole's a rock star. He really is. Similarly, Dory Beats, the OES coordinator, has done wonders in moving the county in the right direction for emergency preparedness, whereas in the past the role was absorbed by county CEO staff who did this work in addition to other duties. As mentioned earlier, anytime a position becomes vacant, it allows the agency the opportunity to evaluate and determine if the vacant position is best repurposed to better serve the organization. In April, the Adult System of Care Deputy Director, Corey Allen, that position became vacant and has remained vacant for the last 4 months to allow the department to evaluate and determine if this position needed to be filled or if a reorganization of the department's infrastructure was more appropriate. It is through this evaluation that I respectfully recommend to convert the Adult Systems of Care Deputy Director to a Social Services Director, which will create a director position in the 3 largest HSA departments. The annual cost for this change is about $3,000 annually. Okay, next, accountant.
So I was going to just disagree with you on the characterization of that being a selfish request. I think it's quite the opposite. So,
For the accountant position, building fiscal support in a department that continues to pursue grant funds, especially the numerous grants associated with the homeless advocate and coordinator position, has directly increased reliance on fiscal staff to ensure the agency remains compliant with federal monitoring and to ensure we maintain credibility in our ability to manage grant funds. Again, in this position, the inability to attract fiscal professionals required HHSA departments to seek innovative approaches to manage the workload. Grant funds in public health have also substantially increased, so we are taking this opportunity to leverage resources between Department of Social Services and Public Health to share one accountant position. Social Services will bear the cost of 60% and Public Health 40%. Lastly, for DSS, the increased workload associated with our aging community has directly impacted the Adult Protective Services. In addition, effective January 1st of this upcoming year, the scope of responsibility for the Adult Protective Services program will change from serving adults 65 and older to age 60 and older. The current and projected workload associated in our adult system of care programs requires the department to invest in an adult citizens of care social worker, which is well overdue. The full annual cost for all these recommendations for social services is about $134,000 annually. Again, DSS existing revenue will support this proposal. No general fund dollars are requested. Public health. Again, another plug to support labor negotiations. Public health, similar to behavioral health, continues to struggle to recruit medical professionals. We have 4 budgeted nurse positions and 2 are vacant. Our first request is to convert a grant-funded emergency medical services coordinator to an infection preventionist. Initially, a public health nurse was slated to fill this role, but after 2 failed recruitments where we received no applications, the position was converted to a grant-funded emergency medical services coordinator. However, to ensure compliance with grant objectives, it is necessary to reclassify this grant-funded EMS position to a grant-funded infection preventionist. And as mentioned in our social services slide, we are also requesting to add the accountant, but split the cost with Department of Social Services. And again, the full annual cost for these requests is about a little over $33,000. Almost, okay. So next, almost done. The Homeless Advocate and Outreach Coordinator position changed with the creation of the Tuolumne County Commission on Homelessness that placed the coordination and advocacy in a structured parliamentary body. The primary task for this position changed to support the Homeless Commission, coordinate homeless services through contracted vendors, grant identification and procurement, serves as an information officer for county homeless services, and also this position must remain abreast of federal and state housing legislative actions and funding. Also, as mentioned during our budget hearings, this position relies exclusively on grant funds, which has been problematic because all grant funds have limited administrative dollars, which required this position to provide direct services. Since the scope of work for this position changed, we believe adjustment to the benefit package is also appropriate. And in doing so, we reduced the cost by a little over $3,300. We also believe the existing name of Homeless Advocate and Outreach Coordinator should be changed to Homeless Services Program Coordinator, which better aligns with the position. In addition, we are requesting to add 1 social worker who will be dedicated to homeless case management and other supportive services to ensure there is no lapse in serving our homeless in the event our nonprofit partners lose funding or if our contractual relationship with our partner does not meet the full need. However, the concern remains for the homeless services program coordinator position because grant funding does not support the administrative duties of this position. Therefore, we are requesting $41,000 from the general fund to help partially support this position. We are not requesting general fund for the social worker position because the social worker will be able to provide direct services, which is funded by grants. And then we also have HHSA revenue to help support anything that the grants do not cover.
Rebecca, I had one question on the homeless services program coordinator. So I see it is a reduction in savings there. Obviously, there's a lot of grant money out there right now. A primary concern with that position is being able to secure that grant funding to pay for these programs. Is that going to be an adequate amount to find, I guess, a competitive grant writing person? Is there a classification ahead of that? If we're really putting it on one person to deal with homelessness, I want to make sure we get the best possible talent for that.
So the wages did not change. It was a benefit package. So they went from an executive and confidential bargaining unit to the management bargaining unit. So the salary that's associated with the position did not change.
Okay. Is there a different classification you would recommend if that was an option?
I think that is it's a good salary, and I think it's a good classification. I did reach out to our Calaveras partners, and that position pays about $3 less.
Okay, thank you.
Rebecca, can I ask a couple of questions on this position?
Absolutely.
On the social worker, I like the idea of having social worker, specifically assigned to homeless issues. Have we already had this position, or is this a whole new position, or are we just making it a full-time position?
It's a brand new position.
It's a brand new position, okay. And then to be clear about the homeless service coordinator, and I'm sorry if you stated this and I went over my head or I'm not hearing it right, but is this kind of basically Kayla Brown's position, which is now vacant, basically funding that position partially with general fund?
Yes, that's exactly it. We're changing Calay's old position to have a new name and a new benefit package. So yes, we are asking general fund to contribute about $41,000 toward the salaries and benefits of this position, and the remaining will be covered by the limited administrative grant funds that are associated with all the grants that have been coming down. And so far, it's about 10%. We've seen some as low as 5% administrative funds.
I wanted to clarify something, that this is already a general fund department. That's the way it was created. Also want your board to know that the $41,000 that Rebecca is referring to is part of the numbers you've already seen. So that's not in addition to, we've already built that in, just so you're aware of that.
Hey, Tracy, did we use general fund dollars on Kayla's, on that position prior?
We did partially. We had some grant funds. Whatever the grant funds didn't cover, we did backfill with general fund.
It was my understanding that her position was grant funded completely.
That had been our hope in the beginning, but then as you just heard from Rebecca, sometimes most of Calais was, but remember that Calais did not actually do what we had thought she would do. She did a ton of COVID work. And so it changed the very nature of why she was hired, which is, and I'd have to ask if we actually ended up with, it was just, I thought it was just a few thousand that ended up being general fund at the end, but your board had allocated, I'm going blank. How much did the board allocate?
It was like 50,000.
50,000 earlier in the year to help offset some of those impacts as well.
Sorry, go ahead, Rebecca. I'll have some comments later, but go ahead with your presentation.
Okay, thank you. In closing, today's personnel requests meet HHSA's philosophy to build a professional workforce, build infrastructure, and build efficiency. The only potential impact to the general fund is a $41,000 investment in the Homeless Services Program Coordinator position. The remaining cost for this proposal is supported by Health and Human Services Agency funding. Thank you.
Thank you very much. Okay, questions from the board? Supervisor Brandon?
Yeah. I don't have any questions. Just want to say I'm fine with staff recommendation.
Okay. Any other questions, comments?
No questions. Thank you for all your work on this. There's a lot of thought that went into this, and it seems easy, you know, when people look at it, but it requires a tremendous amount of effort. So thank you.
Thank you.
Supervisor Kirk or Half, any other questions?
Comment?
Okay.
Just, you, go ahead, Half, go first.
So, Rebecca, I just really salute you in your continuing quest to improve HHSA and being nimble and mobile in how you make sure that your bases are covered. And I think you've done a magnificent job on this, and I'm sorry you had to go last.
That's okay.
But I'm ready to just approve everything.
Yeah. Supervisor Kirk, anything else?
Just a quick question. Riggs, how much of everything presented by Rebecca, how much of it is general fund costs? Is the whole
$41,000.
Yeah, 41,000. What you see, the 276.52 is between those cost center, I'm sorry, yes, between those cost centers. On the first three are different funds. The 68,502, while you're seeing an expense, those are offset by grant funds. So $41,000 is the only amount that is general fund.
Okay, so good job, Rebecca. Every time you come here, you always thoroughly think things through, and I really appreciate that about you. You're never quick and hesitant to just rush stuff before. So I thank you. I will stand firm though in my and it sounds like I'm outvoted. I think adding the social worker for the homeless thing is I support that. I know I've had different opinions on homeless issues, and I think we should support a lot of the community. But I do feel like the grant funded position that Kayla was in should continue and remain grant funded. However, I would support that with the social worker. So I can't, I want to make sure whoever's in that grant funded position has to keep that funding stream going through grants. So I can't support that part, but everything else, I appreciate your time, and I hope you understand my reasoning, but it doesn't sound like you really need to, because the majority of the board's there, but thank you anyways. And I really appreciate you being here late, and just have a good night.
Thank you, you too.
Yeah, and I hope you know how highly I regard you and the work that you've done, and so hopefully my foregoing telling you all the great things about how I see the work that you're doing is having on our community. Hopefully it will suffice just to agree with your recommendation, and I'll buy you lunch at a later time and tell you all the stuff I'd tell you right now if we had the time. So do you need anything else left?
Oh, we could slap a bow on this real quick.
Okay. Oh, recap.
Kind of a little recap.
Love that
here.
word.
So the one number will change, or a couple numbers will change on here, but big items. Contingencies, they were increased by $1.9 million. They now sit at 2.8 in the general fund is what we're talking about there. Reserves were increased up to $1.2 million, not by, but then that will provide us at a reserve balance of $4 million this year. ARP funds, as was discussed by the board, the $500,000 for the community program was the only item that received consensus. So we'll have $2.4 million if my maths are still working. And that will be in contingencies available for use later. And then, of course, you heard the other adjustments for fund balance as well. We'll take out the communications tech, but there was consensus on the other items. And then, as you just heard with the HHSA reorg, we heard consensus on that as well. So unless there are any other items, I think we have the direction we need to build the adopted.
Okay. Thank you very much. I'm going to frame that slide right there. That's pretty impressive numbers there that we haven't really seen in this county in 20 years. I just really, before we say goodnight, I wanted to highlight the fact that this staff that's sitting here in the audience today was working over the weekend on this budget, and now here they are in our board chambers at 8 o'clock. Thank you very much for your dedication, for your hard work, and I truly hope that you see that all that hard work has amounted to something that we can all be very proud of. Thank you to my other board members as well. It's been a long day, but I think we're at the end of it. We have a really good product, and I think our constituents will be proud of us. So if there's anything else to add, all right, so I'll adjourn the meeting. Thank you all very much.